डब्ल्यू के द्वारा जो ये आपने डॉक्टर्स डे पर, चिकित्सा दिवस पर इस कार्यक्रम का आयोजन किया है, मैं आप सबको हृदय की गहराई से आप सबके प्रति आभार व्यक्त करता हूँ।
Congratulating the Integrated Health and Wellbeing Council for this unique gesture to honor the doctors and other people in the medical community who are the most dependable resources to fight this pandemic.
7 दिनों में भाग लिया है, तो सभी का मैं धन्यवाद करता हूँ। डॉक्टर डे के अवसर पर दुनिया के सभी डॉक्टर को, भारत के सभी डॉक्टर को मैं शुभकामना देता हूँ, हार्दिक बधाई देता हूँ। जय भीम, जय भारत।
I would really say the doctors have actually risen to this challenge in this unprecedented times, and that is something which is very heartening, not only in our country but at a global level.
Doctors and nurses, they work tirelessly and never deny care. We salute them all and thank to them. They are our heroes and shine like a gem.
मिल जावा गुल बनके मैं खिल जावा, इतनी सी है दिल की आरज़ू।
अल्लाह के बंदे हंस दे, जो भी हो कल फिर आएगा।
Good morning and welcome to the second edition of Gratitude Week, a tribute to our health guardians. I am Kamal Narayan, CEO of the Integrated Health and Wellbeing Council, India's premier institution for health awareness, advocacy, and behavior change. Started on National Doctors Day, today this is the third day of Gratitude Week. This marathon event was conceived by the ISW Council last year to honor doctors, healthcare workers, and other health heroes working day and night to keep us safe and healthy. There are saviors for the COVID-battered world, and we owe our lives to them literally. On the inaugural day of this week-long observance, echoing the emotions and sentiments of 1.36 billion people of India, Honorable Union Minister for Health and Family Welfare, Dr. Harshvardhan, said that history would bear witness to their indomitable spirit and sacrifice for saving this nation and its people. The day too saw top public health experts discussing how to eliminate the evil of violence against doctors from our society. No civilized mind can accept any violence or even disrespect to these medical professionals who prioritize our lives over theirs. So let's have a look at the journey so far of the second edition of Gratitude Week.
History shall bear witness that when the time came and humanity needed to be saved, it was the doctors who stepped up to answer the call of duty.
We actually really mean to celebrate this Doctors' Day with gratitude towards doctors, then I think we got to get together to support a true legislation and a strict legislation of against assault to doctors.
We need to be really serious about and have a rethink about the final delivery system we need to adopt about the delivery of healthcare. Should it be state versus the central?
By communication, having compassion, having empathy, feel the pain of the other person, then put yourself in that position. I always tell my residents, when patient walks into the outpatient, even howsoever overcrowded you are, overburdened you are, but you have no business to misbehave with anybody.
There is a lack of empathy. Probably that is one thing I can agree with that, but there are other issues that many times the doctor is helpless.
We need to talk to actual people in the Center for Disease Control, the virologists, people like you who are on ground. We need to understand and fight this scientifically.
सच मेरे यार है बस वही प्यार है जिसके बदले में कोई तो प्यार दे
खूब लगा लो पहरे रास्ते रब खोले
तू न जाने आस पास है खुदा
Were some of the glimpse of the first two days of Gratitude Week. This includes deliberations, gratitude to a lot of those COVID warriors, healthcare heroes, and also a musical tribute by normal people, the common people, the children from schools who are there to express their feelings about these health warriors who were there for last 15 months, and not only last 15 months, but beyond that, to always save us, protect us. On the third day today, we will be hearing the role of these health guardians in protecting our women and children, the foundation of the society. If pandemics and epidemics come as a war that sees the enemy trying to break our defense, we must ensure that we use every moment of peacetime in fortifying it. And this fortification has to begin with our women and children. A weak, malnourished, and diseased population will not be able to stay in the face of any such onslaught. And that is where we have seen our many health champions working tirelessly to ensure we build a healthy society by ensuring healthy women who deliver and bring up healthy children. Unfortunately, India continues to lag in this aspect. It has made substantial progress with lesser women dying during childbirth, and we lose fewer child before the age of 1 or 5. However, this does not indicate that our women and children are healthy. Over 50% of women continue to be anemic, and almost 1 out of 3 children continues to be overweight, stunted, or wasted. And to change this status quo, we were privileged that several health champions joined us to facilitate a focused movement, Sapath 1000 Days. Their commitment to the cause of women's health is commendable, as despite the ongoing adversity, these crusaders have continued to strengthen their resolve through many interventions. And one such intervention was the launch of India's first women health helpline, managed by nearly 200 specialist OBGYN voluntarily. This helpline, named Janani, is helping women in 4 Indian languages at present. But to make our half of the population healthy, it will require many more such initiatives and a collaborative and focused war against all that ails them, the way we are tackling this pandemic. And to understand how this fight needs to be stepped up and taken to the conclusion, we have today with us some exceptionally passionate women health and public health crusaders with us. So let me welcome these esteemed personalities. Let me welcome first Dr. Chandrakant S. Pandav, who is a former professor and head of the Department of Center for Community Medicine at AIIMS, New Delhi. He is known as the Iodine Man of India for his relentless effort and unwavering commitment towards bringing to light the dire consequences of iodine deficiency on health. Padma Shri Dr. Pandav is a member of National Council on India Nutrition Challenge under Poshan Abhiyan, and he's also a consultant on iodine deficiency disorders to WHO and UNICEF for over 60 countries. Welcome, Dr. Pandav, on this third day of Gratitude Week. We have with us Dr. Meera Agnihotri. She is a senior surgeon and consultant obstetrician gynecologist and founder president of WWW Foundation for Women Empowerment and Health. She is the former head of department for OBGYN at prestigious Ganesh Shankar Vidyarthi Medical College in Kanpur and is the chairman of Ethics and Research State Medical College. An ardent believer in the achieving women empowerment through health, Dr. Agnihotri is also the head of Sapath 1000 Days Collective. We have with us Dr. A. Lakshmaiah, the head of the Division of Public Health Nutrition at the National Institute of Nutrition, ICMR. He is an epidemiologist and has been extensively researching in the area of public health nutrition. Dr. Lakshmaiah.
Good morning, all of you.
Serve as an advisory committee member in health and nutrition for reputed government bodies like the Department of Science and Technology, DST, and Midday Meal Program, and the National Disaster Management Authority, NDMA. Good morning, Dr. Lakshmaiah. Welcome to the show.
Good morning, sir. Good morning.
Yeah. We also have Dr. Hema Divakar, CEO and chairman of the Asian Research and Training Institute for Skill Transfer and ISW Council Advisory Chair for Maternal and Child Health. Dr. Divakar is one of the most ardent advocate of women health. He is working with the vision to improve the healthcare service ecosystem for the welfare of women and children in our country. She is also force behind Sapath 1000 Days and has been improving the country's women health outcomes through large-scale training programs in partnership with several state governments. She is now Foxy Ambassador for FIGO at the International Organization of OBGYNs. And also we have with us Mr. Raghavendra Prasad, who is a founder of Project Step One, a not-for-profit volunteer organization helping India fight COVID by providing free telemedicine across to COVID-affected citizens in India. Raghavendra's primary interests are technologies and business models which can help rural India better integrate with the rest of the India and global economy. And his brainchild, Step One, has become almost world's most extensive COVID home care management system with over 30,000 calls every day by 7,000 volunteers, doctors. Step One is also providing the technical backbone for our Janani Women Health Helpline, initiated as part of Sapath 1000 days. So welcome all of our esteemed guests today. And as I said, that this program is about showing the gratitude for these health warriors who have been not only during this 15 months of pandemic, but forever. Like, for example, Dr. Pandav, all his life, Dr. Pandav has been fighting against all that which is ailing at a large scale in our society, and iodine deficiency is one of that. So let me first invite Dr. Chandrakant S. Pandav. Dr. Pandav, you have eliminated one of the important aspect which might have impacted a very, very large chunk of our population, which is IDD, iodine deficiency disorders, which might have resulted in a lot of other problems, mental retardedness and many other. This first thing I would like to express a very deep gratitude of all health champions and advocates and health enthusiasts like me. I'm not an expert, but I just love health. So and you have contributed, I think, something which is beyond the words. How do you feel that having achieved that, and and when you see that we have many other problems also, like anemia is one of that, and I see that you are equally passionate about that as well. How do you see that the model which you achieved, or the outcomes which you achieved in terms of eliminating IDD, can they be effectively implemented for something like anemia, which is also really widespread in our country? Dr. Pandav.
Shukriya, Shukrana, Dhanyawad. Thank you so much for those warm words of appreciation. Actually, life is a journey. I only completed one pillar. I've got a long way to go. But I believe the glass is always half full. I'm not only interested in iodine deficiency disorders or anemia, but I'm interested in health in totality. The World Health Organization has defined in 1948 health as a state of physical, mental, and social well-being, and not merely absence of disease or infirmity. Very recently, they have also added spiritual dimension to health. So it's physical, mental, social, and spiritual. But I want to go beyond that. There are 8 dimensions of health. Eight dimensions of health: physical, mental, social, intellectual, emotional, environmental, occupational, and economic. So I want to go beyond the traditional definition of the World Health Organization. India should change its definition of health to holistic health. That's my first strong recommendation, holistic health. Number 2, I'm very proud of India's culture. Very proud of India's culture. Mera Desh Mahan hai. Ayurveda is science of health. Ayurveda is science of health. What I studied at the All India Institute of Medical Science was science of disease. So I want to promote Ayurveda and all the complementary Ayush ministries portfolios as well. Number 2 recommendation, strong recommendation. Number 3, well beginning is half done. I think there should be not Doctors Week, not from 1st to 7th July. There should be Doctors Seconds, because the seconds can make a difference to your life and death. But this is a good beginning, but we should observe Doctors hours, minutes, but Doctors seconds. That's my 3rd strong recommendation. Having said that, before I start, I would like to share with you a small, beautiful song which I listen to it every day in the morning. Itni Shakti De Bhagwan Hame, Itni Shakti De Bhagwan. Over to
Dr. Pandav for playing this song. And I think this song sums up all the emotions which millions of doctors and health workers, while struggling for last 15 months, they forgot when to sleep, when to eat, and they would have been having the same thought in mind that itni sakti hame dena data, कि ये जो काम उन्होंने वो कर रहे हैं वो उसके लिए उनका मन का विश्वास ना कम हो, क्योंकि आई थिंक देयर वर इनफ एनवायरमेंटल चैलेंजेस जो आपको उस रास्ते से अगर भटका नहीं सकते तो डिमोरलाइज कर सकते थे. लेकिन आई एम श्योर एंड थैंक यू सो मच फॉर प्लेइंग दिस सॉन्ग.
शुक्रिया. In fact, I'm the chairperson of the Indian Musical Therapy Association. There's an association called IMTA. I'm the chairperson for the hospital side, Indian Musical Therapy Association. When medicine fails, music heals. Music heals. And I'm a strong believer of that. Strong believer. And I've experienced that myself as well. I'll share my experience at a later stage some other time. Very powerful. Very powerful, the role of music in healing, very powerful. Before I talk about my esteemed colleagues, we got a fascinating panel for the entire week, so I must congratulate the organizers. Very well thought of the program, extremely well thought. आपको जितना धन्यवाद दो उतना कम होगा. बहुत अच्छा, बहुत बढ़िया आपने इसका आयोजन किया है, बहुत बढ़िया. लेकिन मैं एक चीज करना चाहता हूँ मेरे दोस्तों के लिए, मेरे जो डॉक्टर लोग हैं उनसे मैं एक चीज कर. We must learn the art of listening. We must learn the art of listening. What I find is my esteemed colleagues do not have the time to listen. When you start listening, 90% of diagnosis is made based on history, 90%. 5% on clinical examination, 3% on laboratory tests, routine, and only 2% on BT, CT, TT, RT. Only 2%. तो मेरे दोस्तों से मैं अपील करना चाहता हूँ, please learn the art of listening. Having said that, have 3 attributes: sympathy, empathy, and compassion. Sympathy, you express it. Empathy, you experience it. And compassion is ecstasy, where you hit at the root cause of pain and suffering. आधार, अनुभव और अनुभूति, ये 3 कैरेक्टरिस्टिक, एक त्रिशूल है जो त्रिशूल हर किसी में होना चाहिए. आधार, सिंपैथी, अनुभव, एक्सपीरियंस, ecstasy, अनुभूति, where you strike at the root cause of pain and suffering. तो मेरे दोस्तों ये 3 चीजें सीखिए. सो आप मेरे भाई बहनों के लिए 2 संदेश है. Listen, develop the art of listening, and develop the 3 dimensions of understanding what the situation is. After having said that, I want to express my own gratitude to my fellow physicians, surgeons, ward boys, nurses, pharmacists, the entire workforce, security guard, the drivers, the entire paraphernalia that have gave their own life. There is their life taking care of corona patients. I remember a poem in my childhood, Into the Valley of Death wrote the 600. They were aware about the consequences of getting involved in care of corona, but still they did it. So my gratitude to 740 doctors who lost their life last year and about 756 who lost their life this year. So gratitude to my fellow physicians, and most important to their families, to their children, to their parents. And sir, we have a responsibility. Moral responsibility to take care of their families. Moral. So we must start some kind of funds to handle this particular situation. I think this should be a most tangible outcome of this particular yatra. ये जो धन्यवाद की यात्रा है, मेरे ख्याल से मेरी तरफ से सबसे पावरफुल है. उनको परिवार की देखभाल करना हमारा फर्ज है. It is our duty. After saying that, I want to share that feeling gratitude and not expressing it is like wrapping a present and not giving it. I repeat, feeling gratitude and not expressing it is like wrapping a present or not giving it. Gratitude is the healthiest of all human emotions. The more you recognize and express gratitude for the things you have, the more things you'll have to express gratitude for. The Sustainable Development Goals are the blueprints to achieve better and more sustainable future for all. I would say for human beings, animals, plants, and even inanimate things like your mobile. And my Hindu scriptures, when you do Purusha Suktam, there is a verse which says that we must pray for the welfare of human beings, welfare of the animals, welfare of the plants, and also welfare of the inanimate objects. So मेरा हिंदू सनातन धर्म बहुत powerful है, and I'm very, very proud of my ancient cultural heritage. Very proud, very proud.
Thank you so much, Dr. Pando.
Very proud.
Highlight these, holistic aspects of our, traditions, of our way of looking at health or human life, or not only human life, the life on this planet. And I think, what you said, that these sustainable development goals were always part of our own culture. I think we have been trying to nurture more and achieve more than that. The whole, kind of optimum possibilities of every life, not only human life itself. So I will come back to you, Dr. Pando.
One glass.
Okay, sir.
Give me 2 minutes. वैसे 2 मिनट में मैगी भी नहीं बन सकती, मुझे 2 मिनट दीजिएगा.
जी नहीं सर, बिल्कुल.
मैगी के लिए 8 मिनट लगते हैं. मैंने that's the only thing I can make. सर्वे संतु भवन्ति, सर्वे सुखिनः निरामया. May all be happy. May all be free from illness. May all see that which is good and auspicious. May no one be sad or distressed. I repeat, may no one be sad or distressed. May there be eternal peace. Om Shanti Shanti. Just 2 more lines about iodine. The world's single most important cause of brain development, brain damage, is iodine deficiency. And it is totally prevented. Goiter is only a tip of the iceberg. The real damage is due to stillbirth, abortion, congenital malformation. On an average, who stay in iodine deficit, they lose 13 IQ points less as compared to others, 13 IQ points. So I would end by here. I'm ready to make a guest appearance as and when you want me to. Shukriya, Dhanyavad, Namaste, Namaskar, Namaskaram.
Thank you so much, Dr. Pando. Wonderful beginning. Means I think one of the most, kind of uplifting day of Gratitude Week, when I hear so much of, and you have brought all those important, points. And let me now go to Dr. Meera Agnihotri. Dr. Agnihotri, Dr. Pando talked about 8, sides of health. What 8 type of healths we need to achieve.
8 dimensions.
Dimensions of health we need to achieve, and which is an extension of what WHO identifies. But I know that you have been implementing, or kind of having the similar thought for women health, and you have 10 commandments of achieving that women health and empowerment. What are those 10 commandments, and how do they marry with this 8 dimension of health? Because almost all of them are trying to provide the same kind of support, or same kind of environment for women empowerment as well.
At the outset, I extend my heartfelt gratitude to be a part of this academic meet. I've gone through what Dr. Pandava has said. It's very inspiring, and I do agree with him. Whenever we treat our patients, we keep on telling, we treat, he cures. It's not we who are treating. We cure only, we treat only. He cures. And the 3 components of the treatment result are Dawa, Daya, and at the end is Dua. So these 3 things conglomerate and our results come. We must have seen in these COVID periods what happened, that some of the patients who were very strong to come out, and we were thinking that they will come out soon, they died within minutes. And some whom we were thinking that they have got comorbidities and this and that, they came out smiling. So definitely there is a role of Dawa, Daya, and Dua. Dr. Pandey, another important thing which I want to tell, being very passionate during this COVID period, I'm a part of Shapath 1000 and I keep on propagating it in whatsoever sphere I can, whatsoever meeting it is, whether it is academic, non-academic, in the clubs or somewhere. Our Shapath must go on. It's unfortunate that during this Shapath 1000, this COVID eclipse has really caught eclipse to our minds. We were standing at the terminal end of a blind tunnel. We didn't know what we are coming out, whether we will be able to successful or not. A time when we never knew about the vaccine. A time when we didn't know the treatment properly. Every day guidelines were changing, but our treatment continued and we stood strongly facing this situation. One important thing I just wanted to mention, when this vaccine came, it all came to me that we should consider the pregnant women and lactating women who were not covered. And even in the first instance, these guidelines came and they said vaccine is contraindicated for pregnancy and lactating mother. And this thought kept on haunting in our mind that why? Because no work has been done as yet. The vaccine was also in the trial phase. Under these circumstances, we cannot strongly tell that the pregnancy and lactation is contraindicated for that. We are proud that our parent institution, FOXI, has made a FOXI statement which came in existence. Unfortunately, but we were not successful in getting our this desire fulfilled. You see, HEMA is also a part of it. I want to tell you in a nutshell. But we never lost hopes. We kept on fighting. Ministry, ICMR and others, we just kept on trying whatever we could do. But we were unsuccessful, not because of anybody's negligence, not because of any intentions from the government, but of course they were not having sufficient data to confirm that it should be given to the lactating and the pregnant women. Then a day came, it was 7th of May when all the efforts failed, and we have received a letter from the Government of India that no, it cannot be given to the lactating and the pregnant women. We have made a wonderful appeal thereafter by JCG, Joint Collaborative Group, to approach Government of India. And you know that we have taken all the different communities to part in, all the different organizations to join with it. And this application with a motive that preventing the preventable mortality and morbidity of pregnant and lactating women who could be benefited and not be benefited if the vaccine is not given. We know that we may have a loss like loss of death, but at least we can have a chance, suppose it is 5% only, by giving vaccine, preventing 2 lives, it is worth it. So you have to decide between Khai and Khandak. So we thought that it is better to have something than not having anything. And we approached to not only the Ministry of Health and Government of India, our application went to, not an application, it was a white paper made by 13 organizations. And this was sent to Prime Minister of India, Chief Minister of Uttar Pradesh, Indian Council of Medical Research, National Medical Commission, IMA, and so many other organizations which were involved in taking a technical decision to pass it on. So 7th we were failed, and on 13th we could succeed in getting an answer from the Government of India because our application contained all positive things which could conclude that it should be given. And in the first instance, on 13th, we have received a letter telling that it can be given to the lactating women. It was half done. Our journey was not complete as yet. So we kept on approaching, talking, all the technical persons, Government of India, Ministry of Health, ICMR, and we have also presented one of the paper which was written by the CEFOG organization. So that is how we could approach, and we are happy today that we have received an order from the government that it can be given to the pregnant mothers also. So women are protected for pregnancy as well as during lactation. And in pregnancy, mind it, in all the 3 trimesters, it can be given. In lactation, it can be given all through. And that was our ladai and success. We could succeed in our mission. HEMA is a part of it. We kept on fighting till we got it. It is in the vested interest of mother and the child for a dual protection. And it is one of the part of the Shapath 1000.
Thank you so much, Dr. Meera Agnihotri. Wonderful work actually you have done in this couple of months, because that was a big challenge, I think, and you facilitated, you pursued the government to take this decision, which was much delayed for that matter, but very, very critical, as you have already said, that the first important thing that here the 2 lives are at stake, and very important to make sure that all women who do not have a complication maybe which is kind of not right for vaccination must get vaccinated. So thank you so much, Dr. Agnihotri, for doing this wonderful work and then making this happen. Dr. Hema, since is also moderating the next session, I will request Dr. Hema after Dr. Lakshmaya to come on this talk. But let me just invite Dr. Lakshmaya. Dr. Lakshmaya, Dr. Pandav talked about the holistic aspects of health. A small change in this maybe let's say salt fortification with iodine made such a wonderful impact in our society. We have so many other problems going on, and many of them have the root cause, which is the nutritional problem. Many of them have the root, that whether it is undernutrition or malnutrition. But nutrition is, I think, one of the major cause of the whole rut of the burden of diseases we have, or susceptibility to many of these infectious diseases, as well as a lot of chronic burden we carry forward. How do you see this pandemic, bringing some opportunity or challenges which can be converted into opportunity? How we can achieve something which can maybe, post this pandemic? And as I said, that it is important to have a strong body to fight any disease, including pandemic or, COVID-19. There may be many COVID-19, maybe 21, 22, 23. We don't know. We are in the dark alley. How we fortify our population, our bodies, so that we kind of have a better resilience.
Thank you, Dr. Kamal. So let me, before I start discussion, let me congratulate for a wonderful organizing the wonderful sessions continuously 3 days, and it is worthy meetings, and it is essential also to pay our gratitude for our warriors, and because not only as a nutrition expert, basically I'm a public health expert, and during this pandemic period last year from 23rd March onwards, we were there because several people are working from home, but we never taken even 1 day from working from home. All the days we worked, because as a medical team, we worked every day, and all the risks and everything we have taken up. And I'm also one of the this depot manager. I'm working as a depot manager for distributing RT-PCR and other kits for testing. And as well as I'm also working as a nodal officer for zero surveillance. You might be know zero surveillance because we have conducted in 21 states and 70 districts throughout India to just assess what is the prevalence of this infection in the community, and what is the community spread, and as well as who are the susceptible population, how much susceptible population still in the community, and what is the public health measures to be taken. So this is also part of ICMR, Indian Council of Medical Research. So I am heading here as a nodal officer in the Telangana state, and we have completed the zero survey even during lockdown and 4th rounds. Now recently we have done 4 rounds. So one is on May, and then 2020 August, December, and now even last month, June also we have completed. So after second wave, what is the still susceptible population? Before vaccination as well as natural infection spread. So now still how much population is there still susceptible for if third wave comes. So that is the agenda we are working. And as well as nutrition concern, and you are all aware of that because the Lancet global publication recently said that on Lancet Commission on Diets. So the risk factor, almost 65% is the risk factor for all diseases is the unhealthy diet or imbalanced diet. So that is the main thing, and we have seen also in the during the pandemic those people nutrition status is good, and nutrition and immunity. We are hearing nutrition and immunity and immune boosters. Several of vitamins, minerals, immune boosters. If anyone is sufficient and balanced with these nutrients, and the natural protection is there, and that's why even if you admit in the hospital also, whatever the symptomatic treatment is being given, and ultimately what is protecting is your good nutrition only and your own immunity only. So that's why we have also developed a balanced diet charts, and we have distributed everywhere, and the website also there, and COVID and nutrition and immunity. So this awareness program also we have conducted, and several in domains and several associations also we spoke about what is the how nutrition is protecting, and what is the importance of balanced diet and healthy diet. So these concepts we have also developed several videos, and videos also available in the website, and so many even YouTube also available, and this what we are doing currently. So really it is very important, and especially vitamin A, vitamin C, vitamin D, zinc, and iron and selenium. These are the main important nutrients. Those are contributing for immune development, and then ultimately protecting the any infection, not only in a virus only COVID, any viral infection, any even bacterial infection, and even it was preventing, and it is also preventing future also, any even third wave or fourth wave, whatever wave also, your nutrition only will protect majorly, and the doctor role comes next. So that is my important issue, and our I last 2 times also I spoke about what is the gap in our diet. So I am also heading the National Nutrition Monitoring Bureau. The objective of National Nutrition Monitoring Bureau is to assess the diet and nutrition status of, and mapping of diet and nutrition status different segment of population. To our surprise, the micronutrient deficiency is very high in all age groups, not only in children, pregnant, lactating, even men also. So the gap is very high. The deficiency levels are very high. We are all facing triple burden of disease, as you said, non-communicable diseases, and some section of people still suffering from undernutrition, and all the people, even rich and poor, and everybody is suffering from micronutrient deficiencies. So this we have to cut down these deficiencies, and almost 54% of whatever morbidities are there, we can also resolve these morbidities just by taking healthy diet. That is my take-home message is everyone should have effort to take healthy diet, and government also should support for this. Thank you.
And thank you so much, Dr. Lakshmaya. Very important message, and you have highlighted that almost majority of our population, rich or poor, are suffering from the same kind of issue, either it is undernutrition of micronutrients, or even sometimes malnutrition. Dr. Hema Divakar, Dr. Chandra, and I'm trying to, structure the conversation around what Dr. Chandrakant has, Pandav has, set the tone about. So holistic health is something which he's saying that we should look at as a holistic health, and we at ISW Council also try to propagate the whole agenda of holistic health, which is not only, going to only the physical, the being of yourself, the body, your body, but the environmental issues, the food, the water, air, everything matters for that, for your health. How do we actually apply this concept of holistic health for women? Do we really apply any holistic health concept for women, or it is primarily, a health support at the time of childbirth, largely? Do we have this similar holistic health, or if we don't have, how can we get, when we have all the inclination? Dr. Chandrakant, is emphasizing on it. Dr. Lakshmaya is talking about it, that the nutrients is making the 60% of the disease burden. So do we have a way forward for that, and how we achieve it?
Namaskar. Thank you yet again, Kamalji, and for the initiative of Shapath. All of us have resolved that we take the Shapath that we will be positive with the COVID positive patients, because as doctors, you've heard over the last 2 days how helpless we feel many a times, where the gap is between knowing and doing, that, by the sheer overwhelming pandemic situation that we have, we can't do our best. In the middle of this, little things that you do matters. For example, you mentioned Dr. Panda. He kept on, when you were introducing the panelists, you're just encouraging us to do this, and then he also said, "Humko man mein shakti dena." So when we say, holistic, it also means the resolve that every human being, every individual takes, and has the strength to endure, because you have extended the doctor's day from 1 day to a week, and Dr. Panda says it should go on forever and forever and every second. All of us are now in touch with the ground reality. It is not that COVID starts today and ends on a specific day. It's not a full stop. It is a continuum, and we have to better learn to live with it. Okay? So what is the kind of holistic care that we give to our women and children? When we say treatment, it's not just the technical treatment or medical advice. The word treat, according to me, when you go to a sari shop, for example, or your restaurant, how are you being treated there? What is the kind of a rapport that the person over there in a restaurant or a sari shop strikes with you? And that is what is more important. As Dr. Pandav said, that it's the history and the dialogue and the communication and the compassion that we show, which goes a long way. And incidentally, he mentioned about IMTA, that is Indian Music Therapy Association. About 20 years back, I was a member of the AMTA, American Music Therapy Association, and I was refused a visa to go to the US because they thought that when I was invited there as a faculty, I'm just using it as a devious route to relocate myself into the US. That was it. So we brought such holistic therapies around, and I would battle for the maternity care. When you said everything about childbirth, that is a matter of human right, because a woman who is becoming pregnant and procreating the human race, it is not a disease process. She is fulfilling her biological responsibility with all the due risks. So whether in public or in private setting, like right to education, she needs it as a basic human right to be fulfilling her role pre-pregnancy, during pregnancy, and beyond pregnancy in this entire journey in a holistic way, with all the prongs that Meeraji has mentioned, with every pillar that Dr. Pandav has said. Yes, it has started with iodine. He has left a legacy behind in his successor, Dr. Kapil Yadav, who heads now the Preventive and Social Medicine Department of AIIMS, who is battling for Anemia Mukta Bharat, which is also a part of Shapath initiative. Having said this, public facilities, you have to strengthen the supply side, and therefore organizations like Artists for capacity building, Private patients expect the moon, even though they have everything. It's like the demands are huge. So we have to balance this somehow or the other and put our best efforts, because every little thing counts. Just as how we say every mother and child counts. And I would end by saying women's health is nation's wealth. And I'm thankful to Raghavendra and Step One, who have made us take that step one by reaching out through Janani. And this is just the beginning of the 1,000-day-long journey. So we wish the best of luck for ourselves. And I will stop here because, as you said, the next panel, I will have a chance to deliberate and reflect on what we can do. Thank you.
Thank you so much, Dr. Hema. Wonderful thoughts. And yes, the Sapath which we all have taken, not only ISW Council or Artist for Her or Step One or many other organizations, but this should be the resolve for every individual to stay healthy, to look for their holistic health, their families' holistic health, their women's holistic health, because that is where they are going to make the whole society, having the health in a real, truest, holistic manner. Raghavendra, I'm coming to you at the end and with the lesser time, but at the same time, I know that your work which you have done cannot be, summarized also in, these 4-5 minutes, but let's try that. And let me just first, put my perspective on it. See, normally what happens whenever there are the challenges of this sort, where, like, for example, what Dr. Chandrakant Pandav has done, a small intervention, but made a massive, outcome impact. And this was not a small intervention at all, because I think I was, when I was hearing Dr. Chandrakanta earlier also, he did a whole, it was a whole fight to make this a policy decision, which can be implemented at a level of which we have saw in the salt, fortification. Or for that matter, what Dr. Hema is doing, or Dr. Meera is doing, everyone is trying to put together their effort. And you started with something when COVID struck. Nobody knew much about it, and suddenly you started with Step One, if figuratively also I think as a Step One, and you brought together 7,000 doctors who are now handling 30,000 calls per day. How did you do this whole, this is massive intervention of many states, people who are, kind of languishing with the COVID-19 at their home. They have only one support, which is one Step One doctor from somewhere calls them up and kind of comforts them, have a dialogue with them, try to find out their problems and allay their fears. A small step converted into a big thing. How did you do that, Raghavendra? And thank you so much what you have done.
Well, actually, thanks Kamalji for having me today, and thanks for this gratitude week. I think it's a fantastic idea, and also it's my privilege to be amongst this esteemed panel with Dr. Pandav, Dr. Meera, Dr. Hema, and Dr. Lakshmaya. It's definitely my privilege and pleasure. And I would only say that. I was someone who probably had initiated the idea, but Step One is certainly not entirely my creation. I think it is a creation of kindness of humanity, I would say, because as you know, thousands of people have come together, and specifically doctors. Right now, it is roughly about 12,000 doctors who are currently providing free telemedicine support to COVID patients. During the second wave, we were at peak handling 65,000 calls per day, and I think it's a huge achievement. But it is all due to the kindness of the doctors and also kindness of general volunteers. I think we are all very lucky to have been part of a generation which is seeing science develop so much. I think Dr. Pandav, with his scientific ability and insights, was able to able to create so many, an impact on so many millions of people. Dr. Meera continues to do that in her own way. Dr. Hema has always been at the forefront of so many initiatives, including yourself, Kamalji. You were the one who instigated this women's helpline. So similarly, I think all of us are fortunate that we are able to reach every person in a direct manner through this mobile phone. I think there are a lot of disadvantages of the mobile phone, but I think for health, it will be a huge revolution, specifically for women's health. As I told you, we are an aspiring superpower. We are a nation of young people and very extremely ambitious people. And for us to become a nation which will stand up to our historical ideals and achievements, we have to have an extremely strong, healthy and empowered woman in our society. I think women's health is nation's wealth, as Dr. Hema so nicely summarized it. It is definitely true, and we have a long way to go in making that happen. I think we still are not a society where women are largely empowered, right? There is still large inequality in our society, and in spite of that, women today are still the leaders of family healthcare in the country, right? They take full responsibility for healthcare of the entire family, and if we are able to address the health of women, then we will indirectly be taking care of the health of the entire nation. So women's health, I feel, is extremely important, and given step one has been able to achieve these large numbers for COVID. We with the efforts of with the efforts of IHW Council, Teamworks, Artist for Her, so many technology professionals who are working, and I'm sure we'll be able to reach millions and millions of women through the Janani helpline. I would like to see a day where we are struggling to handle calls, because there are so many calls coming and so many people who are dependent on this, and we are scrambling for more people, because I feel it is going to happen, and I really hope we will not only grow as a nation economically, but also be a healthy nation where women are at the forefront of every achievement of our country. I really hope we'll see that day.
Thank you so much, Raghavendra, and wonderful work which you have done. And actually, and sorry to my all panelists, actually, all of you are so accomplished that I can take 2 hours with each one of you, and still the whole thing will not be able to wrap up, because I too have a lot of questions. I want to understand more about how Dr. Chandrakant Pandav traveled this whole journey, and then that journey gives the kind of way forward for many other journeys which we can go on. Dr. Lakshmaiah can give wonderful insight, and I really want to take up one specific session about this whole immunity booster thing and how much we can actually boost our immunity, and that is also a whole topic. Dr. Hema, Dr. Meera, and Raghavendra, the way you feel that technology can change the health of our country, and actually try to do that. And I think you might have saved many lives which are uncounted through this step one process. This is completely a technology outcome. So, but I don't want to eat into much of the time of Dr. Hema Divakar of the next session. So I keep those thoughts with me, and will try to reconnect with some kind of, another, opportunity to talk to you people more. But thank you so much for your work, for your contribution to the society. We express our really heartfelt, gratitude from all the, health champions, health enthusiasts, and the people. As Dr. Chandrakant said, that all of the gratitude is the healthiest of the emotion, and all of them feel for that for our doctors today. And we, I would request all of you to stay connected for 1 or 2 more minutes, because we are going to play an, gratitude anthem which we have especially got created, and we feel that summarizes the emotion this nation of 1.36 billion people have today for their health workers, their health guardians. Thank you so much for joining. May I request my team to play that video?
Thank you.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
Thank you so much, everyone. And the floor is all yours, Dr. Hema.
Thank you. Namaste. And thanks on my behalf also to the very distinguished panelists that we had for the whole of last 60 minutes. Thank you very much. Now I can already see that the next set of very accomplished, distinguished heroes in the real sense have already joined us. So permit me a minute to share the slides to briefly introduce them to our large audience who would be a witness to this panel, which says no one is safe until everyone is safe. And Dr. Pandav just mentioned the holistic approach, and he played a Hindi song as well, as how in the keeping with Dr. Kamalji's song also, that Sarve Janaha Sukhino Bhavantu. That's the adage which comes to our minds when we say that everybody needs a holistic care for us to move ahead as a healthy nation. So I'm very proud and privileged to have with us today Shri K. Jairaj, who is the retired IAS officer, former additional chief secretary to the government of Karnataka, the trustee of PMS Educational Institution, School of Architecture, School of Law, and a trustee at the Sri Krishna Sevashrama Hospital. Very diverse background, and I label him as a man who can make things happen. So that is Shri Jairaj for you. Dr. Harshad Sangvi, all the way from the US, Baltimore. He's a senior advisor to JPIGO, Johns Hopkins University. He's recently retired as the vice president and the chief medical officer of JPIGO, which is an affiliate of Johns Hopkins Public Health Wing. 2 decades of assisting 45 countries in evidence-based practice. He's received the Global Health Council's Best Practices Award in the year 2009. Dr. Uday Khanawala, as we speak today, he is just taking over as the chairman of the ICOG, Indian College of Obstetrics and Gynecology, which is the academic wing of FOGSI, our parent organization with 40,000 gynecologists on roll. He has also been the vice president of our association before, and he's the treasurer of the PCO Society as well. My very beloved friend, associate, and our key leader, Angela Chowdhury, who is the director and member of the governing body at Swasthi Health Catalyst, brings with her an experience of 15 years of strengthening the health systems, establishing monitoring and evaluation systems, building the country-level capacities to address the global health challenges right across South Asia, Southeast Asia, and Africa. She is a board member of the Partnership for Maternal, Newborn, and Child Health, which we call as PMNCH. Angela is a master in public health from the Boston University. Last but not the least, our very own, very beloved Dr. Ekta Bajaj, who is a consultant at the Ujala Cygnus Hospital, a gynecologist and an IVF specialist, provides a wide range of services in the field of OBGYN and is one of our lead in the Janani helpline, which Raghavendra and team have put up for us as the technology partners in the step 1. And she is, of course, an integrated Shapath initiative. So Bengaluru, the way to go. The Sri Jairaj, Angela, and Raghavendra incidentally happen to be from my own city, which we call Namma Bengaluru. And namaskar and welcome to all of you on this panel entitled No One is Safe Until Everyone is Safe. My first question to our esteemed guest, Sri Jairaj, who has been our friend, philosopher, mentor, guide, etc. I said, you are the man who can make things happen. And it's a cliched adage, where there is a will, there is a way. But when we partner with the governments, and Angela would stand a proof to this, where there is a political will, there is a way, perhaps. So what is this all about, political will, and how does it influence the implementation initiatives which each of us in our own capacities dream big and are passionate about doing? Jairaj.
Thank you very much, Hema. It's a pleasure to be here on this forum with you and also such other distinguished panelists. In fact, I feel a little out of sorts because they are all very distinguished physicians, whereas I am from the public domain world. But the fact that you are the moderator gives me the courage. Now, first, I think it's a great idea to have this gratitude week for doctors and congratulate the IHW Council for organizing this. Because, looking at what has happened in India for the past 18 months, Hema, we must express our gratitude to all frontline medical personnel for what they have gone through and the risks they have taken, especially, if I may say so, the women health professionals, the doctors, the nurses, the para staff, because they have really put everything above their own lives and they have provided the kind of succor that has been made available despite this very hard and trying times. So therefore, I would like to join you and I'd like to join the organizers in also expressing my profound gratitude and thanks to all the doctors and others who have made this fight against COVID possible.
Thank you.
So Hema, you asked the question about political will. And, I'm sure our distinguished panel is well aware of what political will is. But let me draw a few examples from history to illustrate quickly what political will is. I'd like to first talk about what Winston Churchill did in 1942 England. That is, to me, the real example of political will. Because, see, the country was at the dumps and Hitler was very menacing. It was rumored that, England would be undertaken by an invasion at any time. And despite all that, Churchill was able to turn things around by the political will that he displayed and by the collective that he was able to forge. So in the context of Churchill, what is that political will? It is first focus, then it is inspiring people, inspiring those who work with you. It is showing the leadership required. It is communicating with people. And most important of all, political will depends upon good execution. Because you can't have will in the abstract. It has to lead to something. We can compare and contrast this, for instance, and I'll be very brief because there are other speakers also, with the kind of political will that the Communist Party of China has shown. You mentioned about political. In 100 years, China, the Communist Party celebrated its centenary just 2 days ago. And in 100 years, China has become a developed country, overcoming its poverty, overcoming all its backwardness. Of course, it's another question about democracy and so on. We can talk about it at length. But now coming closer to our own context, I think the political will shown by the government in the first phase of COVID is something worthwhile, because they were able to, withstand it. But somehow during the second wave, that was a bit wanting, and therefore we've had all the problems that we've encountered. So to respond to you, this issue of political will is critical for any action on the part of the state, and it is an immensely short supply as we look around us today. Thank you.
Yeah, so just a follow-up question to that. You have been in various capacities making things happen, as I've said, and you had to all the time deal with the government and make them be willing to execute some of the initiatives, whether it is in the power sector, whether it is the Bangalore development, or whether it is transport, or whether it is the property tax. And I know of very many accomplishments, which is a big plus in your career. How did you make this happen? Because according to me, knowing and willing and actually doing and making a successful venture to be impactful, that to my mind is what really matters and moves the needle forward. So what is the recipe in your approach?
So first thing that may be of relevance, and which all my distinguished panelists will agree, is that if you want to bring about change, like you for instance, you must be a non-conformist. You must want to buck the status quo wherever you are. And in all these things that you described, change was possible only because some of us felt that we had to change things. We had to defy the stereotype. And that defying the stereotype will not do, because you also need to have a proper plan, a design on what you want to do. I'm sure it applies to all of us here. And once you have that plan and design, you must also have the resources for it, because without resources, you can't execute anything. And finally, when you have the resources, you have the plan of action, you have the design, you must also have a review mechanism by which, you can correct the faults, you can make sure that whatever you want is being done. And finally, the key is that people, whoever is a constituency you are working with, your stakeholders, they must also acknowledge that whatever has been done is to their interest. It's only when it works to the interest of all that you can say that any change is worthwhile. Otherwise, it becomes a flash in the pan. So these are some of the things that are required in order to execute things well. And they apply not only to the public domain, they apply to you as you are going about your task. They apply to all the other panelists. And clearly, it's a required thing today to have a very good execution ethic, or what is called in management as the discipline of execution. That's very critical today.
Yeah. So thank you, Jairaj. The message is loud and clear that plan your work and work your plan. And that would make a difference. I swing to Angela now, because COVID collab. Okay, so it's a collaborative effort, and it's like too many cooks spoil the broth. That's another thing which flashes in my mind, because when way too many people are involved, it's sometimes difficult to collaborate in that sense and get everybody to agree on an action plan and actually execute it. So what has been some of your positive experiences and some of the challenges, Angela, in the COVID collab that you lead, and you've been so kind to support our parent organization, Foxy, and of course, artists as well. So, Angela, over to you.
Thanks, Dr. Hema, for first of all introducing me to this council. I had not heard of it till I received an email from you, and I'm so privileged to know more about it, because, as you know, I left my own clinical practice, oral surgery, of course, and moved into public health because I strongly believe in integrated health and well-being. And to see a council that is made around that agenda, very rare, and very privileged, and I'm hungry to know more about what the council is doing and who's on it. And hi to Mr. Jairaj. 15 years ago, you actually launched the World Bank development report 2006. I think it was at the Hotel Capitol where I had written a chapter there. So you and I have met about 15 plus years ago. So it's great to see you again.
You look very familiar.
Yes, I was a lot thinner with longer hair, so I think that was part of that. But coming to the issue of collab, as you probably already have experienced, collaboration doesn't come that easily, and hadn't come easily till COVID landed on our doorstep. There has been collaborations, of course, it's not the first time. But this has been a collaboration of very unusual partners. And when COVID came at our doors, in fact, when COVID was on other shores, we already knew that this was something that was going to impact every single person here. And how could we actually address it in a very holistic manner, which is very the whole integrated health and well-being. And while the COVID Action Collab, the mission there is really looking at integrated health and well-being for the most vulnerable populations. We had to ensure that there was a diverse set of actors that collaborated. People with similar vision, similar value, different missions, different competencies and capacities. And then no one was stepping on each other's toes, one. Two, the problem is so deep and so wide that everybody has a role to play in it. So there's not really competition. Actually, you have to collaborate to get something done. Otherwise, it wasn't really possible. So I just wanted to give a few examples, because you were saying collaboration, what are some, what does the collab actually do? So the collaborative has right now about 320 partners and growing. And it basically brings together experts and organizations across the field, from design, communication, public health, medicine, technology, policy, you name it, it's all there. And the idea is to, collaborate to understand the demands, the challenges, and layer everything on so that the vulnerable populations have health and well-being. It's not just relief, but it's response, relief, rehab, and development. Because there are long-lasting, impacts of COVID as we have. And really,
just one little question, Angela. Sorry to interrupt you. When you said long-lasting impact, COVID also seems now has come here to stay. It is also going to be long-lasting. Yeah. So also, give your inputs on how this collaborative is going to also sustain and keep lasting forever and forever. Because this is something which we may probably need for more than a decade at least. Yeah.
So the collab took a very decisive call to supporting and focusing on building institutional strengths. It was not about programs. It was not about relief. Relief had to be given because it had to be given. You have to save lives first. But most importantly, we focus on strengthening institutional capacity. When there are grassroots organizations working in livelihoods, we work to strengthen them with health interventions. Basically, all organizations have to have a layer of health. And if there are layers of, and there are also examples of, for example, Sneha is a very well-known organization working with urban poor in Mumbai, and they do a lot of health work. What we help layer is social protection. So the collab has people who are strong in livelihoods, financial inclusion, social protection, and health. And for us to actually look at the needs and layers so that more and more organizations have institutional strength for holistic programming. Similarly, we are working with frontline workers, but it's not like, it's very easy to go and reach out to frontline workers and do programs with them. But that is not going to be sustainable. The sustainable way is working through clusters like associations, training institutes, even employment and contracting agencies. And when they have the capacity, or they strengthen their existing capacity or add to their mandate, life skills, gender dynamics and equity, rights, etc., and they can layer it on their existing program. So it's not like we want to change the mandate of anyone, but whatever you're doing, if you're able to add some layers, you have modules ready, you have sort of some technical support that you require, then we see that it is sustaining even beyond COVID. So that's sort of an example of how we're layering on to what partners already have, not changing anybody's mandate, but just adding a little bit that somebody else has to the existing agenda of associations.
Yeah, so when you say 350 different collaborative organizations, that in itself is a huge challenge to connect the dots. And what's the one thing that you have found in your action point which you think should definitely be a mandatory part for a long, long time?
I guess it would be about very active listening and feeling. When you understand what the other partner is doing, and you've heard them out, you also know what the other sectors are doing. You want to join the have and have nots. Sometimes the language is very, very different. The technology company and a for-profit speaks a very different language than a not-for-profit grassroots organization. And so the skill of the collab, and it's been challenging and it's a learning experience for me and my team, is to really have that bridging language and enabling them slowly processing so they're speaking similar language and moving forward. And I think that is a big role that people in public health are able to do, because they're able to see possibly a bigger picture, but also listening and empathetic skills. And nothing to say that COVID has provided a great opportunity. Everyone wants to do something, and so using the wave of the want to fuel that.
Yeah, thank you, Angela. So we swing to Ekta Bajaj, the real life situations. Ekta, I'm sure that we as OBGYNs, some are designated COVID hospitals, some do not take in the COVID patients. So if our patients due for delivery become COVID positive, we have to wash our hands off and say, no, not here. We send them to Ekta, or they're under Ayushman Bharat scheme, which I know that Bajaj and yourself have been doing a phenomenal work with really the partnerships that you have with the Ayushman Bharat. So what has been your experience of dealing with such a large segment of so-called unbooked patients? They're suddenly dumped onto your care, and what has been your approach, and what has been the response of the new patients and the families when their minds are also, so disturbed with the COVID positivity? Ekta?
First of all, thank you, Dr. Hema, for giving me this opportunity for being on this panel. Yeah, we have been dealing with COVID for last 1.5 years. And last year situation was different, and now we are more experienced, and we are more confident how to deal with the COVID positive patient. And as far as Ujala Cygnus is concerned, we are mostly dealing with underprivileged sector of the society. And last year in Delhi, only few hospitals they could admit COVID patients. And Ujala Cygnus was one of those hospitals last year. So we started dealing with COVID patients last year. And now every patient can, every hospital can admit COVID patients, but people are scared and they are not very willing to admit COVID patients. But from day one, we never refused to COVID positive patients. My institution have always been taking COVID patients. And definitely patients in India, they are not going for test, and they land up in hospital when some emergency occurs. When patient starts having pain, has bleeding, leaking, or some other problem, then she goes to the hospital. And patient comes to us and unbooked. We don't know her status, her COVID status. And RT-PCR report, it takes at least 1 day, 24 hours time to get the report. So what we do nowadays, first we do rapid antigen test, and the report comes within 10 minutes. And in the meantime, we send sample for RT-PCR. But definitely, we don't hold her treatment. We treat her as a potentially COVID positive patient, and we admit and we do every possible thing, but definitely with due precautions and everything. And our staff, our hospital now well equipped and very confident with dealing with the COVID patients.
Just one interruption, Ekta. When we are speaking about women's healthcare, and such a woman is brought to your setting, and you ask for all kinds of tests, and many things have to be done with her. So how empowered is the woman herself to decide for herself? Is it the family who decides? what she can go through or not, and sometimes do they just pull her out of your setting for want of better understanding or better economics, or how does it really work in private practice? Because the education, awareness, and the what needs to be done exactly, you may tell them, but this is your first encounter with them. So what has been your experience with the families around who are responsible for the care of the women herself? Because pregnant women, they will pamper because the child is their focus, but otherwise.
Yeah, Hemaji, see, education definitely plays a role, and I am seeing all sectors of females, and I am like people who are underprivileged and not very educated. Family is taking decision for them.
Yeah.
Family is taking, and in most of the time, she is not able to take her decision. Even nowadays, I deal with the patients who have home deliveries conducted by dais, and they end up in such a bad situation. I will tell you one incident. There was one primary patient. She delivered at home, and she came to me in the morning at 9 a.m. And by the time she had bled so much, she had severe blood loss. Her hemoglobin was just 2 gram, and she had inversion uterus. Imagine, rarest of the problem. We are dealing with such kind of situation nowadays.
Yeah.
But
So
there are
beyond,
yeah.
beyond COVID, there are a lot of issues with the access, affordability, and awareness as far as women's healthcare is concerned, and that in itself is a huge challenge and a barrier. And however much we want to turn it into the timely, opportunistic help that we can offer, we as clinicians do have our limitations. In this context, do you think the Janani helpline, the helpline which answers a patient's call in 4 different Indian languages, with 200 OBGYNs on board to take the calls 24/7. Do you think such initiatives in your mind, at least gives them a quick fix solution of what to do next? How has been your thought process on Janani launch?
See, women, they are dependent to come to the clinic, to reach hospital. They have to depend on husband, family, father, and most of the time they're not able to come. But Janani helpline, it is free of cost. They don't need to spend. Everybody has phone, and they can talk to doctor, gynecologist, qualified gynecologist. They are just one phone call away. So I am hoping it will bring change. At least she can get a good advice, and she doesn't need to listen to her neighbors or relatives for a proper advice, for her health problem. She can easily she has easy access to solution for her health problems, and that too through a qualified gynecologist. So I am really hopeful Janani will make change.
So every little step we take, we are collaborating with step 1 to expand the Janani initiative. It is already pan-India, but a couple of more languages, because language really matters in our country. And I do hope that this scales up into a large-scale initiative, both for awareness and a quick help to our girls and women, with confidentiality and the trust that we would like to offer them. Moving back to Shri Jairaj, there is also something of preparation in anticipation. So you have been in the forefront of leading certain major healthcare institutes which are now wanting to prepare for the next wave. How true it is, how much of what would be required in terms of both manpower and infrastructure, because manpower and capacity building is another huge issue when we have to deal with newer things. So the third wave, which we are probably expecting, will hit the children. So have you any thoughts on whether preparations will be wasteful, or in reality you need to invest and prepare anyhow?
I do, Hema, but taking on from what Dr. Angela and Dr. Akhtar said, I want to say one thing. My learning in this first wave and second wave has been how resolved our health personnel are and have been in extending treatment and any possible help to the afflicted. As I said, despite considerable danger to their own lives. And over the 15, 16 months that I have seen this at work, they have not lost their resolve. They have been unflinching. And I'm not only talking of very eminent doctors, professionals like you and others. I'm talking about down the line health workers, the nurses and others who have really not, thrown, their jobs and gone away. And so really this gratitude week that you are organizing is something that we have to commend. I also want to say, I'm, as you know, running a small hospital essentially oriented like Dr. Akhtar towards the non-privileged sections of society on a, pure not-for-profit basis. And what I find is, as an administrator, that there is no clarity about where this is going, Hema. Honestly, I don't know if Dr. Bajaj or Dr. Angela can give us that clarity, because, if you open the newspapers, you see every professional saying one or the other thing, which contradicts what they said yesterday. For instance, the gentleman who's supposed to be planning India's response to vaccination says that the earlier figure he gave was aspirational. And now, it is anything but aspirational. I mean, it's true that all this has struck us with great force and we don't know what it is. But at least professionals have the obligation of verifying facts, verifying data, and coming to society and telling them, look, this is what it is. Of course, there are a few of them. I won't name them because, I don't want to embarrass the others. They have stuck to the knitting. When they speak from facts and they speak with assurance. So to respond to what you have said, we are preparing now for the so-called third wave. And, spending a lot of resources, getting things organized, just to be told that there may not be a third wave of the kind that we were told affecting young children and so on. But, there may be other deadly variants of this Delta, and this deadly variant of Delta will affect all population, including those who've been vaccinated twice. So,
yeah. So when you said, the right kind of information, I'll just come back to you in a minute, Angela. So even the professionals are, somewhat at a loss, because even the world organizations have been rethinking and re-revising what it could be. And also another issue here is, few of us may want to tell some things which we think is right, but who listens? Where is the forum for us to go and make our voices heard? That is also, Gaurav, can you just mute, please? Yeah. So both aspects, they are like two sides of the coin. One is that yes, there is a guesswork on modeling and the information that we have on hand, but to disseminate that, we agree to disagree on many of the professional forums as well. And when they ask us for the data, this all is so nascent and so new that we can't really put the data on the table and produce the evidence as how it is required. And also, who listens? And today it is something and tomorrow it's something else. So Angela, you are also collaborating with the WHO and, as a part of the collab and many other leading world authorities, if I may say. What has been your role in disseminating the right information to the segment where it matters, both the peer group as well as the administrative group and the political group, which need to take some, decisions in preparation? Angela.
Thanks. I wanted to burningly respond to what Mr. Jairaj just mentioned, and that alludes to the question that you've asked me as well. One is what we know, but we also know what we don't know. And I don't know why there is a fear in actually stating the fact that, hey, we don't know this. And that has been the most dangerous piece to my mind. A lot of people speaking with a lot of authority, but knowing that it's a bucket of salt, massive buckets of salt, right? And I think, and we're losing trust, we're losing face, vulnerable populations. Vaccine hesitancy is a lot of it, and I'm on the ground, and we're with the most vulnerable populations, a lot of it is because of the myths and misconceptions. And it's not just WhatsApp universities. There are doctors that are, now believing in voodoo. I mean, from HCQs to ivermectin to God knows what. And then later on coming back and saying, hey, that wasn't the right call. I honestly don't know what has happened to some of the medical profession when there is evidence base available. And we are also behind on the waves. There are countries that are ahead of us. What is stopping us from learning what other countries have already faced? Why are we creating new clinical protocols when there is no evidence of efficacy of those new clinical protocols? I want to speak to political will. We know when there is a wave, hospitals will be overburdened again. Doctors, nurses, everybody will be overburdened again. Why then, and I will speak for Bangalore, probably the same for other cities as well, are we closing down CCCs? Are we putting everything and folding it up? Because it takes a while to get it up. We can be more efficient. We don't, of course, have to run it at full operations, but why can't we keep it ready for the wave? We do this every wave and we struggle every time. We know whether it's kids or it's adults or it's older populations, we know that the facilities are not enough, but yet we struggle with decisions like this. We know already that Delta variant is a problem. Why is there so much regulation when there is private sector willing to help on genomic sequencing? Genomic sequencing will also support medical professionals to make the right clinical protocols. So the difference between first and second wave basically happened because even the clinical symptoms came in differently. The false negatives from the RT-PCRs came in differently. And it took so many deaths later for the politicians to say, listen, if you have symptoms but you don't have a positive test, treat it as COVID. Good call. Little late, lots of people died. But when you took the call, people are still not implementing. I have lost people personally when they had a negative RT-PCR test, but had every clinical symptom of COVID. So, again, I think I've answered your question. I feel this is a hot button for me.
Yeah, Angela, but this also brings in a point of capacity building, okay? Because there are, people trust medical professionals in general, the lay people, and they'll just about call up any doctor anytime and ask for advice. And, even the medical professionals need a refreshing, retraining, and the capacity building to say the right things. And that is not happening in a manner that it should be, whether it's a doctor cadre or a frontline worker cadre, nurses, and the lower staff which have to do the infection prevention control practices as well. Yes, Jairaj.
Yeah, just wanted to respond to Angela. I agree completely with her. Why are we closing CCC? Why are we not doing genomic sequencing? And your talk about capacity building. But just to tell Angela, what is the flavor on the other side of public health administrators and so on? I know my younger colleagues who are in the BBMP and so on. So basically, they are pilloried for whatever they do, let alone what they don't do. So people who started this CCCs, at one point in time, it was heralded in the newspapers as a white elephant. It was mercilessly attacked on media and 24/7 TV. And they said that these guys are in cahoots with the private sector and they have done all these things. They have hired costly equipment. And now there's nothing there, so why don't you close it? No, what I'm trying to say, Angela, is that there must also be stakeholder acceptance in a democracy for what public health agencies do or don't do. And if that consensus is lacking, you will have this back and forth decisions of the kind that we are seeing today. So there is a requirement just as much as there's a requirement for professionals to be sure of what they are saying and to admit and acknowledge that they don't know anything. Likewise, the stakeholders also must have a broad degree of consensus in terms of what is good for society in the medium term and long term. That's what I wanted to say. Thank you.
Yeah. Yeah, so thanks a lot. Now, before, we said we draw our expertise and experience from everywhere. So we have Dr. Sangvi from Johns Hopkins giving his inputs, and Dr. Uday. And as I said, that since the differences in time zones, we have pre-recorded the conversation, which I will ask Himani to play in just a moment. But before that, Ekta, have you started vaccinating your pregnant, non-pregnant patients and the post-delivery patients, lactating patients? Ekta, you're muted. Yeah.
See, now we have got the guidelines for vaccination for pregnant and lactating women. First, we got guidelines for approval for lactating women, and now pregnant women as well. We are vaccinating lactating women, and we advise pregnant women as well, but they are not taking it very positively. They are still hesitant. But from our side, it is yes, but they are not very willing to take risk.
Yeah, that's why
because
like
it is a
said,
new
we have to match, both perspectives, because we in professional organizations fought so much for getting these vaccinations for our women who are pregnant and just delivered. But as Angela said, vaccine hesitancy, and there is still a gap that needs to be built over, bridged over time, certainly. So I think that the communication, sensitizing everybody who is involved. Some of our peer group may also say, let's jump into the bandwagon later. Let's see what happens. When let somebody else give it first and face the music, and then we will come on. Angela?
I just wanted to say, particularly because you asked Dr. Ekta about women, that we are saying that unless we have gender equity, this is going to be, it's not even hesitancy, it's actually a barrier to vaccination, because a lot of the women are not making decisions for themselves, their own bodies. And their children, and that's a huge barrier. And this is where our other societal and development issues come in the way of public health. And just very quickly to respond to your question on capacity building, I think we've done wonderfully in terms of resources for capacity building, be they methods, modules, personnel, training institutes like yourselves. I think that is there. Unfortunately, I don't think everyone has the learning mentality to take on new learning. And that is what I have seen in these, when crisis has happened, oftentimes the health workers, including nurses and doctors I work with, often go back to what their grandmothers told them and not what they studied in college or practice with patients. Something has happened with this crisis, and maybe it's just something for us to think about on how we create that environment that brings us back to, evidence-based.
I agree that if all of us, all the distinguished speakers as well as the audience agree that no one is safe till everyone is safe, then they should let go this gender inequities and get everybody on the same page for the benefit of the whole humanity per se. May I now request Himani to just play the video clip where I'm in conversation with Dr. Sangvi and Dr. Thanawala to give us a few more insights into what better we could be doing. And at the same note, Sri Jairaj, Angela and Ekta, who have joined us live on my personal behalf and on behalf of IHW Council, I really thank you, not only for your time, but for giving such insightful, useful inputs and giving us the hope and the courage that we have come a long way, but there is still a long way to go, and together we can. So thank you so much, Himani. The tape, please.
Thank you, Hema, and thank you, Dr. Angela and Dr. Akhtar. And pleasure to have interacted with all of you, and especially to meet Angela after all these years. Hope to meet you again soon. Thank you.
Thank you so much. Yeah, straight on to the show. And the first question to Dr. Sangvi: what else can we talk about apart from COVID in this massive COVID pandemic, which is making waves in every country? So Harshad, my question to you is, as the mantra goes, no one is safe until everyone is safe. What does this mean to you in the COVID context, especially for girls and women?
So I think the most important thing from my perspective is that unless everybody gets vaccinated, no one is really safe. So I think that in the context of COVID, we must strive for universal coverage of the COVID vaccine. Now for everybody who are 12 years and old. And soon for every child when studies are completed and shown to be safe.
Right.
Now, India has the capacity, in my opinion, of vaccinating the entire population. And I'm certain that the current shortages in vaccines are going to be overcome very, very rapidly. So this is our time to figure out how we will vaccinate everybody. Mobilize both our private and public sector, hold mass vaccination campaigns, address vaccination hesitancy using social media, community actions, social mobilization. So let us incentivize achievement of vast coverage. We can find creative ways to get this done, including by mobilizing the entire healthcare system. So we've now worn masks for more than a year so that others can be protected. We've isolated and stayed apart 6 feet so that we could be safe. We've wiped and we've cleaned. We've shut down. We found new ways to accomplish both our professional and public personal goals. And some of us have gotten vaccinated, at least a proportion of us. And it's within our reach to vaccinate everybody. The virus is evolving, and variants such as Delta are many, many more times more infectious. Those who remain unvaccinated are most vulnerable and allow the virus to replicate and perhaps even spawn more virulent forms. So let us do our part to move this thing on. If you've not been vaccinated, get that done today. And let us make the vaccines hassle-free, easy, and convenient. And if you've already been vaccinated, then look for 3 or 4 friends among your friends, family, clubs, networks who have not been vaccinated and help them overcome their hesitancy. Help them make the choice to get vaccinated. Let's do that today. Let's get done with this thing already.
Thank you, Harshad, for that message. The message is very loud and clear that don't make any excuses. Do it right now and right here. Harshad seems to be saying all the way from the US into the interior parts of India. His voice and message is echoing loud and clear. Harshad, just one small follow-up question. When we say no one is safe until everyone is safe, India is a large country. And we know that even with the fastest and the best attempts that we make, it's going to take a while. So those who are vaccinated are happily roaming around without masks. So how can you relate to no one is safe until everyone is safe? Because until everybody, at least a significant percentage, is vaccinated, the responsible behavior of every citizen to follow the COVID precautions. What is your message or advice to them?
I think our leaders, our health leaders, our doctors, our nurses all need to model those same behaviors we want everybody to follow. So if we put on our masks, if we continue social distancing, if we don't create too many crowds, then I think the public will follow. I think the public is intelligent. They understand. I think they just need good examples from all of us.
Thank you, Harshad. So the role modeling as how you are for us. So I think the same philosophy we need to percolate into the COVID precautions as well. Now to Uday. In your new position as the ICOG chair, Uday, we know that ICOG has been vibrant and doing a lot of activities as the academic wing of FOXY. Let me turn around the same mantra of no one is safe until everyone is safe, not in the context of COVID, but in the context of girls, women's, new mothers. How can we ensure that every single one of them is safe beyond the COVID context when it relates to other issues regarding the women's healthcare? Uday.
Thank you, Hema, for this question. And ICOG and FOXY both have been working towards improving the women's health in general, much before even COVID came in all its perspective, because we have realized that unless we get up and do something about it, and you know, it's not going to change. So you'll realize that the maternal mortality rate has fallen drastically over the last 10 years or so, and we are in a much better position today than what we were. Awareness is something which the organization has brought to all the women, and we have committee people working for it. We have got ICOG working for it. We have programs right starting from the schools and involving the adolescents, going on to the primary health care centers in the small villages or the small towns, where all our Foxy members are brought up to date in what to do, what antenatal care to do, how to treat adolescent women. There have been various programs like, you know, all adolescent girls getting a tablet of iron once a week and stuff like that. So enough initiatives have been started by the organizations to reach all the women so that they become safe from diseases. Take for cervical cancer, we are propagating the vaccinations of cervical cancer. We are going into preventive mode of healthcare by focusing on issues like nutrition. Now, in the COVID era, it has been a little bit difficult because what we had, that the school midday meal program, you know, the wind has been taken out of the sails, which was going so well, but ultimately it is coming back on track. The government is focusing on those things also, and immunizations, etc. Everything is going there, but the Foxy ICOG had its lead in upgrading its members to bring it up to scale, a skill improvement of skill of medical and paramedical staff. We have this huge concept of Manyata, where we are building up the skill of the paramedical force so that any emergencies can be dealt with more easily. No women should have a problem in labor or die because of labor. And a lot of initiatives have gone into it to make the women safe.
Right. So as an organization, as an organization, you think when the demand is generated, your supply side with the capacity building and the skills and all, is every attempt is being made to strengthen that and reach every girl, every woman. Is that?
Yes, it is. That is the way. And in fact, you know, last whole month, there was a big campaign that all pregnant women should be vaccinated, because initially the Indian guidelines said that, okay, do not vaccinate pregnant women, lactating women, we query. Now they're saying, okay, you can. I mean, they're the vulnerable group. They need to be vaccinated. And of course, they also know that we don't know too much about this virus. We don't know the long-term implications, etc. But it is better to get vaccinated rather than to get COVID in pregnancy and have a big problem. So now at least that recommendations have changed. And I think Foxy has played a very big role in getting it done.
Right. So I think professional organizations doing their bit to escalate and be the advocates and champions for women's healthcare, we really, really appreciate that. Dr. Sangui again, he has mentioned about the adolescent girls, and yes, the COVID has also taught us that prevention is better than cure, and it is the dream and aim of every of the women's healthcare providers that we must catch them in pre-pregnancy care, adolescent care, make them get into the pink of health before they embark into their reproductive journey, etc., etc. These are all, you know, very nice to hear, but how do you actually make it happen? What are your thoughts on how in a country like India we can, you know, catch them?
Well, I think we must make every effort to make sure that schoolgirls and adolescents continue to get the health care that they need. Especially about how their bodies are changing and changes that are occurring during adolescence. I think the widespread availability now of telemedicine is actually a really good approach for young people. I believe that many young people may be shy about coming to face-to-face consultations, but I think telemedicine offers another type of opportunity. So let us engage with young people in different ways and seek their advice on how they want to receive their care. Let us engage with youth in a manner in which they understand. I personally think that it's time for us to design health clinics that are designed for young people in mind. All our clinics at the moment are designed for grown-up adults. We don't design specialized services for young people. I think it's necessary to do that. And let us work with teachers, for example, because I don't think teachers are playing a complete role in helping with the health of young people. So there are many things we can do to continue to nurture our young people. But most important, I think, is to create specialized services for them that are targeted, that are appropriate for young people.
Good thoughts, Arshad. But I swing back to Uday on knowing to do and actually doing it. That's the gap. How are we trying to bridge that? Because we used to go for health and hygiene programs, many Foxy ICOG champions in every nook and corner, all excited about going and addressing the ankles. Everything has got arrested because of the COVID. Just about. How do you cope with this change? Because it was 4 steps ahead, now we are 2 steps back. Is that the feeling you get also?
Yes, in a way, yes, but ultimately now everything is switching over to the digital mode, and they're having digital classrooms, etc. Now the problem is when a child is sitting at home, they're watching a digital class, and ultimately, they want to get a little free. It's not like a free period that a doctor walks in and talks about something else. It will be another lecture which we can squeeze uh, in their digital curriculum. And in a way, it'd be better because over there, they were shy of getting up and asking a question that, oh, 10 people are watching me. Here, they can easily type a question on the chat bot and get the answer. But ultimately, we have to take that step and do it. It is going to take a little time for this thing to go into the digital platform, us to go into the digital platform of schools, because they are adapting to a big change. They have no idea about how they're going, they are coping it up, and now they have started doing it very well. The parents are at another end because most of the parents said, okay, children are going to school for 5 hours, 6 hours, and they're out of the house and all. Now they have to sit with the kids and make them do the online classes.
Right.
It has created a big challenge in villages and remote areas because many of the people don't have computers, don't have mobile phones, how to log on. And even if they have the mobile phones, they borrow the father's mobile phone for their class, but then the internet connectivity is not good. So all these challenges have come up now, which we will probably gradually overcome. So I feel the aspect of dealing with the health right now will be probably more in the teacher's hand, and the teachers will have to be giving that information to the school kids and the adolescent girls.
Yeah.
And I don't know, the doctors, well, we are available online, but they should be getting to us. That is the thing.
Okay, so I think both our expert guests have mentioned that digital mode ensures confidentiality and anonymity and offers them a good chance. So in this context, I would like to congratulate the IHW Council, which has hosted this program, who have launched the Janani Helpline for girls and women in many different languages, because language also becomes a great barrier for the communication and understanding. And as Uday said, champions are all out there, and Dr. Harshad also agrees that we have to continually do our bit to reach out, involving the young people into this very project. So thank you for those responses. We move on in her journey now to the pregnancy care. Pregnancy care also oftentimes, Dr. Sangvi, we have found that the hi-fi care and the management of complications seems to score well. But in the first place, why did those complications happen at all? Because the basic care with preventive care and the early recognition is perhaps lacking. How do we get around that problem? Because in the COVID context, it's become a big excuse that women, first of all, did not have much access. Now they have been asked to come even more infrequently. How is this all impacting the development and late detection of complication itself, the care for a new mother, which is, according to me, it's the matter of human right and the right that she deserves to sail through this journey with safety and dignity.
Right. I think worldwide we are seeing that the outcomes for mothers and their pregnancies and their babies have taken a big hit during COVID. And I think part of the reason is that women have been uncomfortable about coming, and we have been uncomfortable about necessarily providing the care. Now, I'll go back to telemedicine. Almost 60% of everything we need to do for the woman is actually possible by virtual consultation. And of course, virtual consultation marginalizes the people who are most in need in rural areas. But I go back to the 90s when India installed and led the world in installing these STD, PCO, ICO booths.
Right.
And what they did was that immediately the vast amount of the rural population was allowed the use of phone services, and penetration of those services reached everybody, the masses. And I can imagine a day when virtual consultations could be possible through something like that. We need innovation to make that happen. I think that we also need to improve on our point of care diagnostics. If tests can be done remotely, and today many tests can be done fairly significantly without the presence of laboratories necessarily. And if we are capable of innovating in this area, then I think we would dramatically improve the care and make it reach the most vulnerable. And I would urge our innovators to think more about low-cost tests that can be done on a regular basis. Finally, I think for India, you are the world's leaders actually at the moment in artificial intelligence and machine learning. And if we think about those capabilities today, if we start harnessing those capabilities, then we can really predict disease and illness and maybe treat illness so much better. This is not just blue sky thinking. I think that this is something that is possible, but it requires our big software giants, our technology colleges, our public health schools, our doctors, our medical associations to come together so that we can build a resilient nation so that our women can safely give birth across the nation.
Thank you, Harshad. These are very, very important, insightful, and interesting points because technology married to healthcare, it seems to be such a low-hanging fruit for us to, get it out to the girls and women out there. But at the same point in time, I want to ask Uday, who was just expressing a few minutes ago, that there seems to be a barrier in the mindset of the healthcare providers themselves. They're now saying, oh, there's no need to use the telemedicine, though even it's legally allowed in our country now. Let's go back to the touch and feel. Let the women come to us. We are not comfortable doing everything on the digital space. So do you think this barrier is real or in some few pockets? Because when Harshad was mentioning where the need is, the rural and marginalized women, I'm very, very happy to share on this platform that we offer the video consultation 8 a.m. in the morning to 8 p.m. at night to the whole team. And we have many, many calls from rural India for video consultations, the paid video consultation. They are all pretty comfortable and silent because they're so grateful that they can reach out to a specialist and get the advice on time. That is the mindset of the care receivers, whereas the caregivers, you seem to think that there is a barrier. Uday, your comment on that?
Hema, you've been always a leader and you have done a great job in setting up a network of telemedicine. Even much before COVID had started, you had joined up with the rural PHCs and doing that. And you have a full network now established in Karnataka to do that. When you take cities who have not been doing it, and we had not really been doing teleconsultation, and we started doing it when it's COVID. And initially, yes, when there was the first wave of COVID, there was a lot of appointments, etc. For me. But then, as soon as the lockdowns opened up and was eased out, patients, even to show a report, prefer to come to the maternity home and show it they want to see the doctor and they want to say, doctor, now you see the report. Now, even if the doctor is covered by the mask and the face mask and all, they still feel, they feel it's important to go to the hospital and get my report shown. And I tell them that why don't you simply teleconsult instead of traveling, coming, waiting in the waiting room. And I don't want a crowd in my hospital. So I in spite of that, many people still want to just take appointments and come to things. We had this thing about taking appointment online and stuff like that, but now they've gone back to the old system. Even the patients have gone back to the old system. And maybe it is our thing that we have not really made them used to it. Like you have done it for many years and people are used to logging in and consulting in Bangalore. Maybe we have not done that, but I think in general it's a 50-50 thing. Many people would want to do a teleconsultation, but many of them would still prefer to see the doctor in person.
Yeah, thanks, Uday. It's good to get a different point of view because India is a big canvas, and much contrary to our perception, it's not only Karnataka or Bangalore based, but we have calls from interiors of West Bengal, some Purulia and Azamgarh and all kinds of places. And then even the home monitoring for COVID in the notebooks, they're neatly writing the pulse ox and the word of pulse oximeter with such ease. They are speaking it out. So women out there and every nook and corner, we cannot deny that they are wise, and we cannot really underestimate them. So it is a behavior change, and Harshad will agree that in any kind of a situation, behavior change is always been the greatest barrier, and it is happening slowly. And I think people will slowly and steadily recognize the importance of the hybrid kind of a model ultimately, because no one thing can be the best or the right or wrong, but we will apply it to the context. And by the way, telemedicine and the digital use was one of the key questions that I wanted to ask, but I think it has come as a thread through all of our questions because it has been the forerunner of what the future may present with respect to many simple, doable point of care and the reach through the digital platforms. And when we are talking so much about the power of technology, this has been an exciting deliberation. The best of people from right across the world, Dr. Sangvi from Baltimore and Dr. Uday from Navi Mumbai, brought to your doorstep right here and right now. What else could be more exciting? So thank you very much, both of you. And we thank you for your time, your insights, your expert inputs, and we move on to the rest of the panelists who have joined us here to continue our journey into getting more inputs from the other experts in the country as well. Thank you so much. Namaste.
What percentage of children would have these severe symptoms?
What is before I answer this question, what is very important to remember is we must see the entire picture. In the first wave, when we saw families, maybe one member was affected, not entire family was affected. In the second wave, because of the increased transmissibility, even if one member in the family was affected, what we generally saw is everybody were affected. But children continue to have mild symptoms. Now, if you are, what happens is in the media, what is projected is say 10,000 children have been found positive from one district. But we must remember that the total number had also gone up. So actually, you must look at the percentage of children affected. So ICMR has clearly stated that in the first wave, 4.2% children were affected. In the second wave, 5.8% children were affected. So actually, the percentage of children affected has not changed significantly. It is because the whole population, the total number went up, the number of children affected also went up, the number of children who would suffer complications also went up. So the virus has not caused increased problems in children. It is just that the total number went up, proportionately children also got affected. Secondly, your question was about complications. So please remember, parents, that fortunately 95% of COVID cases continue to be mild in children. And they just require simple symptomatic treatment. Means if the child has fever, give paracetamol. If has loose motions, give hydrate the child, etc. But there are children who are at high risk for severity, and those children are who have underlying, say, heart problem, kidney problem, liver problem. So these children need a little more monitoring. And always, I mean, there are red flag signs to look out for, but I want to reassure parents COVID continues to be mild in children. and those who have underlying health problems need to be monitored more closely, and seek opinion of your doctor. They will tell you the red flag signs. So if say the fever continues for a prolonged period, or the fever in between the fevers, your child is not active, playful, or passing less urine or breathing fast, they need to contact their doctor accordingly soon. Now, there is this complication which Dr. Shali Awasthi talked about, MISC, which is very important for all parents to be aware of. Though the cases are rare, they are potentially life-threatening. So this MISC, the full form is multi-system inflammatory syndrome in children, and this does not occur during COVID. It occurs usually 3 to 4 weeks after COVID. Means it is many times when a child is diagnosed with MIC, the family doesn't even recall that there was some COVID infection, because it is mostly asymptomatic in majority. Now, how do you recognize these signs? Is the child presents with very high fever, the lips and tongue look bright red, the eyes look red, they may have severe loose motions and rash over the body. So if you have a child with such symptoms, it is very important that you contact your doctor immediately, because timely detection, there is cure for this, there is treatment for this. This is not contagious, but the child needs to get medical attention soon. So this is but though they are rare, they are potentially life-threatening, and you must contact the doctor.
Right. Dr. Yadav, what did you see in your practice? Dr. Avanti said that at first there were admissions of children who had COVID. What was your experience? And as a pediatric, how did you feel? Because, pediatric doctors are there, there's such happy times, the baby's born, vaccinations, growth measurements, most of the times we always, associate a pediatric doctor with happy times. How did you deal with this? I'm sure parents would have been really, really anxious if their child had COVID and had to be admitted. So what was your experience with that?
Definitely during COVID pandemic, especially during the peak times, we got a lot of phone calls from the parents. They were very anxious because of they are getting infection, and they want to protect their kids. So it is very difficult to, if parents are getting infection and protect to children, it is very difficult. Definitely parents are anxious, but I assure them that we are doing in routine practice, we are seeing in routine practice that most of the children are either asymptomatic or mildly symptomatic. So we observe similarly like other doctors, our kids are very either asymptomatic or very mildly symptomatic. Only very few data suggests that 9% of hospitalized children were the severe category of symptomatic. So there are very less chance of getting severe infections in children. And in my practice, I have seen almost 12 cases of the MISC right now after the COVID second peak is over, and only with one expiry. There is excellent response of IVIG. If parents are aware about the symptomatology of the MISC, they will get medical attention very soon, very early. Recognition is very important in the community level. If they are aware about these symptoms and their symptomatology, they will definitely get medical attention in earlier phase also. And there is excellent response of IVIG therapy. So it will be very vital to availability of the IVIG. That will be very vital.
Right. Dr. Meena, so from what I've heard from all the pediatric doctors on the panel, that largely children are mildly symptomatic or asymptomatic. But where is this whole fear mongering, the third wave will really affect the kids? Even as an adult, if I contract COVID, I feel stressed, not knowing, this is a new virus, what will happen? What if I infect somebody else? How, children getting affected would be very, very stressful for parents. Do you think there is a real bias, real basis for believing that, kids will be badly affected in the next wave that comes? Because the statistics that were quoted on this panel, between the first wave and the second wave, the percentage of children being affected by COVID was not very high. While in the second wave, entire families were getting affected. So what is the basis to think that children will be badly affected in the third wave? Do you agree with it?
Thank you for the question. What I would like to say is the third wave, there is no need to panic, but definitely there is a risk of infection in the third wave to the children. And I wouldn't say it will be a severe infection, it will be too early to say, because the new problem with COVID now, what we're facing is the mutation. We are not very sure about the new virus strain which is going to happen, because the first wave, if you see the pattern, the present pandemic, what is going on, the first wave, the cases were mild, whereas the second wave, the cases were a bit severe, more severe, requiring ICU admission, a lot of mortalities. But the same did not go down with the pediatric population. That is one plus point if you say pediatric population getting affected, because even though the number of cases were high in the second wave, the percentage of severe cases who required admission, who required ICU stay, who were very ill, that remained still the same. But the total number of population affected was definitely high. The third wave, why are we expecting that the children will be affected? Because see, the first and second wave affected mostly adults, and they are already immunized, most of them. I mean, we are into the vaccination drive, and a lot of care has been taken to vaccinate as many people as possible. And unfortunately, we don't have a vaccine for children yet. And that is the one which is worrying us more, because if there is no vaccine, the only thing which can prevent a child from a severe infection would be a mild infection, antibodies. Either it can come from vaccine or from a natural infection. If there is no vaccine available, the natural infection do give them some protection. And similarly, children have got good innate immunity, and they I mean, first and second wave has taught us that they have good immunity towards mild infection during the active phase of COVID infection. I'm not talking about MISC. Definitely, there will be a risk of MISC if the number of cases affected will be more, right? But considering there is children are still not vaccinated, considering that the COVID appropriate behavior, if not followed in the future, there could be increased number of cases in adult population, and that can be transmitted to children. So definitely there will be a risk of children getting affected, but it all depends on the strain. If the virus undergoes further mutation, we do expect some new variants with unknown severity and unknown prognosis.
Okay, so there are still a lot of unknowns in this, because the most recent mutated version, the Delta Plus, is known to be very transmissible, and children in any case are known to be more infectious than adults. So, Dr. Shweta, I want to understand how prepared are doctors or hospitals for this?
Yes.
Because all the attention so far has gone on ICU beds and ventilators, oxygen beds, etc. And most of the time we are talking about the adult population, because the wave is very severe. So pediatrics is usually a department in a hospital. So
Yes.
it's not very large. So how prepared are we for if there is a chance that pediatric cases go up?
Yes.
What are you doing at your hospital?
Yes, thanks, Anisha. So, rightly so, when this prediction was made, will the third wave affect children more predominantly? It was made at the peak of the second wave. Okay. Now the prediction has been made. Instead of saying the prediction is right or wrong, we need to be prepared. Be prepared for the worst and hope for the best, right? So, yes, we are ramping up a pediatric healthcare infrastructure, and in anticipation of the third wave. Okay, there is no need to panic, but yes, we need to be prepared. This is called disaster preparedness. Okay, so it's like a meteorological department saying there's going to be a rain, there's going to be a cyclone. Instead of saying that these people say there is a rain, then there is never a rain. Instead of saying there'll not be a third wave, or we'll see if the variant is there, we need to be in anticipation of the third wave. And it is not only infrastructure, it's not only the beds, which we are doing, isn't it? The government is saying the number of beds in a pediatric facility is also going to be increased. And in any city or any region you take, maybe there'll be 10 to 20 hospitals which cater to adults, but there'll be only one or two exclusive pediatric hospital, very few. So yes, we are trying to inculcate beds pediatric beds or pediatric care system in these hospitals where it is exclusively an adult. That is we are trying to do in anticipation, of course. And medical equipment, Anisha, it's not only the beds. Even a simple IV line, a simple face mask is different for a different age group of a child. That also we need to take care of. And this suddenly reminds me of the first wave when it was all locked up. There was a patient, a parent who couldn't get a paracetamol syrup because everybody put that paracetamol at home. So we had to take a tablet, sort of dilute it in water and give, because we were like 1-2 days, there was some scarcity. So even pediatric simple drugs, okay. Now we are not talking about, all this remdesivirs and all in children. Simple paracetamols, simple rehydration liquids, okay, that of course we need to make it available, and they are being done. And again, now coming to how to give a paracetamol, how to rehydrate a child who is having severe diarrhea due to COVID. Training healthcare professional, like all of my colleagues here would agree that when we were in this lockdown, first wave, second wave, not only a general physician, not only a pulmonologist, every specialist, be it MBBS, orthopedician, be it a gynecologist, everybody put their hands together to help our COVID patients. But now it's difficult to treat. Like an orthopedician could take care of a, because of his MBBS knowledge, because of his experience in dealing with adults, he could treat a mild COVID case, he could triage a COVID case. But it's not the same in children. All these specialists can't just come and say, oh, I'm going to treat, or I'm going to help treating a pediatric patient. Even healthcare professionals, staff, nurses, okay. So it's different when a doctor gives an order to a nurse, give paracetamol to that patient, give IV fluid, give a saline to that patient. Now the doctor has to give an order. This is the amount of saline to be given, this is the amount of this drug to be given, because it's all weight based in children. So training healthcare professionals also need to be done. Be it an MBBS doctor needs to be trained, a staff nurse needs to be trained. More importantly, now this is all our part, healthcare part, educating parents, okay. So now everybody is like, will my child get COVID, will it be severe? It may be, but what are we doing? What is a parent doing? How do we know that this is COVID or my child has a flu? When do I go? When do I talk to a doctor? When do I take my child to the hospital? Because there is a confusion. Now there is a wave going on. I can't go to the hospital. What do I do? So parents need to be empowered. Parents need to be educated. And somewhere I feel it is our job, to sort of be available. Tell them, don't panic. This is what you do. These are the set protocols. These are the symptoms. This is what you can do as first aid. And then, educating is empowering. You need to empower the parents. And lastly, because I am associated with telehealth, I would like to put in my perspective also in this anticipation of third wave. See, there is transition. A child, I'm talking about children. So a child may transit from mild to moderate COVID, moderate to severe COVID. This can happen with a simple monitoring of a video call with a doctor, with a treating physician or a treating pediatrician. I can assess a child. I can simply see a child, see how he is breathing, and catch the transition between mild to moderate COVID, and suggest the parent that now you need to take to a hospital. And the other way around, we have seen parents, they get up in the morning, put pulse oximeter to the child, and it shows 80%. They carry the child, run to the emergency. And we see and say, oh, the pulse oximeter didn't fit. We can sort of see a child and say, is this child really desaturating? Are his SpO2 levels really falling, or this is just a technical glitch? Such things can be made, and I think rightly so. In the last 1.5 years, telemedicine has been ramped up. And of course, like when you're talking about the third wave, even telemedicine in pediatric wise also can be helpful. So yeah, beds, hospital catering to pediatrics, medical equipment, medical drugs, training healthcare professionals, educating parents, and of course telemedicine help, because I'm into it. That would be, we are
Right.
doing it. Yeah.
You've given us the full spectrum. Dr. Lavasti, could you tell us how did you feel, at the time that you were treating your pediatric patients in the first wave and the second wave? Because you said that you saw in the first wave a lot of hospital admissions. You have seen MIC patients as well. So, as a pediatric doctor treating a child, what emotions did you feel? What did you think? Did you feel in control, given that this is a new disease? How did you reassure the parents? Because their anxiety would be very great, and wears off your child, and anxiety really doesn't help if you have COVID.
See, there was a difference between the first wave and the second wave, a lot of difference. In the first wave, everyone was very frightened. Knowledge was less. People did not know what's happening. And we did not allow attendance inside. So except when, of course, the child was there, child was with mother. Now, I have seen situations where the family members were apprehensive about staying with a COVID positive child. That happened in the first wave. We had to reassure them that using a mask, trying to wear a PPE would help. Few patients were like that. Few patients were absolutely fine. They were staying with the child. Mothers were staying with the child. No other family member was staying. Father was not staying. The mother stayed with the child. And then the spectrum changed. When we came to the second wave, by that time people had experience of COVID. People were sort of more forthcoming. And let me tell you, even though the numbers were different, my feeling is that the proportion of children who were sick with COVID was more. Proportion-wise, it could be 12% in wave 1, less than 20 years, 12% in wave 2, less than 20 years. But among those who were hospitalized, because the numbers were larger in wave 2, there was a wider spectrum of disease. And with the wider spectrum of disease, the ill patients in our ICUs increased. In the first wave, there was a need for a separate pediatric COVID ICU was felt towards the end. And by the time it was felt, the numbers started dropping. But in the second wave, the pediatric COVID ICU was functional right from the first case. And there was a time when I told you there was no beds. Now in the second wave, parents came themselves. They came with a mask, they stayed with the child, because children don't stay without parents. It would have been totally impossible to manage a child without parents. They came, and remember, that time there was no vaccination, so they were unvaccinated. Some of them hadn't had COVID. They came and stayed with the child. And as Dr. Yadav was saying, during this time, telephonic consultation or telemedicine, as you may say, whatever, we had a lot of telephone calls because outpatients were closed. We were catering to our patients on telephone. There were a lot of apprehension and people were asking us about symptoms of COVID, and we were managing these patients. So now with the third wave coming, what have we learned? We've learned that parental education about pediatric COVID is there, but it has to be augmented further. And there has to be a preparedness in the family that the child can get sick. The child will largely have mild symptoms. However, the child should be taken to a hospital in case there is increase in symptoms. The second thing in terms of preparedness, which we are doing in our state of Uttar Pradesh, is that we are trying to treat children closer to their homes. Because each district is having a pediatric COVID facility. So we don't have to rush across districts to go to the capital city of the state for treatment. And that level of preparedness is important, because if the child is sick in the family, perhaps a few elders will also be sick. So what happens is that at the cost of the child, they take care of elders and the child would be neglected. There could be gender discrimination in care seeking if care is very far off from the city. So we have taken care of those things in I'm sure all over the country, where each district has become sufficient to take care of COVID patients. And I guess, as one of our panelists was very rightly saying, we should hope for the best and be prepared for the worst. Exactly. I liked what she said.
Dr. Dhanya, some recent sero surveys have been done in Mumbai, where the second wave started early. It was very severe. And some sero surveys, sometimes maybe small, have happened in Chandigarh as well. And the SERA surveys have shown that more than 50% of the children have antibodies. Like a majority of them have antibodies. Yeah, I mean, we didn't see them all in the hospitals, right? They were asymptomatic or had very mild COVID. They have the antibodies. So, what does this mean for what lies ahead, especially with mutations? And as a doctor, what do you think should be the best way forward for parents? What would you advise them?
Okay. So this is actually very reassuring to know that in the zero surveys, 50% of the children have found to be having antibodies. That means they have kind of suffered the infection of COVID. As I said, many of the infections are asymptomatic, so they don't even know when they get infected with COVID. Now, but on the other side, we also know that 50% are still vulnerable. So the message from this is, though it's a good news, we need to continue the COVID appropriate behavior. So we cannot let go down the guard at the same time. And what the parents need to assure is they need children look at parents as their role models. So unless they wear masks, unless they follow social distancing, the children it is not expected that children should only follow. So I would appeal to parents that teach them COVID appropriate behavior as you be their role models. And what is important through this session, I would say that teach children not to touch the front part of the mask, because it's the front part that is most contaminated. And because children have this habit of they want to, put their finger into the nose, scratch their mask. So you need to teach them, if they want to, they need to remove the mask, scratch, perform hand hygiene, and then wear the mask again. Because later, at some point of time, the schools will reopen. So it is better that the children are taught from now on only how to handle outside. Then regarding the social distancing, we say 3 feet, but for a child, they should be taught what is 3 feet. It's like a distance. You imagine someone lying down on a bed, that is the distance. So in child appropriate language, they should be taught COVID appropriate behavior. This is my appeal to parents. And vaccination, definitely parents should get themselves vaccinated, their grandparents vaccinated. For children, we are looking forward for the vaccine, not because children, though they suffer mildly, they can transmit infection to others. So we hope that vaccine will come soon for children.
Yes, the trials are underway, and let's hope they are successful, and we'll perhaps have some leads in September for vaccination for kids, and we're all keeping our fingers crossed. Dr. Yadav, the government has recently come out with guidelines for treatment of COVID-19 in children. So could you, break it down for us in simple language so that other doctors, parents could be, prepared, and they know that these are the symptoms. This is what I do. Could you please tell us what these guidelines say?
Yes, ma'am. This is very important and relevant question. As we all know that most of the children may be asymptomatic and either may have some mild symptoms only. So the most common symptoms are flu-like symptoms. That includes fever, cough, cold, coryza, myalgia, headache, diarrhea, and vomiting. So parents should not worry about these symptoms. These can be managed home very well and on the simple medications, symptomatic medications. At the same time, we have to teach our parents, they have to be very watchful about the progression of the disease, how it is progressing. If there is any breathing difficulty, if there is some kind of retractions, that is chest indrawing, if there is patient is or child is not feeling well, he is vomiting everything, he is drowsy, he looks dehydrated, or he is unresponsive or having any kind of convulsions, these are very alarming sign and symptoms, and immediate attention is must. at that time. And we same time we also advise to be watchful if there is any redness of the eyes, if there is any swelling in the body like hands and feet, if there is any swelling in the lips and cracking of the lips, if their tongues are very red, if there is any kind of rashes, or their fear is not responding after 3 or 4 days of the simple illness. So these kinds of symptoms which must be attended by the qualified practitioner and must be taken care of, because the most importantly children are getting RT-PCR positive is it is unlikely. Most of the children are not RT-PCR positively, and most of the symptoms are even post-COVID also. Since it is asymptomatic, most of the patients are asymptomatic. So we have to watch for a few weeks, like 4 to 6 weeks. We should be very careful about the children.
Dr. Meena, schools remain shut because we want to break the chain of transmissibility, and because children are infectious, schools are shut. But this is bringing its own set of problems. While we've seen Dr. Dhanya tell us that we must practice COVID-appropriate behavior, how long will we keep our kids locked in? They need to go out, and if they're going to a park to play, they may be playing on the swings which are used by everyone. So, where do we draw a line about safety? Because, for our children to be restricted indoors as well, it's not going to be good for their health. And the general belief is good health is what is going to help you beat the disease. So, how do you find the balance?
That is what I can say, because see, COVID, child getting COVID and overcoming infection is one aspect of it. But what the tip of the iceberg is only the COVID. What we are not seeing is what are the effects of lockdown on COVID pandemic on overall health of the child. Because we are seeing a lot of, now that the lockdown has been taken off and people have started coming out, we are seeing a lot of cases in OPD basis, lot children of varying age, starting from say toddlers to adolescent. We are seeing a lot of physical health problem as well as mental health problem. Because just imagine 1.5 years of your life you're being within your house, not meeting your friends, not going for your physical activity and school education, you're not meeting anyone. So there are a lot of implication of lockdown itself. The factors are multiple, starting from getting infection per se, and lockdown, not socializing, and lot of issues like that. I mean, we had child who refused to talk. We have seen children who are not getting their developmental milestone as expected. A lot of kids have got speech delay because of especially nuclear families not able to meet their friends or family members, and excessive use of screen time. This is I would say we had a lot of cases with autism like feature, kids not responding to their parents, not uttering few words which were supposed to be started by 1 or 2 years of age. These cases have come up, and the extreme cases like in adolescent, we have seen a lot of anxiety coming with psychosomatic illnesses. They have a lot of unexplained pains here and there, headache. They come with acute breathlessness, and mostly the teenagers, they are having this problem because of anxiety related to COVID, not able to express their emotions at home, and confined to a place. These are the problems which are happening, and it is going to be a huge problem, and it is going to take a lot of time to get back to normal things. Because as we know, the communicable disease to some extent were well controlled with vaccines in children, but the non-communicable disease, the lifestyle diseases, what we are seeing on a daily basis, it has increased tremendously in the last 1.5 to 2 years, and the main cause being COVID and lockdown, restricted physical activity. These are the things which are happening. So what can be done is, you have to see what is the benefit you are getting from lockdown versus the risk of staying indoor, right? And now that the lockdown has been eased, it has to be a gradual process. And what I would request the parents is, If it is not necessary to step out, please avoid taking your children outside. Social gatherings are a big no-no. You don't have to carry your 5-year or 6-year-old child to eat street food. That is not acceptable right now, right? You can, all those things which can be controlled, which can be prevented, definitely needs to be done. But physical activity is something I would stress to each and every parent, because you're seeing a lot of cases with overweight, obesity, obesity related issues, mental health issues. That is all because of excessive screen time and poor eating habits. There is no proper schedule of any of the thing. And I mean, saying that to parents, obviously it is not it is going to be a big burden on them, because parents, they are facing a lot of issues, saying from COVID, their financial issues, work from home, their mental health issues, domestic problems. With that, children mental health is getting affected. That is my area of interest. I mean, how to cope up with the mental health problems which are faced by children during the pandemic. So a sincere request to all parents, please work on that, because if you're mentally not health, obviously you cannot be able to cope up with any COVID related issues which is going to happen. That is not in your hands. COVID related things, to some extent, it is not in our hands, because COVID is an aerosol infection. Eventually when you are going to go out, eventually you are going to be in contact with people. But COVID appropriate behavior, vaccination, and avoiding unnecessary outing, that is something which I definitely put a word parents.
Right.
So focusing on mental health of children, get them into physical activity, indoor activities, please increase and decrease screen time as much as possible.
Okay. Dr. Shweta, have you received any SOS calls from parents where their children have been affected? I had a former colleague who said her daughter is in a senior class and, both class 10, and she would have daily headaches from hours of online classes, and she was just, exasperated. What do I do? My child has a, board exam to give and school is closed, and this way of teaching is not working, but that is the only way. So, in some households, we've seen small toddlers become more violent, more cranky.
Yes.
They cry because they can't go out. There's nowhere to vent their energy. They can't bottle it inside, and they're fighting with their siblings. So huge problems are happening, and parents have work to do from home. They cannot, ideally, like what Dr. Meena is saying, it would be nice to engage them so that screen time reduces, but you gotta work. So, I mean, what do you do? What has been your experience?
Yes, thanks, Anisha. So I think Dr. Meena has summed it up pretty well. So the tip of the iceberg is the COVID, the health issues, and the rest of it is all this. Okay. So first, if I would get such an SOS call, and we rightly do so. Okay, mother is helpless. Actually, to be frank, even we are helpless. What do we say? Okay, what do we say to her? Then we sort of, sorry for using, we try to become gyan givers. Okay, so because we know that somewhere along the line, yes, of course, we need to rule out any organic illness. Is the headache really related to any health issue? Okay. Of course, if I'm able to examine the child physically, I would be very happy to. But because of this pandemic issue, first I would rule out any organic illness. Is it related to any disease or anything? Like I think Dr. Shalli was telling, along with the COVID, we are seeing other cases also, other diseases also coming up. So first I would rule out if the child is actually having any illness. Okay. So then coming to anything else. Okay, is it something else? Is it related to screen time? Is it being locked indoors? See, of course, the parents here, it's not only the children, the parents are also getting affected. Stress due to jobs, some of them have lost their jobs, need to maintain, one parent came to me telling, this child is going to be, I thought he'll go to school in few months. This is 1.5 years back. A 3-year-old child is supposed to be in the school. Now he's going to be with me for the next 2 years. The parent was so much in trauma, like, I can't even put him in childcare. There's nobody to come and take care in the house, so I have to take care of the child. I have to work. So mental health in parents is also important. Screen time in parents is also important. Okay, we can't say, oh, you give only 1 hour screen time to your child while the parent is nicely Netflixing and Amazon priming, So it's important for parents also to know, okay, as a family. Now, this is not only I will do this to my child, I will decrease the screen time to my child. It is as a family. The whole family needs to be positive, okay, that they need to know that things will be better. Okay, when I'm receiving such calls for non-health related issues, I say, be positive, not COVID positive, be mentally positive. Things will be better. As a family, you need to engage. Okay, it's difficult to say, make your child play a game. As a family, you engage, do indoor games, do some activities, do
Meeting ID
read,
double
read
eight six
to your
four
child,
329 0479.
Yeah, I
inculcate a
think I,
hobby,
yeah,
inculcate a hobby. Okay, teach your child. All of you paint together. All of you learn a new art together. Learn music
Money Singh.
together. I dare say do family yoga. Now, if you're specifically telling, headache, I'll say, drink some water, do some breathing exercises. All of you milke do yoga. Don't make the child do this. Okay. Set, of course, screen time. Set because of so much screen time. Screen time, we have our pediatric guidelines where say below 2 years of age, zero screen time, but now screen time has become the norm. Okay. So we need to accept that, set mild rules, set protocols, that this is the amount of, you can't set rules and say, no, this you can't do, this you can't do, this you can't do. What will the child do then? So, set some timeline. You will get your chocolate, you will get your time, you'll get your screen time, but this is the amount of time. Okay. And I think in India, always mental health has been, like a taboo. If I suggest go take your child to a child psychiatrist, nobody's going to accept. Okay. So I think slowly, even as pediatricians, as parents, we need to accept that not only, again, sorry to just, pick up a phone and be like, give gyan. There are people for that. There are people who have degrees, who will help you, child psychiatrists, child psychologists, who will actually help you, okay, out in that. So I don't think parents should hesitate, speaking to a child psychiatrist right now. This is the era where we need help. Not only children, even parents need help. And of course, like Dr. Meena said, parents should lead by example. They should be role models. Before we correct our children, before she's doing this, my son is doing this, we need to correct our parents as well.
Okay. Dr. Dhanya, how do we get a balance? Because like Dr. Meena said, please don't take your child forcibly to the street vendor to have golgappas, or avoid unnecessary social gatherings. But what is the safe thing that you can do with the child? They're not restricted inside, but they can do something safely, which positively impacts their health. Like for my children, my daughter wakes up in the morning and we cycle together, or we take a walk together. There are not many people in the mornings, and we wear a mask, and we're doing this. But they haven't seen their nana nani for months now because they had COVID. And nana nani se milna hai, nana nani se milna hai, bua se milna hai. So how do we draw a balance? This is safe, we can do this, and this is completely not done. Any tips there?
So most important, the first tip that I would say is listen to your children. What happens is parents don't realize, though they are also under stress, children are also under stress because of these online classes, inability to play out. So it is important that you should let them vent out and talk to you. So talk to your children. That is the first most important step, and connect with them. It should not be like, when you talk, you should try to build a positive environment around. Secondly, as you said rightly, you have been cycling with your daughter, going for morning walk. So that's great. So basically, spending time with children, that's the second important part. So spending time, maybe, just even if it's basically, it should be quality time. It's not about number of hours or number of minutes. It's about, doing something together and connecting with your child. So, it's not when you come home, did you do the homework and just about academics. So how was your day and what did you do? Something like that. and how are your friends doing. So just inquire if they're in contact with they're in contact with their friends. I guess many of the children have phone access where they can contact their friends if they want to go to some place. Basically, if if you teach them COVID appropriate behavior, I don't think it's like, I mean, they cannot visit their relatives. In fact, they should be encouraged to be in contact with relatives as well as their own friends. That interaction should not stop. I mean, COVID should not come in between that. So that is my.
All right. Right. But Dr. Vasteep, what would you like to say? Like, doing a Zoom call with friends on birthdays is different than going to hug your nanny, who you haven't met for months together. What it could be done in a safe manner? Like, you could go and play a game of badminton in a park where nobody's there. Wouldn't that be safe? I mean, would that be unnecessary exposure? What do you feel, Dr. Vasteep? What could be done safely?
I think what you're doing is wonderful. You're going for a ride with your child in the morning, and that is fair enough. If the child is very young, don't mask the child. Below 5 years, avoid masking the child. And you can. There are other things also, like children may not get that interpersonal touch when on Zoom. We have a relationship with our parents, with our in-laws. So on the Zoom, we build on that. However, they have nothing much to build on. It's one-to-one interaction that is important. So I guess what is the way out is for protecting, if the grandparents are immunized, if you all are immunized, and if you are COVID negative and you're sure you're negative, there's no harm in meeting them, I guess. Now we should loosen a little bit. For how long will we stay frightened? So with precautions, we should allow children to meet with select people whose behaviors they can vouch for, we can vouch for, and we know that this person will not be going out unnecessarily, is immunized. That is at least we should begin doing that for now.
Right. Dr. Krishna Kumar, do you think it's safe for a few friends to gather in the park, play a game of football or play badminton? Would that be safe, or would that be risking taking too much of a risk at this time?
If you are pretty much sure that your group is very responsible citizen, they are behaving according to the COVID protocol, then playing with them is not a big issue. I think, like, we are living in the apartment and our colleagues are doctors, and they are behaving outside of the campus or outside of the home appropriately as per COVID protocol. So in the evening time, we sit together with the COVID protocol, making physical distancing, and we used to talk, we do yoga, and we do same time we can play. And I used to play badminton with the two colleagues, each other, making physical distancing. That is not, I think, any problem. If we are very much sure that the particular group is behaving appropriately.
Okay. So last word. I'll take a last word from all of you because we are going to conclude this session soon. So Dr. Tanya, last word. Your advice for parents on how they can keep their children safe and how they can keep their children happy during this tough time.
Okay. I also represent the Indian Academy of Pediatrics as a national task force member for COVID. So I just want to reassure parents that COVID continues to be mild in children. About 95% are mild. Do not panic. But at the same time, be alert. So if there are symptoms, do be in touch with your doctor and about the red flag signs, etc. And continue to build up the culture of COVID appropriate behavior for your child so that they are ready to face the outside world, especially when the schools begin. So they are also confident in wearing masks and performing hand hygiene, etc. And talk to them in their age appropriate language and maintain a positive environment in the house. And of course, encourage the physical activity and do not panic.
Do the physical activity yourself. Be a role model because it's better showing them than just telling them, right? Dr. Yadav, your closing comments. What can parents do to keep the children safe?
I would, yeah, definitely. I would like to request parents, please behave as like a responsible citizen, because if you are safe, then your family will be safe. That is the final comment. Don't worry about the kids, because if you are safe, you are behaving appropriately, then your kids will be safe in the home.
Dr. Shweta, your last yarn for all parents.
Thanks, Anisha. So again, like Dr. Dhanya and Dr. Yadav have said, role models. I don't know if everybody. I say SMS. I've picked it up from somewhere else. You know, you should tell children sanitize, mask up, social distance. So I'll be like SMS. Okay. So the parent should just be like SMS. You know, they should SMS. The child should SMS. Prepared and not panic. Know the symptoms. Know the danger signs. Know the first aid. Learn from your pediatrician. Have an emergency contact number. Contact your pediatrician if required. Vaccinate appropriately. Just a small addition that in the first wave we said, you know, like delay the vaccines, and now we are saying if you don't want to come out, okay, but do schedule your vaccines accordingly. That's very important. Don't delay your vaccinations. Good nutrition, good fresh homemade food. Avoid malnutrition, at the same time avoid obesity as well. Some outdoor activities are allowed. Mental health, anxiety, loneliness, antisocial behavior needs to be tackled. All this, yes.
Thank you. Dr. Meena, what would you like to say in conclusion? We want our children to be happy. We want them to be safe. As parents, what can we do? Dr. Meena, you muted. Could you please unmute yourself?
Yeah, most of my colleagues have summarized it, and I would like to tell the parents, okay, do not panic, but yes, you have to be cautious. And as I said, the first thing what you can do is get vaccinated, because that will break the chain of transmission within your family. Because you, as a working person, you're going out, you could be the source of infection for your children. So that needs to be done. And look after your, pick up early signs, and do not delay taking treatment, because many of the things go out of hand when you don't act promptly within speculated time. So that is very important. And don't hesitate to take teleconsultation, or be in touch with your pediatrician, because they can guide you in any of the doubts, and in case there are something which needs to be tackled. I mean, even in the small percentage, if your child requires any medical care, that can be done quickly if you're in touch with your pediatrician. Do not hesitate. Take help and look after your mental health as well as your child mental health. Do everything in moderation. Have lots of, spend quality family time with your kids, because that is the biggest advantage as parents you have got during the lockdown, as well as diet and exercise. Everything in moderation should be fine, and be cautious. Be aware of what is going on. Don't be yeah. Do not be ignorant about what is happening. Don't put a blind thing to saying, fine, this cannot happen to me. It can happen to anyone. This COVID has told us that irrespective of the gender, socioeconomic status, it can affect anyone. So don't be ignorant. Don't deny the facts. No, be aware of the facts and try to face it.
All right. And Dr. Awasthi, your last words that you would like to tell to children if they're hearing you, to parents, how would you like to reassure them?
Well, won't repeat what my colleagues have said, but they have to accept that COVID is there. It will stay for some time. We don't know for how long. So we have to integrate all the behaviors in a positive way into our lives and into our lives of children, so that we continue to grow and evolve and stay safe for X number of months, or perhaps a year or so, and come out safe at the end of it. Vaccination is important, and I think we should never ignore that COVID will not happen, or it has gone, or it will go. Be prepared, be alert. Thank you.
All right. A big thank you to all of you for sparing the time and joining us. Hearing from you, parents would be better informed and perhaps less stressed about the health of their children. Thank you so much. And thank you for taking care of children all through this pandemic. Children are the center of families, and you have taken such great care of them. Thank you so much. We would like to thank you for joining us today. And we have also anthem for all the doctors for this gratitude week that we are celebrating. We want to thank doctors for the wonderful job they have done during the pandemic, and they continue to do so. A big thank you to all of you.
Thank you.
Thank you.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
करेंगे तो दूसरी तरफ चिकित्सक और चिकित्सा कर्मी की सेवा को, उस अहर्निश सेवा को कभी भी नहीं भूल सकते. तो मुझे विश्वास है कि हमारे जो ऐसे कोविड वॉरियर्स जिन्होंने अपनी प्राण की आहुति दे दी, मैं ऐसे बहुत सारे अच्छे अच्छे डॉक्टर को जान रहा हूँ. इसलिए आपने जो कहा है इसको निश्चित रूप से मैं अपने ऊपर जिम्मेवारी पूर्वक इस बात को कैसे आगे बढ़ा सकते हैं, मैं जरूर विश्वास करिए कि मैं इसको बढ़ाऊं.
आप मेरी ओर से, मेरे मंत्रालय की ओर से ये सभी फ्रंटलाइन फाइटर को उनका मैं अभिनंदन करता हूं, उनको धन्यवाद देता हूं. जिस तरह से उन्होंने इस पैंडेमिक में काम किया, ये तो सराहनीय काम था. और इनके वेलफेयर के लिए जैसा आपने कहा कि आयुष मंत्रालय कभी पीछे नहीं रहेगा, हम हर रोज आपके साथ रहेंगे, यही मैं आपको कहना चाहता हूँ।
कोरोना योद्धा के नाम पर अगर ये डॉक्टरों का अगर एक मेमोरियल हो जाता है, बहुत ही अच्छी बात है। आपका सुझाव बहुत अच्छा है। मैं हेल्थ मिनिस्टर डॉक्टर हर्षवर्धन से बात करूंगा, माननीय प्रधानमंत्री नरेंद्र मोदी साहब को भी एक पत्र में लिखूंगा, और बहुत सारे डॉक्टरों ने लाखों लोगों की जान बचाई है। इसलिए कोरोना योद्धा के नाम पर डॉक्टरों का एक मेमोरियल जो है, इनकी डेथ डॉक्टरों की हुई है, ऐसे डॉक्टरों का एक मेमोरियल जो है, ये मेमोरियल बनाने के लिए जरूर भारत सरकार की तरफ से जरूर हम कोशिश करेंगे।
Common man has so much faith in doctors. Ever since I've grown, like I can talk about my parents, me, children. Doctors are your first contact, and you always contact them, and there's a very long emotional relationship with them. So definitely, there has to be a celebration around it. There has to be. So we will do that celebration around it also.
Dr. Kamal, I have noted down your point, and whenever you actually put across this proposal, kindly also keep me in the loop. We can approach the Honorable Health Minister Dr. Harshvardhan, who is himself a very senior medical professional, and in fact known in India as the man behind the Pulse Polio program. And I'm sure he understands the nuances of all that we are discussing. And I'm sure we could be able to carry it forward. Very noble thought of yours.
Welcome back to another session of Gratitude Week from the 1st to 7th July. This is Ayush Sadhu Council's Thanksgiving Marathon for 7 days to thank our healthcare heroes for their untiring efforts and service to the nation during the hard times of a pandemic and carry this gratitude in our hearts forever. Now, the topic for this Expert Explains awareness session is Will COVID make you bald? Now, many of you must be thinking, well, it's a matter of life or death. If you're infected with COVID-19, is hair fall really a big issue? Now, hair fall can become a problem because as we understand more about this virus, we are getting data that cases of temporary hair loss in COVID-19 recovered patients has spiked quite significantly. COVID-19 impact on health and well-being of COVID recovered patients uh, in a big way. The impact on the health is very large. And the additional stress of hair loss adds to the already mountainous burden of stress that people are already undergoing during the pandemic. If you're losing hair, you will have self-confidence issues. This just adds to the stress that you're already undergoing, and this stress really undermines your physical well-being as well. So is this hair loss very worrisome and irreversible? What can you do to save yourself from the situation or, if possible, reverse the damage? We have a set of experts joining us right now to discuss this. And we are very thankful to OakNet Healthcare for supporting us in this discussion today, because we want to reach out to many of those people who may have recovered from COVID, but they really feel that they've not completely recovered. There's some or the other nagging issue that is still troubling them, and hair fall is one way we have seen is one big nagging issue for COVID-19 recovered patients who would have overcome the virus, but there are some lingering symptoms. Now, please welcome our panelists, our esteemed speakers who will be discussing this issue. Please welcome Dr. B.S. Chandrasekhar, Chief Dermatologist and Managing Director, Cutis Academy of Cutaneous Sciences. Please welcome Dr. Gaurav Bhaskar, Dermatology and Cosmetic Surgeon, BSC Hospital. Dr. Pooja Mittal, Dermatologist and Cosmetologist and Founder, Astha Skin and Laser Center. Dr. T.N. Rekha Singh, Dermatologist, Cosmetologist and Trichologist and Founder, AV Skin and Health Clinic, Secunderabad. Dr. Deepak Patel, Dermatologist, Neil Skin and BD Clinic and Love and Care Hospital, Surat. And Dr. Neeraj Goenka, Skin and Health Transplant and Hair Transplant Surgeon, Goenka Skin Clinic and Hair Transplant Center, Surat. A warm welcome to all of you, ladies and gentlemen. Thank you so much for sparing the time to join us and talk to us about this issue that is now coming up, that we have recovered patients talk about this. So let me start with you, Dr. Rekha. What have you seen in your practice? Is this anecdotal, or is there really some truth to this, that there is an increase in the number of patients who have seen hair loss?
Yeah, definitely. Though hair loss is not a life-threatening concern, but I see in my practice that this concern is growing more and more, and it is overwhelming for me to see more and more people coming to me with hair loss. And this I see more often in people who have already suffered with COVID. Let's say 1 or 2 months later or 3 months later, they come to my OPD with tremendous hair loss, which they have never experienced in their earlier times. So I feel it could be because of the stress associated with the COVID situation as such. We have a condition called telogen effluvium, wherein the hair is shed from the growth phase to the shedding phase abruptly. This happens because of the various stressful factors, one of the major cause being any febrile illnesses. And we all know that COVID-19 starts with fever and other respiratory symptoms. And also the panic that is associated with this condition, the family stress, or the financial burden, if somebody is getting hospitalized, all put together, definitely we see a tremendous rise in hair fall concern. And they do not take it very lightly. They definitely come back to the doctor because they have alarming increase. If it's a normal hair loss, normal hair shedding, probably they try to do something at home, follow home remedies, grandma's advice, still it continues and they immediately come to the doctor. And there have been several studies, and Indiana College of Medicine, which they have done a study. They have done a retrospective study. They have studied around 5,000 plus patients who were affected with COVID, and they saw that at least 33% of the people had suffered severe hair loss. And the people who come to hair loss with OPD, there was 400% increase in rise. So I was just looking at the numbers from other countries as well. So we are not behind. Even in India, people are taking this as a serious concern, and they are coming to the dermatologist with a concern.
So 30% is a huge number for COVID recovered patients who have been suffering from this. Dr. Chandrasekhar, what have you seen in your experience? Because the way I see it, the first way we just locked up everything, we just shut ourselves in, and we just tried to save ourselves. At that point of time, we never thought of meeting a plastic surgeon or a skin doctor, or those were not important for us. What are you seeing now for those who recovered from COVID-19? I would feel that there would also be some relief of having recovered. But Dr. Rekha has said that 3-4 months after having the COVID episode, are people coming to her? What are you seeing in your practice?
Okay, normally when it comes to hair loss, what Rekha identified is correct, but there are additional reasons why the patients come for hair loss. Number second is the drugs used in COVID treatment. They themselves can cause hair loss. People inadvertently take ivermectin tablet to prevent COVID, to prevent the initial stages. Ivermectin is a very big drug which can cause hair loss. Number second point, patients who are with us who are taking treatment for hair loss, if they get affected by COVID, they stop the treatment. The best example is androgenetic alopecia, where you cannot stop minoxidil for more than 5 days at any point of time. With so much of stress of COVID, normally if they suffer from COVID, probably they would not take anything for 14 days till they recover from COVID. So that leads to hair loss. There can be a coincidental hair loss. Probably we have seen COVID, the family suffer from COVID, but the patient comes with hair loss. Number four, probably the stress related to COVID. As Dr. Rekha already told, there's a huge amount of stress. We know that stress affects two highly metabolic tissues in the body. One is a bone marrow, second is a hair papilla, dermal papilla, which are highly metabolically active tissues in the body. So naturally, any stress arrests this hair growth. The anagen phase of the hair, which is 85% of the human scalp at any given point of time, suddenly get arrested and they start falling. So these are some of the additional reasons why hair loss is there. Of course, acute telogen effluvium, as Rekha said, is one of the most commonest presentation. I agree with her that we see around 30 to 40% of patients with hair loss are coming post-COVID. Plus, the acute telogen effluvium, normally we used to see after about, say, about 8 to 12 weeks after any viral illness. But here, surprisingly, I'm noticing it happens within 3 to 4 weeks. Patients are coming in 6 weeks, which is not expected to happen in any viral disease or any bacterial disease, which is for a long duration. So these are some of my observations. So there are a lot of dimensions to hair loss in COVID era and COVID time.
Yeah, but you've seen patients come even on 6 weeks after
yes,
having COVID.
That happens.
Right. And, Dr. Patel, what have you seen in your practice? Are you seeing patients coming later, much later after COVID? Because the body takes its time to recover from this disease. Like some people are bouncing back quickly, some people are having symptoms that last for much longer, something which is called as long COVID also. What are you seeing in your practice? And does this hair fall fit into the definition of long COVID?
Actually, we have already observed that there is excessive telogen effluvium. There is a loss of excessive hair loss because of stress. And this stress is not only in the patient, but relatives and even parents or even a child suffering from any type of infection in COVID time, they develop a stress. And this stress is maybe due to the psychological stress. Sometimes it may be due to the drugs. Already sir said that there are so many drugs like Tamiflu or Remdesivir, Ivermectin. These all drugs are causing a hair loss. And even this stressful time in all family member, even one death in a family can also create the stress to the whole family, and it creates a hair loss. We know that this hair loss is a temporary. It will be definitely recovered within a 6 to 9 months. But for that, we require some assurance to our patient, and it gives a proper treatment, and then we can give a better result in a telogen effluvium. So it is a definitely stress drug related, and that proper counseling is very required. Definitely it will be recovered.
All right, so that's good news. This is temporary and not permanent. Dr. Bhaskar, when patients come to you, do they seem very stressed and upset about the hair loss? Or are they just not sure if they've done something to get there? Stress is obviously an important factor leading to this hair loss, but you can't just wish it away. So, what is the way out? Can anybody do something to prevent this kind of hair loss?
Yeah. Hair loss is commonly seen nowadays with post-COVID patients. And due to stress, obviously, they are getting hair loss due to medications, what they have got during the COVID time. Then the financial stress is again there. Family stress is there. So first of all, I ask them to have a good diet. They should get all the nutrients in the diet that are required for hair growth. Secondly, they must go for stress relieving activities like exercises, yoga, meditation. Also, they can go for certain nutrient supplements are available that can help in growth of the hair. So stress relieving exercises, sessions, yoga sessions, they are good to relieve the stress. And apart from that, we can add nutritional supplements to reduce the hair loss.
Right. Dr. Mittal, what have you seen in your practice? At what stage are people coming to you? Have they tried something? Have they waited for some time for perhaps the hair to grow back? At what stage are they coming to you after they have acquired the COVID infection?
See, there are many patients. I'm seeing lots of hair fall patients. They are not only post-COVID, even the relatives, as all other doctors, all other colleagues are observing, even the relatives, even normal people, whether they have had COVID or not, they are experiencing hair fall. So initially, 1 or 2 months, they normally don't come to doctors for hair fall. They say that it must be temporary or it will go on its own. But when it is not getting better with home remedies and all, at that stage they are coming to us and for further like blood test or for any other investigation or any other additional medication which can help to decrease the hair fall. So these kind of patients we are seeing, and very less patients are coming at very early stage. Mostly they try to heal their own hair fall at their own places. When it is not working, only then they are coming to us.
Right. Dr. Chandrasekhar, is there any direct correlation between the impact of coronavirus on our body and the hair follicle? Or is this indirectly because of stress that or the usage of the medicines that patients experience hair fall?
No, disease itself can cause hair loss because any acute viral illness which goes for more than 5 to 7 days can lead to a telogen effluvium called acute telogen effluvium. But take a scenario of COVID. COVID is a special variety of a disease. See, it starts once you become RT-PCR positive. Immediately, I think anybody on the earth would have a stress and anxiety of COVID. What will happen to me in another 14 days? They will start counting days. Today is first day. What happens on third day? What happens on fifth day? What is on seventh day? What is on ninth day? What is on 11th day? Am I okay now? What is happening to me? So this kind of constant stress is one of the factors which leads to this kind of hair loss, because we know that acute telogen effluvium is one of the reason is this. The second important point, the drugs which are given, we already told. And the most important point is the rest of the things what we did not see till now. See, COVID is related to immune activity in the body. The immune suppression is there, overactive, cytokine release is there. At this point of time, there can be deregulation of our immune system and lead to a new onset of hair loss. I have seen patients of alopecia areata developing alopecia areata after COVID. They were all right there. There was nothing. There was no family history, nothing. But suddenly they started developing alopecia areata patches. So there is some immune mechanism which is going on to develop autoimmune hair loss diseases. What we are talking now is a telogen effluvium, which is a normal, and an androgenetic alopecia, which is hereditary. But autoimmune hair loss like alopecia areata can be an onset. So as you consider both the disease itself as well as the stress related to disease, which is unusual really, because so many deaths you see, social media is exacerbating all these things, exhibiting deaths, exhibiting the dangers around the COVID. So all these factors have added, and it's a real problem. The COVID, post-COVID hair loss is a real problem, and we are facing such daunting task to convince patients. Of course, the counseling is the one which really matters a lot. I think that we'll discuss later.
And Dr. Chandrasekhar, I just want to clarify. You said that COVID can trigger alopecia areata in Dr. Chandrasekhar,
Hello?
can you clarify? Could you clarify, Dr. Chandrasekhar? Are you saying
Yeah.
that because of COVID, because of the immune response, they can, patients can have alopecia areata because as a consequence of COVID? They may not have had it before, but they have it because
Yes,
the immune
yes.
system has.
It's a because alopecia areata has got multifocal etiology, pathology. One of the most important factor for alopecia is immune dysregulation as well as stress. So both are happening in COVID. You can expect a lot of other autoimmune diseases coming up over a period of time now. We are already seeing a lot of coming up. So similarly, alopecia areata also.
Dr. Rekha, have you seen this in your practice as well?
Yeah, I totally agree with Dr. Chandrasekhar sir. As he said, now COVID-19, the understanding is still evolving, and we all know that there is a lot of immune change that is happening in the body, and we all know that alopecia areata itself, one of the causes is immune dysregulation, and we never know, there could be some kind of inflammatory change going on at the root of the hair follicle, and nowadays we see more of flares of alopecia areata. Like the disease was quite senescent, quiet, lying down low there, well under control without any medications, and suddenly something happens, and then you see new episodes of alopecia areata coming in. Not only that, I would like to add that even androgenetic alopecia, which is in common terms that which we call as baldness, that also we see that people are coming back with sudden increase in the hair fall or slight worsening of the grade of balding also. As Dr. Chandrasekhar said, I said that definitely I agree with him, and I understand, and there may be some immune change definitely happening at the level of hair follicle as well, which is causing all these things.
Right. I think Dr. Chandrasekhar mentioned that if somebody gets COVID and they are taking the COVID treatment for 14 days, they also stop their medicines. If they were taking any medicines for hair loss, they also stop the medicine. So, Dr. Patel, I wanted to inquire from you. Some patients may already be taking immunosuppressants to manage the autoimmune issues like alopecia areata. When they get COVID, should they stop the immunosuppressants? And what about vaccination? If you want to take a vaccine, should you also then stop these immunosuppressant drugs that you're taking? And what could be the impact on the hair loss?
Basically, all these autoimmune disease, they are basically involve immunosuppression, and they all are on the certain immunosuppressive drugs like methotrexate, cyclosporine, or certain biologics. Usually during this COVID time, they stop it, and that may definitely create some problem at the hair follicle level. This hair follicle is a single unit in which there is a different type of ingoing, outgoing supply of the vessels are going. So there is a capillaritis develop at the root of the hair follicle. There is also oxygen supply in each follicle in a different way. So in COVID situation, what happens? The oxygen starvation and even a nutrition starvation of the hair follicle develops, and even a certain drugs can also create a problem. So these immunosuppressive drugs definitely create some problem in hair follicle, and that leads to a telogen effluvium. Even the people believe that it's a myth that stopping of the immunosuppressive drugs that will be helpful in a hair loss, but it's actually basically a myth. Vaccination have no role with a hair follicle, so vaccination should be advisable to the all immunosuppressive patients, and that can be helpful in such a patient like any patient who is on the immunosuppressive drugs.
So what you're saying is, Dr. Patel, that they should go for the vaccine, but
yeah, they should go.
But if they were taking immunosuppressant drugs to keep their alopecia areata in check, then should they stop it and then take the vaccine? What is your advice there?
Yes, at least for if there is an active lesion of the or active COVID-19 is positive, then for certain time they should stop the immunosuppressive. After the recovery from the COVID, they can again start immunosuppressive.
All right. Dr. Chandrasekhar, you wanted to add something?
Yes. Vaccine and COVID, it's a very right question you have asked, whether immunosuppressants go with vaccine or not. See, we have different categories of drugs in immunosuppression. For example, if you take a methotrexate drug, which is commonly used by dermatologists across the globe, you need to stop the drug for a week. Take a vaccine. Continue your drug. If you are on a cyclosporin, which is a main immunosuppressive, don't have to stop anything. You please go ahead with the vaccine. When you are on biologics, you don't have to stop any biologic, except if you are on infliximab, which is rarely given nowadays. Secukinumab is given, then adalimumab is given, etanercept is given. These are TNF alpha inhibitors and the cytokine blocker biologics. You have absolutely no problem. You can continue to take vaccine. And post-COVID, it's already resolved. Whatever you are, whether you're an immunosuppressant drug or not, you have to take vaccine only after 3 months after the recovery from COVID. These are the guidelines for the vaccination in COVID.
Mm-hmm. So vaccination is definitely one of the points, but Dr. Mittal, what Dr. Chandrasekhar is explaining about, the immunosuppressants are not built same. And what you may be prescribing to your patients, they're not, say, what would be given to a kidney patient, or, they're not the same. So is then the advice to get in touch with your doctor when you're going in for a vaccine? What would you say? Because, there is this, people will find any excuse to not take the vaccine. I have been taking painkillers for so long. I have a bad knee. No, I won't take this vaccine. How can I stop my painkillers? So people find all excuses. What would you say? For people who are taking medicines for alopecia areata, what would you say?
See, like Dr. Chandrasekhar very beautifully explained the role of immunosuppressants and vaccination. See, like in alopecia areata, we normally start with oral steroids. That too on a pulse therapy, we rarely give everyday steroids in alopecia areata. So in that case, patient can take his routine weekly dose, and after that, they can go for vaccination. There is no need to stop omnacotil or any other steroid for vaccination. And definitely patients are making so many excuses. I don't want to take vaccine because I'm on this medicine, I'm on that medicine, I have gone there, but all these are excuses. They are hardly meaningful. So you should always go for vaccination, but you can, there is no need to specifically stop any medicine. Like Dr. Chandrasekhar said, you can stop methotrexate for 1 week, and all those things we can choose, and we can always encourage patient to get vaccination.
All right. Dr. Bhaskar, if a patient stops his medicine, the immunosuppressant medicine for the week, and then gets back to it again, does it impact his hair fall at all in the interim? Will there be a significant rise in the hair fall?
Yeah, if a patient was already taking treatment for hair fall and he stops the treatment due to anything like COVID, or patient says that due to financial issues he was not able to take it. So yes, definitely it will affect. Minoxidil is a kind of drug which is applied topically, and it affects the hair cycle. It helps to maintain the anagen phase of the hair. So if a person is not applying minoxidil for a week or two, the hair will start going back to the telogen phase, and hair shedding will again start. So due to withdrawal of the drugs that were keeping the hair in the anagen phase, patients get hair loss. So it is not recommended that patients should stop the medicine.
No, but say for whatever period they had to stop because COVID is serious, or they decided to take the vaccine, how soon can they get back? And then, can they minimize the impact of that period where they were not able to take the drug? Dr. Bhaskar.
Like for the supplement and for the minoxidil, if they are applying for hair loss, they can again start it back. It won't affect, but it will be restarted. If they were on some immunosuppressive like cyclosporin or for alopecia areata or anything else for alopecia areata, so they'll have to consult their dermatologist to again start the immunosuppressive medication.
Right. Dr. Rekha, when a patient comes to you a few weeks after COVID and suddenly starts experiencing a lot of hair fall, generally how long will this last? And you said this is temporary hair fall. How much time does it take to get better? What medicines would you have to take? What care will you have to take?
Yeah. So I think this is a very apt question, because the first answer that our audience would like to know is about this. Now, one thing is they need a lot of hand holding from the doctor. So we need to assure them, as Dr. Deepak has said, we have to tell them that it's a temporary thing. The hair loss due to COVID or any other acute virus illness or any stressful condition, basically telogen effluvium, can last from 6 to 9 months. And sometimes it may extend a little more. So the first thing that we do as dermatologists is we handhold them, assure them, give them good dietary advice, and many of them are already taking some vitamin D supplements, multivitamins, vitamin C. So we can check their complete blood picture to see that their hemoglobin is normal or not. And those who are vegetarians especially, we check for vitamin B12, vitamin D. And if those who are already hypothyroid or any other thyroid abnormalities, we see whether the thyroid hormone is maintained within the normal limits or not. And then we assure them, and we put them on supplements basically containing certain important amino acids which are important for the growth of the hair. Put them on iron supplements if iron is low. B12, supplement them with B12 and vitamin D. And we do have some serums like protein serums containing mainly certain things like Capexil, which we give them, we offer them to apply daily. And we tell them that you have to improve your diet, maintain healthy lifestyle, exercise, have a good sleep, and try to have positive thoughts, and then go on. So the duration, generally it takes around 6 to 9 months.
All right. So we can safely say, Dr. Mithal, that this is reversible, right? It isn't something that is going to stay with you forever. You can reverse it.
I'm not able to understand.
Yeah, the question is that this is reversible, right? The patient shouldn't worry on that point.
Yes, definitely. It's a reversible condition and it's a treatable condition. So there are many things which we can't properly treat. So it's a treatable condition. First, the most important part in the treatment of telogen effluvium in post-COVID patient is assurance that your hair will come back. They are not going to leave you forever. So rest, we are giving them medicines. We are, as Dr. Rekha said, we are telling them to de-stress their body by exercise, by meditation, because this is the main reason for post-COVID hair loss. So first we should address this. Rest of the things definitely going to help, like hair supplements, hair solutions. They all are going to help the patient in a long way.
Right. Dr. Patel, what protocol do you follow? Somebody is coming to you with, presenting with temporary hair loss after having suffered COVID. What protocol do you follow? What's your advice to them?
Basically, assurance to the patient that it is a temporary condition. We have to take care of oxygen, blood supply, and nutrition. So for improving the oxygen, at least we have to advise them certain type of yoga or exercise or physiotherapy for the whole body. Even for nutrition point of view, already Dr. Rekha said that biotin, iron, folic acid, and certain nutritional supplement already available in for hair growth. And for vasodilatation, minoxidil is the best drug of choice. Locally, we can apply according to the percentage, 2%, 5%, and 10%, depending upon the requirement. We can also give the certain peptides are available in the market that can be helpful for the hair follicle. And in this way, we have to assure properly and give a treatment for at least 6 months, and that will growth in this COVID situation.
Right. Dr. Chandrasekhar, how much importance do you assign to counseling? Because, all of you tend to agree that this, while there could be physiological changes, immune changes because of your body fighting the COVID disease, stress is playing a major factor in this hair loss that these COVID recovered patients are seeing. So how important is counseling? And who should do this counseling? Should the dermatologist do it? The trichologist do it? Should a trained psychologist?
So, dermatologist has to do it because dermatologist, a trichologist, and a psychologist too. Because we know the hair science better than anyone else. So in addition to the points told by my colleagues, I would like to tell you that we need to make people understand the hair cycle. So what is the hair cycle? Normally, what happens to the hair when it starts growing? And we also should make the patient understand that individual hair has got its own metabolism, its own life cycle in the scalp. For example, you take that the hair cycle, 6 weeks is the time for the new hair to fall and new hair to grow. But it cannot happen like that because individual hair is different on the scalp. So as Rekha said, you should tell 4 to 6 cycles of hair are required for you to come to a normal, number one. Number two, you should give live examples of patients who were treated for COVID or who were treated for acute telogen effluvium because of dengue, because of typhoid, because of malaria. Those patients have recovered. We all dermatologists have got profiles of patients with us. We have the records of patient. We maintain the records of the patient. You need to give live examples to them. So that's how you counsel. This is a patient who was suffering from hair loss. This is the density she had at the starting of the hair loss treatment with me. And this is what has happened over a period of 4 or 5 months. That's what you should say. The second, however you counsel, however you tell Anisha, unless you stop the hair loss, patient is not going to be happy. They'll stand in front of mirror, they will watch their pillow, they will watch their kitchen basin, they will watch their bathrooms. Everywhere you see hair in acute telogen effluvium. So you need to encourage the hair follicle because it is going in waves. As Rekha said, there are beautiful serums which can encourage, like caffeine derivatives are there, capaxyl derivatives are there. We all know about this science. We need to make the patient use it properly because sometimes if you don't advise the patient how to apply, how much to apply, where to apply, they will not do it. So I have seen patients, if they use it correctly, the derivatives of caffeine or a capaxyl or some other serums which are available, they will be able to come out of that acute phase in a matter of 6 to 8 weeks. That's where hand-holding patient for at least for about 2 to 3 months is very crucial. And in case if you see there is too much of stress, then you will have to evaluate for depression, you will have to evaluate for anxiety. So you will have to evaluate if you find that we have a questionnaire. Life Index questionnaire is.
All right. Yeah, I think the questionnaire sounds like a good option for you to evaluate your patient and then decide, whether, what other steps could the person take for their mental well-being. We also have Dr. Neeraj Goenka now joining us. Dr. Goenka,
sorry, I was busy in some work. Sorry, I was late.
No, but what the panelists have so far said is that post-COVID-19, recovered patients are having temporary hair loss. It's quite significant. Some of our practitioners here have seen a 30% increase in the number of cases coming to them. And Dr. Chandrasekhar, Dr. Rekha has also told us about, what could be the treatment protocol, including counseling. In your experience, what have you seen? And one question that I had to you, Dr. Goenka, is that, at the time of a pandemic, how do you consult with your patients? Can you assess their conditions on the telephone or through video consultations? How are your patients coming to you these days?
You're talking about the telephonic consultation?
Yes, I want to know, if our patients coming to you with a complaint of hair fall, how do they reach to you? Do they meet you in your OPD or are they doing telephonic consultation?
Hey, right now the situation is a little bit better. Like a month ago, it was definitely more of the telephonic consultation because the COVID severity was more. But right now we don't see that much of the telephonic consultation. More of the patient, they are coming like face-to-face OPD consultation. Most of them, they are coming in this scenario. And now we are allowing the face-to-face consultation in the OPD. So that was your question. Sorry, I was not able to understand.
Yeah, so the question was on, how the patients are coming to you and what you are seeing with your patients. Are you also seeing an increase in temporary hair fall?
Yeah, definitely. Even in the mild COVID situation, they are coming with severe hair fall. Even in they say that they had gone through a mild COVID, just 2% or 5%. Even they are having a hair fall after 2 months. So sometimes they are not explainable, but they have severe hair fall. So again, all seniors said, the nutrition supplements, psychological evaluation, the minoxidil or capixil serum. But one thing I want to add, sometimes we need to give anti-anxiety drug also when the patient has severe depression or severe anxiety. So we need to add some like alprazolam or some antidepressant. And when they are in severe depression, sometimes I also send for a psychological evaluation to a psychiatrist.
Mm-hmm. Definitely, that's something that Dr. Chandrasekhar also mentioned. Dr. Patel, for you, can you correctly diagnose the condition of a patient through video consultation or through teleconsultation, or do patients have to necessarily come and meet you face to face?
Basically, when the patient came to our OPD patient, we explained that proper hair cycle, that this hair cycle remains for 2 to 6 years. One hair follicle have a 3 phase: anagen, catagen, and telogen. Anagen is the active phase, telogen is a transit phase, so there is an increase of transit phase, so there is a telogen effluvium. So don't worry, this is a temporary problem. So we reassure the patient, and they came into the patient by face to face in OPD. Then we explain the whole thing in our computer also, or explain the hair cycle properly and give a proper scientific way treatment in the form of systemic drugs, even local application, and if required, certain aesthetic procedures to our patient.
But can this be done in a teleconsultation mode? All that you have said, the counseling that you've done, the explanation that you've done, the diagnosis that you've done, can this be done remotely?
On telephonic, we cannot diagnose properly, just assurance we can give. If they come to our OPD, then we can do a trichoscopy, or we can diagnose by our own clinical examination, and then it will be helpful.
Right. Dr. Mittal, is it safe to step into psychologist clinic to get yourself evaluated at this time? Should people think about that, or should they start their treatment as soon as possible?
I didn't get your question, Anisha.
My question is, what are safety protocols that you are following so that patients can, easily step into your office and get themselves assessed? Should they have hair fall problems? Because there is this hesitancy about meeting doctors or seeking this treatment as well, considered vain by some people. Oh God, it's only hair fall, but for people who are suffering or going through it, it's a big problem. So can they safely go and get themselves assessed?
See, it's better always. See, skin is such an organ in which when you examine the patient properly, only then you can make the proper diagnosis. With teleconsultation and with telephonic consultations, we can just reassure to some extent, but we cannot properly diagnose and we cannot properly assess the patients. So I normally feel that patients should come to doctor so that they can properly check the scalp, they can get their blood tests done, they can evaluate so many other things to guide and to reassure the patient properly. So this is my opinion regarding teleconsultation. I'm not very much satisfied with my teleconsultation. I normally tell patient to come and show me.
Right. So Dr. Goenka, can people do something themselves so that they do not have severe hair fall? I mean, not taking stress is obvious thing to do.
I'm not getting your voice very clear. Your voice is not clear, ma'am. It's not
right.
Very clear.
Dr. Goenka, my question was that what can people do to stave off hair fall? What can they do to avoid hair fall if they're recovering from COVID-19? Can they do something themselves? Not taking stress will obviously help them, but that's easier said than done. So any home remedies, any dietary changes, anything that people can do on their own to try to reduce the hair fall.
So you're talking about the COVID situation or in general?
I'm talking about hair fall. Like I've recovered from COVID. I'm not sure if I should meet a doctor about my hair fall. What can I do? Will putting hair oils help? Will taking particular supplements help? Can I do something on my own as a first attempt?
Kind of prevention post-COVID, right?
Yes, so that I don't have hair fall.
So it's always a positive attitude first, stressless thing, and accept the COVID and try to go through it. you have to be positive that you are recovered well. And then definitely a best nutrition, exercise, yoga, some therapies which keep you calm. Nutrition, you can then add iron like green leafy vegetables and beet if he or she is a vegetarian. And then they can add biotin supplements and exercise, yoga, daily routine. They can do some activities which reduces the stress and help build up the immunity. It helps the less of the hair fall problems.
Right. Yes, Dr. Chandrasekhar, please go ahead.
This is one of the important things and the message we have to give to our patients. Yes, you can do at home. Number one, you need to care your hair like a baby hair now. So you cannot use harsh shampoos. You cannot use shikakai. You cannot rub your scalp very badly. So you need to go for something which contains lauryl sulfate shampoos or the shampoos which are available with caffeine, which are available with amino acids. They are called anti-hair loss shampoos. They are freely available across. You can just go to the net and get it, number one. Number two, you should know what is hair-rich diet. Hair-rich diet is the diet which contains amino acids, microminerals, and vitamins. See, normally in our diet, we don't have so much of microminerals. So you need to have, number one, what is hair-rich diet? To supply proteins, you can have egg, you can have soya, you can have badam, soaked badam. So to get a microminerals, you can have apples, you can have pomegranates, you can have green leaf vegetables to get iron. So this is what sprouts, very, very important to have that supplemental zinc. So as a patient, you should be able to take this balanced diet, what I said. These are the two principal things. And as Dr. Goenka said, stress. Stress, probably a family support should be there and a dermatologist support should also be there. Teleconsultation, you can definitely counsel the patient, but they take a very long time. They take about 30 minutes, 40 minutes. Patient will speak, next father will speak, daughter will speak, husband will speak, and you cannot have such a big patients to counsel patients. So they have to come to the clinic. And you were talking about the precautions in the doctor's clinic so that the patient comes in. I promise you that every doctor across India, irrespective of the specialty, are following the protocols for COVID. They have a sanitizers, they have a screening desk, they have a fumigation in the clinic, and recently we have ion disseminating device called Shaikocat.
All right, yeah.
The device called Shaikocat, which has got ionized particles coming and sterilizing your clinic to an extent of 99.99%, which is approved in European countries. So these are the measures every doctor has taken. So there should be no worry or no fear for the patient to come into the doctor's clinic. I'll tell you, they are more safe in the clinics rather than outside. That is the level of protection doctors are taking in India.
So I think, Dr. Rekha, nobody should, family members should not give you snide remarks. Hair fall hi to hai, kya ho gaya? Why are you taking risk? Kabhi to cover kiya hai. You know, it is not a small thing to be brushed under the carpet or dismissed by other family members, isn't it? You need the family support as well.
Yeah, so you're absolutely right, because I see many of my patients who tell us that when I ask them, why didn't you come to me earlier? Why have you been waiting so long to see a dermatologist? So I get the same answer which you have told me right now. They say ki hair fall hi to hai, humne samjha tha ki kam ho jayega. So in fact, if you start taking the concern seriously and start treating it early, the earlier you start interventions, the better are the chances of recovery of hair. So I feel the other family members should take care of the patient's diet if somebody is affected with COVID, which everybody does. There's nothing new in it. And they have to seek early dermatologist consultation, whether it is through teleconsult or face-to-face consult once they recover. And as our colleagues have said, teleconsultation definitely has its own limitations, but surprisingly now I see that my patients want to come and see the doctor. They like to discuss things in person, and that makes our job easy because we have dermoscope in hands through which we can examine the scalp thoroughly, arrive at the diagnosis. We can tell them in what situation the scalp is right now. And there are certain scalp conditions which go unnoticed without the dermoscopic examination, which you cannot see through the naked eye. So we can counsel them. And definitely when the patient comes to the clinic, mother, father, spouse, the family member is also going to accompany the patient. So it is it becomes easier for us to counsel both the patient and the attendant together, so that the family can give a good support. And the foremost, and another thing which I want to add to the discussion is, I advise them not to fall for those magic potions which promise overnight hair regrowth, because this is the era of media, and there are so many things coming up on internet. So they try shop. There is so much of online shopping going on. So they browse through hundreds of products. They ask us whether they can use this, that. So it takes a lot of effort for us to counsel them. So if they come face to face, I think that one thing can be taken and that can be addressed if we see us. So I would say that whether it is teleconsultation or face-to-face consultation, early consultation with the dermatologist would definitely help those patients who have hair fall post-COVID. And second thing, coming to the family support, dietary supplements, like Dr. Chandrasekhar sir has said, protein and micronutrient supply rich food has to be taken. They should take care of their adequate sleep, because we know that inadequate sleep can also have certain effect on the hormones. Exercise, following healthy lifestyle. If somebody is smoking, they have to cut down on smoking. Alcohol, though it doesn't have a direct effect on the hair fall, cutting down on such things would also help them.
Right. Dr. Patel, in this session, Dr. Rekha told us that the treatment extends between 6 to 9 months. How much time does it take for patients to make a full recovery? I mean, get a good crop of hair. You may be taking medicines for 6 to 9 months, but by what time do you see, hair growing back and it all looks much better?
Basically, this phase is for at least 6 to 9 months. So, first of all, we have to explain our patient that it will take around 6 to 9 months for a proper recovery. Every monthly counseling is important. Every monthly they have to come to OPD for examination. Never use any head conditioner or head shampoo. Only mild shampoo or shampoo which contain a caffeine, that can be helpful. Certain peptides and minoxidil, that can be helpful. Already sir said that high rich protein food, that can be helpful. So these are the common advices we give, and assure that definitely it will recover. It's a temporary phase and it will take around 6 to 9 months.
But Dr. Patel, does the recovery or the regrowth of hair start during the treatment itself? Like once you start taking the medicine, or by when can the patient hope to see some effect after starting the medicine?
Yes, on dermoscopy we can see the baby hair after 2 months of the treatment, and gradually we give a proper treatment that will be helpful, and definitely results are there.
Right. Dr. Mittal, when your patients come to see you, do you like it or ask them to get the family members as well, or just treating the patient is enough so that this problem is addressed completely?
See, normally patients come along with their family members as well, because it's a thing which normally everybody in the family is experiencing. Like if one person of the family is having hair fall, the other person are already observing their hair and all those, the stress the patient is facing because of hair fall. So they normally accompany the patient and they come to us and they want the good solution for their problem. So we normally tell them, like you said, that how much time will it take to get the full growth and full normal when the patient come back to normal. See, normally everybody knows that it will take 6 to 9 months, but it depends upon the length of the hair. If the patient's hair are very long, like in females, so that normally that length will take some time. So initially, first thing will be that there will be the number of hair will be falling less. The hair fall is getting better clinically. And then we can see baby hairs within 2 to 3 months. And they will grow like the growth of hair is around 1 to 2 inches in 1 year to 6 to 12 months. Like, so it normally takes quite a long time. It's not only 9 months. Even after that, you have to take care of your hair so that they will grow healthy and they will acquire the desired length, whichever patient wants to get.
Right. I'll come to Dr. Chandrasekhar. One question to Dr. Goenka also. Dr. Goenka, what is the state in which the patients come to you? Like Dr. Pooja Mittal is saying, for a woman to have long hair will take time. Do they come with some skepticism? मैंने सारे तेल मल लिए, बादाम भी रोज खाती हूँ और देखो कुछ हो नहीं रहा है, आप क्या कर दोगे? Or do you face any frustration? It's taking too long. So how do you manage the patient expectation? Dr. Goenka, you're muted. Could you please unmute yourself?
Yes, sorry. So there are so many patients, they come with home remedies going on. Most of the patients, they do something at home, like whatever. This can be Ramdev Baba treatment or something. They do something, and then later on, when the hair fall is really severe, then they come to us. Then they say they want to treat like we can do in 15 days or 1 month, or now we did everything. What else you are going to do? It's not treating
like
them
magic.
just.
So they expect
Yeah,
to have a magic wand.
now as they come to doctor, they need magic. They expect that the allopathy is like wonder, and they have done everything Ayurvedic, homeopathic, and they expect from us that we are magician and will treat them in 15-20 days. So first thing we explain is just trust us and have a patience. Patience is the first thing they have to have it. It's definitely going to be there. We have to counsel them. Counseling is really, really important. Explaining the cycle, explaining the phase, and explaining the giving them the real hope that they are definitely going to get it. So sometimes it's frustrating. They are behaving like we are allopathic doctor and will treat them as a magician. So sometimes it's frustrating, but explaining in a proper way and counseling them in a proper way gives a fruitful results along with treatment.
All right. Dr. Chandrasekhar, you wanted to add something, sorry.
Yeah, regarding the patient expectations, we need to have a timeline for the patient. What is this timeline? Recovery of hair loss is 6 to 8 weeks. Improving in the bald areas about 3 to 4 months. Then density of the hair getting increased at about 6 to 8 months. The length of the hair would take 18 to 24 months. I'll tell you simply because your hair grows 1 centimeter per day. Okay, sorry, per month it is 1 centimeter. So it takes so much. If you want to grow 12 to 14 centimeters of hair, you need to wait for 1 year, 1.5 years. But if you tell the timeline to the patient, arrest of hair loss, then closing of the bald areas, increase in the density, then ultimately length of the hair. So this is what exactly the patient has to be told. If the timeline is told, the patient will not be so much wary about it, and they will be counseled to a greater extent. That's what I wanted to tell.
All right. Dr. Chandrasekhar, you had mentioned something about, giving an example to a patient. So I want to come to you, Dr. Mittal, and ask you, like if you're giving an example to a patient saying that he had dengue or he had malaria and he had this and now see he's recovered. So could support groups help patients? Would you encourage this? Do you lead them on to any support groups where they can talk with each other? That gives them hope. 9 months, a year, it is a long time. But if they've spoken to somebody who's already recovered, so they feel more reassured. Do you support groups?
टिश्यू पेपर से कर करना दिन में 2-3 बार करना, बस यही ऑप्शन है. बार मॉइस्चर बहुत लगा के
Dr. Goenka, I would request you to please mute yourself. Please mute yourself, Dr. Goenka.
Sorry.
Yes. Please go ahead, Dr. Mittal. Do you think support groups would help patients who are having temporary hair loss? So do you encourage them to find the support group?
Yes, support group is definitely going to help. See, every time patient comes to us, we give them medicine for few days. And when normally patient comes to us, we answer so many questions which he has, she has in his mind. After 1 month of therapy, again, they have fresh set of questions. So every time you have to spend time to counsel the patient, to tell them and to counsel their relatives as well that this is going to come back. This is a temporary procedure. If sometimes when patients are very much in stress, we can add some aggressive therapies like PRP as well. So single session or 2 sessions of PRP definitely going to arrest the stress which is going on at the scalp level. So that is also giving nutrition, and it will also help to recover, at least to stop the hair fall. So the New hair will take some time, but at least patient will clinically see that my hair fall has stopped. So now they are in hope that new hair will come up and it will be over in 6 to 9 months. So every time you have to counsel a patient, doctor, relatives, every time you have to sometimes add or delete few things in the treatment. So all these things help definitely.
Right, we've come to the close and we have very little time. So I'll ask each of you to give me 3 points that you would like to leave the audience with. The most important things they must do. So I'll start with you, Dr. Rekha, for somebody who's experiencing hair fall after COVID. 3 things that they should do.
Yeah, the first thing I would say is please fear not. Have patience because this is only a temporary hair loss. Here, the roots are not going to close forever. There is always a chance of hair regrowth. You should give your body some time to cope up with whatever stress it has undergone through COVID. So with the right nutrition, following the right nutrition, taking care of lifestyle factors, having good sleep, exercise, and consulting the dermatologist whenever you feel that it is not coming under control. So these would be my takeaway points for the audience for today.
Right. Dr. Patel, 3 things you would like to tell to the audience which you think is most important if they are facing a problem of hair fall.
Post-COVID hair loss is a most common thing we observe in our OPD. So it's a temporary, it definitely recovered. Second thing, it's you have to do exercise and good diet is very important. And third thing is consult your dermatologist or trichologist for a proper management of the hair loss, in which they can also offer a certain medicine, certain aesthetic procedure that will be definitely helpful for the regrowth. These 3 tips is I want to say.
Dr. Chandrasekhar, what would you like to say to those watching?
Believe the science of hair, what cycle it is, how it grows. Number 2, don't get trapped with the, all these advertising products to stop hair loss. And when it is in a dire emergency, don't forget your dermatologist who is a true trichologist. Please visit them. This is what I tell them.
Right. Dr. Mittal, what would you like to tell those who are having a stressful life because of hair loss? Stress has got them to hair loss and now they are stressed about hair loss. What would you tell them?
The 3 things which I would like to say is de-stress, right nutrition, and have patience. So this is a temporary thing and it's going to come back.
Right. Right. Thank you. And Dr. Goenka, what would you want to leave the audience with? How should they manage the issues of hair fall?
I think everyone has said the same thing. Patience, good diet, nutrition, immunity. One thing Dr. Chandrasekhar said that they should not believe in all the ads and there are so many gimmicks going on. Do this, do that. Just consult your doctor at right time and take a proper counseling about the hairs. Don't go through all these gimmicks. Just go to the right doctor at the right time. This will help you a lot. Thank you.
All right. A big thank you to all of you for joining us this afternoon and sharing with us your knowledge and your experience in what you're seeing among patients who recovered from COVID but are seeing significant hair fall. It's reassuring to know that this is only temporary. With the right treatment and right diet and lifestyle, this can be reversed and it's not the end of the road for all these people who have additional stresses to deal with. A big thank you to all of you for joining us. Please stay with us. We have our anthem that we want you to hear. We want to thank all doctors. Just hear this as well.
Hi, my name is Padamji Chelawat and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे, सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव पे। डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया। You are the real heroes, आपका शुक्रिया। Thank you.
Doctors who've joined us, and Kamal is with us for the next session. Kamal, over to you. I think you're speaking with an old friend, dear friend of mine, and former colleague in your next session. I look forward to hearing this.
Thank you so much, Anisa, for conducting this wonderful session, and really informative. We were getting a lot of comments from social media. People find this all the messages and the information shared by the doctors really important and useful. So thank you so much for all our doctors who joined us today, and we also show our gratitude to all of you, because when we see that the doctors who are kind of helping us on the front line, but at the same time you people also keep providing that important solace to all the patients and those who are suffering for different kind of issues, but they too equally damage their morale. Losing hair can be a big problem for somebody, and you people bring in the right kind of solution, help them. So we are really thankful to all of you for all the wonderful work which you are doing. So thank you so much. We will be having the next session in 5 minutes. In between, I would request my team to kind of play the glimpse of our Gratitude Week 2020, which we started last year. And thank you so much, all the doctors.
Hi, my name is Patanjit Sherawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, the doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है। काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी। डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया। शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे।
IHW के द्वारा जो ये आपने डॉक्टर्स डे पर, चिकित्सा दिवस पर इस कार्यक्रम का आयोजन किया है, मैं आप सबको हृदय की गहराई से आप सबके प्रति आभार व्यक्त करता हूँ।
Congratulating the Integrated Health and Wellbeing Council for this unique gesture to honor the doctors and other people in the medical community who are the most dependable resources to fight this pandemic.
7 दिनों में भाग लिया है, तो सभी का मैं धन्यवाद करता हूँ। और डे के अवसर पर दुनिया के सभी डॉक्टर को, भारत के सभी डॉक्टर को मैं शुभकामना देता हूँ, हार्दिक बधाई देता हूँ। जय भीम, जय भारत।
I would really say the doctors have actually risen to this challenge in this unprecedented times, and that is something which is very heartening, not only in our country but at a global level.
Doctors and nurses, they work tirelessly and never deny care. We salute them all and thank to them. They are our heroes and shine like a gem.
मिल जावा गुल बन के मैं खिल जावा इतनी सी है दिल की आरज़ू। अल्लाह के बंदे हंस दे जो भी हो कल फिर आएगा।
History shall bear witness that when the time came and humanity needed to be saved, it was the doctors who stepped up to answer the call of duty.
We actually really mean to celebrate this Doctors' Day with gratitude towards doctors, then I think we got to get together to support a true legislation and a strict legislation of against assault to doctors.
We need to be really serious about and have a rethink about the final delivery system we need to adopt about the delivery of healthcare. Should it be state versus the central?
By communication, having compassion, having empathy, feel the pain of the other person, then put yourself in that position. I always tell my residents, when patient walks into the outpatient, even howsoever overcrowded you are, overburdened you are, but you have no business to misbehave with anybody.
There is a lack of empathy. Probably that is one thing I can agree with that, but there are other issues that many times the doctor is helpless.
We need to talk to actual people in the Center for Disease Control, the virologists, people like you who are on ground. We need to understand and fight this scientifically.
सच मेरे यार है, बस वही प्यार है, जिसके बदले में कोई तो प्यार दे।
खूब लगा लो पहरे रास्ते रब खोले, तू न जाने आस-पास है खुदा।
तो आप सभी का ग्रेटिट्यूड वीक के इस खास प्रोग्राम में स्वागत है। मेरा नाम कमल नारायण है और मैं हेल्थ अवेयरनेस एडवोकेसी के एक प्रमुख इंस्टीट्यूशन ISW काउंसिल का CEO हूं। साथियों, हम सभी जानते हैं कि कोविड की इस महामारी की मार से बचाने में हमारे डॉक्टर्स, नर्सेज और मेडिकल फील्ड से जुड़े लाखों करोड़ों लोगों का एक मेजर रोल रहा है। यही वो फरिश्ते हैं जिन्होंने अस्पतालों, डायग्नोस्टिक सेंटर्स, फार्मेसीज, दवा और वैक्सीन के रिसर्च सेंटर्स और कारखानों में बिना रुके और बिना डरे जी जान से मेहनत की और कर रहे हैं जिससे हम बच सकें। इन्होंने अपने परिवारों की सलामती से पहले हमारे परिवारों की चिंता की। और इनके इसी जज्बे और सेवा भाव को सलाम करने के लिए और 1 अरब से ज्यादा देशवासियों की ओर से धन्यवाद देने के लिए ISW काउंसिल ने पिछले साल नेशनल डॉक्टर्स डे के मौके पर इस ग्रेटिट्यूड वीक की शुरुआत की थी। और मुझे खुशी है कि तमाम लोग इस पहल से जुड़कर इन कोरोना हीरोज को के लिए अपनी फीलिंग्स एक्सप्रेस कर रहे हैं, कोई वीडियो से, कोई मैसेजेस से, कोई इनके लिए गाना गाकर, और कई लोग इनके लिए परफॉर्मेंसेस करके। इसके बाद हमारे नेक्स्ट सेशन पे वी विल बी सीइंग सम ऑफ द आर्टिस्ट्स आल्सो परफॉर्मिंग इन ऑनर ऑफ दीज डॉक्टर्स एंड हेल्थ केयर वर्कर्स। लेकिन इनके साथ बहुत से ऐसे मददगार भी थे जो अस्पतालों में ना सही लेकिन घरों में, सड़कों में, अस्पताल के बाहर और यहाँ तक कि शमशानों तक में कोविड की मार से लाचार लोगों की सहायता कर रहे थे। और ये वो लोग थे जो तब मदद कर के लिए मौजूद थे जब उम्मीद के सारे रास्ते बंद थे। और ऐसे ही 2 कोविड समैरिटन्स आज हमारे साथ जुड़ रहे हैं। मैं स्वागत करता हूं दूरदर्शन के वेटरन जर्नलिस्ट और एंकर अशोक श्रीवास्तव जी का। इनका चेहरा भारत के हर घर में जाना पहचाना है। और हमारे दूसरे कोविड मददगार सामाजिक कार्यकर्ता दर्शन एन पोपट का। दर्शन जी ब्रज फाउंडेशन के संस्थापक हैं और इनकी संस्था हेल्थ के एरिया में भी एक्टिव का वर्क करती है। तो दर्शन जी और अशोक जी, एक बार फिर से आपका स्वागत है ग्रेटिट्यूड वीक के इस मौके पे। लेट मी स्टार्ट विद अशोक जी। अशोक जी, आप पत्रकार हैं। वैसे तो मैं खुद आज नर्वस हो रहा था आपको होस्ट करने में, क्योंकि आप इतने समय से लोगों को मतलब होस्ट करते रहे हैं अपने टॉक शोज में और अपने एंकर के रोल की तरह। तो जर्नलिस्ट तो अपने आप में ही फ्रंट लाइन वर्कर हैं, ऐसा हमारा मानना है। और इस दौरान जब कोविड-19 में ज्यादातर हम लोग घर में बंद थे, तो जर्नलिस्ट डॉक्टरों के ही तरीके बाहर जाकर के हम लोग तक बहुत हद तक एक सही इंफॉर्मेशन पहुंचाने की कोशिश कर रहे थे। और आप उसके एक वरिष्ठ मेंबर हैं। मैं भी उसका मेंबर हूं, थोड़ा सा जूनियर मेंबर हूं उस पत्रकार समुदाय का। तो आपने ये जो अपने मतलब जो रोजमर्रा का काम था जर्नलिज्म का, उससे आगे जाकर के मैंने सुना कि और देखा भी कि आप डॉक्टरों का कंसल्टेशन भी अरेंज करवा रहे थे, बहुत तरीके से हेल्प करने की कोशिश कर रहे थे सोशल मीडिया की तरीके। तो इसकी प्रेरणा कैसे मिली, कहाँ से शुरुआत हुआ ये सब?
तो जी पहले तो बहुत बहुत शुक्रिया, मुझे आपने बुलाया, अवसर दिया, और आपकी संस्था को भी बहुत कर रहे हैं और उसमें उन लोगों को शुक्रिया कर रहे हैं दरअसल जिन्होंने इस दुनिया को और भारत में लोगों की जान बचाने ऐसी महामारी के समय में काम किया। एक बहुत साधारण पत्रकार हूँ और जाहिर सी बात है कि हम पत्रकारों को भी एक समस्या से रूबरू जरूर होना पड़ा कि इस कोरोना टाइम में जिस तरह से डॉक्टर्स लगातार ड्यूटी, सुरक्षा कर्मी ड्यूटी पड़ते, उसी तरह फर्स्ट वेव में, सेकंड वेव में मुझे बहुत ट्रैवल भी करना पड़ा। मैं कश्मीर भी गया, लद्दाख भी गया, क्योंकि आपको याद होगा लद्दाख में कुछ जो है प्रॉब्लम शुरू हुई थी, तो मैं लद्दाख भी गया, कश्मीर भी गया, मेरठ, देहरादून, इस तरह की कई जगह पर मुझे जाना पड़ा रिपोर्टिंग के पॉइंट पे घुसे, ताकि लोगों की बात को समझ सके। जब मजदूर तमाम पलायन कर रहे थे तो मजदूरों की भीड़ के बीच में भी मैं गया। आनंद विहार बस अड्डे पर जब लोगों का हुजूम था, मैं वहां भी गया। वो सब चीजें देख करके हमको लगता था कि भाई वास्तव में लोग कितने परेशान हैं, और उसमें एक पत्रकार तब सिर्फ पत्रकार नहीं रह जाता, क्योंकि हम पत्रकार भले ही हों, रिपोर्ट जरूर करो, लेकिन कहीं ना, और खासकर कमल जी जब ये दूसरी वेव आई, जैसे आपने कहा, अच्छी देखी, मैंने देखा कि जो तमाम पत्रकार हैं काम किया, वो लोगों की आवाज बन गए। और मैं मानता हूं कि इसमें बहुत सारे ऐसे पत्रकार हैं जिनको आइडियोलॉजिकली या जिनको मुझे लगता है कि जिनकी पत्रकारिता में मैं अक्सर सवाल उठाता रहता हूँ, मैं उनका भी बहुत आभारी हूँ, क्योंकि मैंने देखा वैचारिक मतभेद कुछ भी हो सकते हैं, पत्रकारिता के तरीके अलग अलग हो सकते हैं, लेकिन मैंने देखा तमाम पत्रकार जो हैं उन्होंने अपने ट्विटर पे डीएम खोल दिए थे, कोई मैसेज आता था उसको वो मैसेज को फॉरवर्ड करते थे, सही अथॉरिटी तक पहुंचाते थे, क्योंकि ज्यादातर जो बड़े पत्रकार उनके ट्विटर हैंडल से उनके लाखों फॉलोअर्स हैं, तो एक बार जब वो ट्वीट करते थे किसी अथॉरिटी को टैग करके करते थे तो उसके रिजल्ट जो हैं वो तेजी से मिलते थे। ये सबसे बड़ा काम, तो इसी काम में मैं भी जुड़ा था, मैं भी लगभग यही काम कर रहा था। लेकिन कमल जी, बीच में मेरे साथ भी कुछ ऐसा हुआ कि जिसने मुझे मजबूर किया कि मैं इससे आगे का भी सोचूं, आगे भी करूं। दरअसल मेरे माताजी पिताजी दोनों कोरोना के शिकार हो गए और दोनों की उम्र बहुत है और दोनों बहुत गंभीर रूप से पीड़ित हुए। लेकिन मैं कमल जी एक बात कहूंगा कि जैसे समाज के हर वर्ग में एनजीओज हों, डॉक्टर्स हों, पत्रकार हों, नेता हों, पॉलिटिशियंस हो, हर वर्ग में अच्छे और बुरे लोग होते हैं। तो मेरा सामना कुछ ऐसे डॉक्टर से भी हुआ जो शायद अपनी डॉक्टरी पेशे का जो उन्होंने एक संकल्प लिया था उसको भूल गए, ऐसे लोगों से भी हुआ। क्योंकि जब मेरे माताजी पिताजी बीमार हुए तो मैं कुछ डॉक्टर्स के पास उनको लेकर भागा, तो डॉक्टर्स ने उनको देखने से मना कर दिया, कहा कि पहले कोविड टेस्ट करा के लाइए। अब रात को 8 बजे मेरे पिताजी, 91 साल के पिताजी, तमाम तरह की मुश्किलें झेल रहे हैं, उनकी स्थिति खराब है, डॉक्टर उनको देखे बिना ये भी बेसिक ट्रीटमेंट ना करे और कहते पहले कोविड टेस्ट कराओ, तो मैं कोविड टेस्ट कराऊंगा और 2 दिन बाद आऊंगा, तब तक क्या मेरे पिताजी जीवित रहेंगे? तो मुझे ऐसे डॉक्टर भी मिले। फिर मुझे कई लोगों ने बताया कि कुछ डॉक्टर्स ने सडनली फोन पर अपनी जो लोगों की मदद कर, जो लोगों के ट्रीटमेंट के लिए लोग कंसल्ट करते थे, एकदम से अपनी फीस बढ़ा दी। किसी की 800 रुपए फीस थी, उसने 1500 रुपए कर दी। तो ये सब कुछ चल ही रहा था। तो इतने में मेरे अमेरिका में एक मेरे मित्र हैं, उन्होंने मुझे संपर्क किया और वो एनआरआई हैं, भारतवंशी हैं। तो उन्होंने कहा कि हम लोग कुछ भारत के लिए कर सकते हैं क्या, मदद कर सकते हैं क्या? तो मैंने उनसे कहा कि आप लोग अगर कुछ कंसंट्रेटर भेज सके, क्योंकि मैं अपने माताजी पिताजी को बचा पाया क्योंकि मुझे कंसंट्रेटर समय पे मिल गया था, ऑक्सीजन कंसंट्रेटर मिल गया था। मैंने उनसे कहा बहुत लोगों को ऑक्सीजन कंसंट्रेटर की जरूरत है, आप वो भिजवाइए। तो उन्होंने कहा कि वो काम हम सेवा के साथ मिलकर कर रहे हैं और बहुत सारे कंसंट्रेटर हम भेज रहे हैं, इसके अलावा बताइए क्या कर सकते हैं। तो मुझे अपना एक्सपीरियंस याद आया, अपने दोस्तों का एक्सपीरियंस याद आया जिन्होंने कहा डॉक्टर्स की फीस बढ़ा दी है। तो मैंने उनसे कहा कि क्या हम कुछ डॉक्टर्स अरेंज कर सकते हैं फोन लाइन पर, जूम कॉल पर? उन्होंने कहा बिल्कुल कर सकते हैं। और उसके बाद कमल जी, मैंने 1 तारीख से 1 मई से जो हमने एक सिलसिला शुरू किया, हम रोज 1-2 घंटे की जूम कॉल पे करते थे। अमेरिका से डॉक्टर्स जुड़ते थे और हम लोगों को जुटाते थे। उसके लिए हम कहते थे आइए आपको फ्री कंसल्टेशन के लिए, जिसको जो तकलीफ होती थी उसको डॉक्टर्स वहां पर उसकी मदद करते थे। अब वो जो मदद करने वाले थे वो भी डॉक्टर थे। उन्होंने बिना कुछ किया, आप सोचिए कि अमेरिका में बैठे भारतीय डॉक्टर बिना एक भी फीस लिए, बिना कुछ कहे 2-2 घंटा वो बैठते थे और सिर्फ बैठकर के लोगों की बात सुनकर उनको सिर्फ बताते नहीं थे, अपना ईमेल आईडी देते थे, कहते थे आपको कोई तकलीफ हो अपना ईमेल आईडी मुझे भेज दीजिए, मैं आपको ईमेल पे भी आपको रिस्पॉन्ड करता हूँ और बताता हूँ, आपकी कोई रिपोर्ट है मुझे भेज दीजिए। और फिर हमें लगा कि इसको गांव तक ले जाने की जरूरत है। हम गांव में ले गए, देहातों में ले गए और पता नहीं कैसे ईश्वर की कृपा हुई और उसमें एक टीम जुड़ गई। पता नहीं कैसे जिन लोगों को मदद मिली थी उन्होंने कहा कि हम आपके साथ इस काम में जुड़ना चाहते हैं। तो मैं जहां अकेला था मेरे साथ एक बड़ी टीम जुड़ गई, उसको हमने सहयोग नाम दिया और उस टीम में लोग जुड़े। उस टीम में लोग गांव में जाकर अपने मोबाइल फोन ले जाकर के गांव में रख देते थे और जिसको जरूरत होती उसको डॉक्टर की मदद देते थे। और कमल जी, आखिरी में संक्षेप में बता दूं अपनी आखिरी बात, उसके बाद आप जो है हमारे दूसरे मेहमान
जी
तो उसके बाद क्या हुआ कि हमको लगा सिर्फ ये पहल यहीं तक सीमित नहीं रहनी चाहिए, जो समाज के लिए देश के लिए कुछ करना चाहते हैं, लेकिन हम हमारा चलता रहेगा। हम अब हर हफ्ते जो है इस तरह की मीटिंग, जूम मीटिंग कर रहे हैं, जिसमें एक हफ्ते भारत के डॉक्टर होते हैं, एक हफ्ते अमेरिका के डॉक्टर होते हैं और गरीब लोग जो कि डॉक्टर की फीस अफोर्ड नहीं कर सकते, हम उन तक पहुंच रहे हैं, उनको डॉक्टर की सलाह दिला रहे हैं। हमारी अगली कोशिश ये है कि जो गरीब लोग हैं इनको डॉक्टर की सलाह ही नहीं दिलाएं, बल्कि उनको फ्री में मेडिसिन भी दिलाएं। वो हमारा अगला कदम है जिसके बारे में हम लोग जल्द ही अनाउंस करेंगे सहयोग टीम के साथ मिलकर। जी कमल जी,
थैंक यू सो मच अशोक जी, बहुत ही बेहतरीन काम आप कर रहे हैं। मतलब ये मैं समझ सकता हूँ, जैसा आपने एक्सप्लेन किया कि आपके खुद के पेरेंट्स को जब हेल्थ केयर की जरूरत थी और आपको उन समस्याओं से गुजरना पड़ा, और इसके अलावा तो बहुत सारे लोग ऐसे भी थे जिनको अस्पताल या डॉक्टर से कोई कनेक्शन मिल ही नहीं पाया। मतलब उनको वो डॉक्टर्स से बात करने का कोई तरीका नहीं था, या अस्पताल तक भी नहीं पहुंच पा रहे थे, और अस्पतालों में जगह भी नहीं थी, और शायद डॉक्टर्स के पास टाइम भी नहीं था। हर तरीके की चीजें हैं। ये भी है जैसा आपने बताया कि कुछ केसेस में जब इस ऐसी आपदाएं आती हैं तो हमारे ह्यूमन नेचर का बेस्ट पार्ट भी निकल के आता है, और कभी कभी वर्स्ट पार्ट भी निकल के आता है। और जो बहुत सारी कालाबाजारी या कई सारी घटनाएं देखने को मिली, वो शायद उसका पार्ट थी। और जो डॉक्टर रात दिन मेहनत करके, और डॉक्टर्स ही नहीं, आप जैसे लोग, कई सारे लोग ऐसे भी थे कि जिनके घर की अपनी समस्याओं के साथ साथ दूसरों के लिए भी समस्याओं को दूर करने की कोशिश कर रहे थे। तो जो आपने शुरुआत किया एक बहुत ही शानदार कदम है मैं कहूंगा। और जो आपने कहा कि पहले आपने शुरुआत छोटे लेवल पे की, लेकिन लोग जुड़ते गए, तो मुझे लगता है कि इसके लिए भी वही है कि गॉड हेल्प्स दोज हु हेल्प देमसेल्फ, या हिम्मत मर्दा मदद खुदा। तो वो शायद आपका कारवां बढ़ता जाएगा और आगे और बढ़ता जाए, क्योंकि भारत में सिर्फ एक पैंडेमिक नहीं है, पैंडेमिक के साथ साथ बहुत सारी पैंडेमिक हमारे यहाँ वैसे भी चलती रहती है। और जब आप देहातों की बात कर रहे हैं तो बहुत सारे हेल्थ के ऐसे इश्यूज हैं हमारे यहाँ पर। बहुत सारी बीमारियों से लोग इस पैंडेमिक से बहुत ज्यादा तादाद में मरते हैं, हर साल मरते हैं। तो उनको भी शायद आप कुछ हेल्प कर सकेंगे अगर ये आपने जारी रखा। दर्शन जी, आप तो, अशोक जी तो पत्रकार हैं, समाज की सेवा इन्फॉर्मेशन से करते हैं, आप प्रोक्लेम्ड जो है सामाजिक कार्यकर्ता है। कैसे आपने जो है कोविड के टाइम पे लोगों की हेल्प करने की कोशिश की, क्या सारे तरीके आपने किए?
जी बस मैं बहुत कम समय लूंगा आप सभी का। और सबसे पहले धन्यवाद कि आपने इस काबिल समझा कि ISW के किसी लाइव सेशन में एक ग्रेटिट्यूड वीक में हमें शामिल किया, और बहुत बहुत धन्यवाद आप सभी का। और मैं अपना एक छोटा सा एक इंट्रोडक्शन देना चाहता हूँ। मेरा नाम दर्शन पोपट है। मैं सबसे पहले तो भारतीय हूँ, प्राउड इंडियन, एंड आफ्टर दैट एक गुजराती व्यापारी हूँ नवी मुंबई से, जो पिछले 21 साल से सिरामिक्स के बिजनेस में है। आज मेरी उम्र है 38 इयर्स, बट मैं पिछले 21 साल से, मतलब मैं 16-17 साल का था तब से मैं बिजनेस में हूँ। सिरामिक्स का मेरा बिजनेस है यहाँ पे नवी मुंबई में। कुछ कंपनियों में मैं पार्टनर हूँ, कहीं पे मैं प्रोप्राइटर हूँ, कहीं पे मैं फाउंडर हूँ। तो बस इस तरह से 21 साल से मैं बिजनेस कर रहा हूँ सिरामिक्स इंडस्ट्री में। और बाकी हमारे एसोसिएशन से भी मैं जुड़ा हुआ हूँ। मैं पहले 3 साल सेक्रेटरी रह चुका हूँ, और अभी मैं प्रेसिडेंट हूँ हमारे एसोसिएशन का। और नवी मुंबई व्यापारी महासंघ का भी मैं कोर कमेटी मेंबर हूँ। व्यापारों से जुड़े हुए जो भी प्रॉब्लम्स रहते हैं वो लोग हमारे पास लेके आते हैं। हम लोग उनको कुछ हेल्प करते हैं, बिकॉज इतने लोग पढ़े लिखे नहीं है हमारे व्यापार में। तो कहीं ना कहीं एक अवेयरनेस की कमी है, लोगों को नियमों के बारे में कुछ पता नहीं है। तो ये सब के लिए भी हम लोग को, मतलब हम लोग उनको हेल्प करते हैं। ये सब पिछले अप्रैल 2020 में शुरू हुआ।
फालतू परेशान, आप तो मुझे रोज ही परेशान करते हैं।
जी मेरा वॉइस
कर ले हमारे साथ नेक्स्ट सेशन। हिमांशु जी प्लीज।
ठीक है
हिमानी, कुड यू हेल्प? अच्छा, ओके। मेरी आवाज आ रही है आप सभी को? Am I audible?
Yeah, दर्शन जी।
Okay, so it's all started in April 2020. मतलब जब पहला लॉकडाउन हुआ था, तो मतलब इसके पहले हम ट्विटर पे कभी इतना एक्टिव नहीं थे। अकाउंट हमने 2011 से बनाया था। सबसे पहले हमारी मार्केट से हम शुरू करें। सीएम ने कुछ अनाउंस किया था कि कुछ माइग्रेंट्स लेबर को हम लोग राशन किट या वैसे कुछ फूड प्रोवाइड कर रहे हैं। हमने एक एसोसिएशन से लेटर लिखा और ट्वीट वगैरह किया, बट कुछ उसका फायदा हुआ नहीं। और आखिर में हम लोग ने एसोसिएशन में मिलके यहाँ से 150 जो माइग्रेंट्स लेबर थे, जो रोज कमाते हैं रोज खाते हैं, उनको हमने राशन किट प्रोवाइड करके दिए। और फिर ट्विटर पे आके हमने देखा कि यहाँ पे तो ये प्रॉब्लम काफी लोगों के है, मतलब काफी रिक्वेस्ट पेंडिंग है, काफी लोग पहुंच नहीं पा रहे हैं। तो हमने वो एक बोलते हैं ना, एक मिसिंग लिंक जो गवर्नमेंट और पब्लिक के बीच में एक मिसिंग लिंक थी, तो वहां पे हमने काम किया। और मतलब अप्रैल 2020 से आज करीबन 15-16 महीने हो गए। अभी तक ये कार्य हमारा चालू है। राशन प्रोवाइड करवाना या फिर मेडिसिन प्रोवाइड करवाना, अंडर प्रिविलेज लोग है, ब्लड प्लाज्मा है, बेड्स बीच में शॉर्टेज थी तो बेड्स हमने करवा के दिए थे, ऑक्सीजन कॉन्सेंट्रेटर्स है, ऑक्सीजन है, कुछ किसी के सोशल इश्यूज है, या फिर बीच में कुछ लोग हमारे यूएई में फंस गए थे, जैसे बहुत सारे हमारे लोग जो थे वो वहां पे लास्ट ईयर फंस गए थे, तो उनको भी हमने गाइड किया थ्रू एक वंदे भारत मिशन करके जो अपना एक ये था, इसके अंतर्गत हमने प्रोटोकॉल के हिसाब से उनको इंडिया लाने में हमने काफी लोगों की मदद की। और अभी भी जॉब पे हम लोग काम कर रहे हैं सर, क्योंकि एम्प्लॉयमेंट ही ऐसा है कि ये नेक्स्ट पेंडेमिक एम्प्लॉयमेंट का ही है। सो अगर रोजगार होगा सभी के पास तो ये सब रिक्वेस्ट और ये सब जो चीजें हैं वो आना हमारे पास रिक्वेस्ट कम हो जाएगी।
थैंक यू सो मच दर्शन जी। मतलब एक व्यापारी होने के साथ साथ आप एक अच्छा सामाजिक कार्यकर्ता की तरीके भी काम कर रहे हैं, और शायद ये जो सामाजिक जो है सहयोग की भावना है वो ऐसे ही होनी चाहिए। और व्यापारी वर्ग में सबसे पहले ये होता है कि जो वर्ड आते हैं ना, प्रॉफिटेरिंग और कालाबाजारी और इस तरीके की चीजें होने के चांसेस होते हैं कभी कभी, लेकिन आपने एक बड़ी अच्छी मिसाल पैदा वो की है, सबके सामने रखी है, और आपके एसोसिएशन ने, आपके आसपास के जो बाकी व्यापारी हैं जिन्होंने मिलकर ये काम किया, बहुत अच्छा काम है। और आई एम श्योर जो आपने कहा कि ये जो नेक्स्ट पैंडेमिक शायद अनएम्प्लॉयमेंट का होगा, तो उस पर आप कुछ किसी तरीके से हेल्प कर रहे हैं, वो दैट इज अ ग्रेट थिंग एंड वी आर रियली थैंकफुल अबाउट इट। अशोक जी, आपने जैसे डॉक्टर्स तो मतलब इंडिया में भी बहुत सारे डॉक्टर, हमारा एक जो है एक पार्टनर संस्थान है, उन्होंने स्टेप 1 करके एक इंस्टीट्यूट शुरू किया, जो कि 19 की शुरुआत में शुरू किया, और उसका जो आज भारत में करीबन एक समय था सेकेंड पीक में कि एक दिन में वो 65,000 कॉल्स अटेंड करते थे कोविड-19 के पेशेंट्स का, जो होम आइसोलेशन में होता है, और करीबन 8,000 डॉक्टर्स, भारतीय डॉक्टर्स, जो है वॉलंटरली बिना किसी पैसे के और बिना किसी इंटरेस्ट के, मतलब दिल्ली के पेशेंट को कोच्चि का बैठा हुआ डॉक्टर उसको रोज सुबह शाम फोन करके बताता है कि कैसे आपको रहना है, कोई समस्या है तो आप उसको बताइए, जो कोविड के आइसोलेशन के पेशेंट होते हैं, वो स्टेप 1। तो ऐसे बहुत सारे लेवल पे लोग कर रहे हैं, लेकिन आपने न सिर्फ भारतीय डॉक्टरों को बल्कि यूएस के भी डॉक्टरों को इस पे पूरी उस पे जोड़ा कि जो है इस तरीके से आप लोगों तक पहुंच सकें। तो कितने परिवारों तक आपकी ने जो है हेल्प करी होगी इस पूरे दौरान?
कमल जी, मोटे तौर पर अगर हम देखते तो हम करीब 1500 परिवार हैं जिन तक हमने अपनी मदद पहुंचाई। ये वो तमाम लोग हैं जो सीधे जुड़ते थे, क्योंकि मैंने देखा जैसे आपने और तमाम संस्थाएं जो हैं वो अपने अपने तरह से प्रयास कर रहे थे, लेकिन मुझे लगा कि थोड़ा सा मैंने जो अपना मॉडल अपनाया था, मैंने उसमें सोचा लोगों को थोड़ा पर्सनल टच की जरूरत है। और ये आपने जो होम आइसोलेशन वाला बताया, देखिए बहुत इम्पोर्टेंट, क्योंकि डॉक्टर्स जो हैं, जाहिर सी बात है, जितने डॉक्टर्स, जितने हॉस्पिटल, जितनी हमारी हेल्थ सर्विसेज थी, उन महसूस कर रहे थे कि वर्कलोड उनके ऊपर आ गया। तो ऐसे में मैं बैठा डॉक्टर है और वो भारतवंशी है, भारत के लिए कुछ करना चाहता है, उसके अंदर ये भाव था, तो हमने उनको कनेक्ट कर दिया। और जैसा मैंने कहा कि हम लोग जब रोज करते थे तो हम लोग ट्वीट करते थे, लोगों को ट्वीट पे कहते थे, सोशल मीडिया पे कहते थे कि आपको कोई समस्या है तो अपना नंबर भेजिए, वो हमें अपना नंबर भेजते थे, हम उनको एक व्हाट्सएप ग्रुप में जोड़ते थे और शाम को उनको लिंक दे करके उनको सीधा डॉक्टर से कनेक्ट कर देते थे। और इस तरह से करीब जैसा मैंने करीब 15 लोगों को हमने मदद करी, और इनमें से बहुत सारे परिवार, मुझे लगता है कि मतलब हम तो सिर्फ एक जरिया बन रहे थे, वो डॉक्टर सेवा करना चाहते थे, यहाँ पे लोग थे जिनको मदद की जरूरत थी, और हम तो सिर्फ एक सेतु बने, सेतु का काम किया। लेकिन इस सेतु बनने के बाद लोगों का जो प्यार मिला, लोगों का जो अथाह जो हमें रिएक्शन मिले, उसने मुझे बहुत भावुक कर दिया। और तभी मेरे मन में आया कि ये जो चीज है, ये जो कोशिश है, ये रुकनी नहीं चाहिए, क्योंकि देखिए जितने मदद के हाथ होंगे, लोग तकलीफ में आज की तारीख में, जितने मदद की जरूरत होगी, जितने हाथ होंगे, उतना अच्छा है। और फिर अल्टीमेटली कमल जी, हम लोग को जो ईश्वर ने ये जो जीवन दिया है, जो मानव का जीवन दिया है, अल्टीमेटली ये सिर्फ इसलिए तो नहीं कि मैं नौकरी करूं, कमाऊं अपना प्रोफेशन में और उसके बाद घर चले जाऊं। देश के लिए, समाज के लिए कुछ ना कुछ जिम्मेदारी जरूर बनती है हर एक की। तो मुझे लगा शायद ईश्वर ने मुझे इस काम के लिए चुना है। तो अब जो है मैंने सोचा है कि ये सिलसिला बिल्कुल चलता रहेगा और इसी तरह से हम लोग हजारों हजार लोगों की मदद करने की कोशिश करेंगे। और जैसा मैंने कहा कि हमारा अगला स्टेप जो है, हम लोग लोगों को फ्री में मेडिसिन भी देंगे, गरीब लोगों को जो मेडिसिन अफोर्ड नहीं कर सकते। और सपना मेरा ये है कि हम लोग आज 1, 2, 3 साल बाद गरीब गांव में बैठा व्यक्ति जिसको ऑपरेशन की जरूरत है, अगर हम उसको दिल्ली अपने खर्चे पे लाकर उसको ऑपरेशन करके वापस स्वस्थ करके उसको उसके घर में भेज देंगे, तो मुझे लगेगा कि हमने वास्तव में जो कोशिश करी वो किसी न किसी अच्छी मुकाम तक पहुंची है। और ये सपना जो है हम लोग सच करेंगे। और आप सब लोग भी जैसे लोग हैं आवाज पहुंचा रहे हैं लोगों तक।
आपकी बात सुन करके ही मुझे ये भरोसा हो रहा है कि आप डेफिनेटली इस काम को अंजाम दे पाएंगे, क्योंकि आपका एक अपना फैन फॉलोइंग भी है और एक क्रेडिबिलिटी है। और अगर आप उसको यूज करके इसे एक सही रास्ते पे और सोशल वर्क के लिए, सोशल इम्पैक्ट के लिए यूज करने की कोशिश कर रहे हैं और एक ऐसे एरिया में यूज करने की कोशिश कर रहे हैं। हमारा ISW काउंसिल में जो पूरा मेन मोटो है वो यही है कि लोगों तक एक होलिस्टिक हेल्थ, जो गुड हवा, अच्छी हवा, अच्छा पानी, अच्छा खाना और अच्छी स्वास्थ्य सुविधा, ये एक होलिस्टिक हेल्थ, मतलब ऐसी हेल्थ नहीं कि पहले आपको कैंसर हो जाए फिर आपका कोई ऑपरेशन करा दे। क्योंकि हम कोशिश करते हैं कि या ऐसी एडवोकेसी करते हैं लोगों को इस ओर चलने की ओर जो है प्रेरित तो नहीं करते, पुश करते हैं कि आप होलिस्टिक हेल्थ की तरफ सोचिए, जिससे कि आप बीमारियों को ठीक ना कर रहे हो, बीमारियों से बचे हो, बीमारियां आपको कम आए। तो जो जिस एरिया में आप काम कर रहे हैं डेफिनेटली बहुत ही इंपॉर्टेंट और बहुत ही रिक्वायरमेंट वाला है। लेकिन एक चीज मैं आपसे फिर दर्शन जी के पास जाता हूँ, एक चीज आपसे ये पूछना चाहूंगा कि इसमें चैलेंजेस क्या आए। मतलब मैं देख रहा था कि और कई बार ऐसा होता है कि अच्छा काम करने वालों पे निकलने के लिए भी ना बहुत सारी समस्याएं आ जाती हैं और ऐसा कई बार देखा भी गया है, कई बार बैकलैश भी होता है। मैंने भी देखा एक आध ट्विटर वगैरह में कि आपके बारे में लोग लिख रहे थे। तो ये क्या इनको आप एज ए चैलेंज मानते हैं, एज अ ऑब्स्टिकल मानते हैं, क्या कहीं ये डिमोरलाइज करते हैं कि नहीं नहीं आप जो अपना काम कर रहे हैं उस पर आगे ना बढ़े, या जो है यू टेक इट एट इन योर स्ट्राइड?
देखिए, जो आपने बिल्कुल सही कहा, इस तरह की चैलेंजेस आते हैं, लोग कई कई तरह की बात करते हैं और लेकिन मुझे लगता है सबको तो कुछ नहीं आप कर सकते, क्योंकि बहुत सारे, अब देखिए जो लोग मैसेज भेजते थे शुरू में, जो आपने चैलेंज की बात की ना, शुरू में सबसे बड़ा चैलेंज ये था कि मैं अकेला था। अब मैं एक ट्वीट करता था और मैं ये कहता था कि कल जो है हमारे साथ फलाना डॉक्टर जुड़ेंगे इतने बजे, अगर आपको कोई भी कोरोना कले की मदद चाहिए तो आप अपने नंबर हमें भेजिए। तो धड़ाधड़ धड़ाधड़ लोग नंबर भेज देते थे। 50, 60, 100 नंबर जो है, उनका नंबर जो है ट्विटर से लेकर के उनको सेव करना, उनको सेव करके उनका एक ग्रुप बनाना, तो ये सब बड़ा लेंथी काम होता था। इसमें पूरी पूरी रात, कई बार रात सुबह के 4 बज जाते थे करते करते, तो ये चैलेंज होता था। लेकिन उसके बाद भी बहुत सारे लोग, उसमें अगर एक किसी का नंबर छूट जाता था तो वो अलग अलग तरह की बात करने लगता था कि आप लोग घरपोसला कर रहे हैं, आप ये करो। तो इस तरह की चीजें ट्विटर पे होती थी। लेकिन मुझे लगता है ये एक चैलेंज भी होता है और ये एक आपको मजबूत भी बनाता है, क्योंकि पर मैंने इस बीच एक बात और सीखी कमल जी, इंटरेस्टिंग बात सीखी। मैं ट्विटर पे कभी किसी को ब्लॉक नहीं करता था, कभी भी नहीं। मुझे लगता है जैसे मुझे किसी की आलोचना करने का हक है, सामने वाले को भी किसी। लेकिन मैंने देखा कई बार इस तरह की जो ताकतें हैं, जब आपको एकदम से आपके दिमाग पर सीधा असर डालती है ना, आप तो लगे हुए एक काम में, एक अच्छे काम में, और कोई सडनली आपको जो है सर, तो मैंने इस कोरोना काल में ये सीखा कि अपने माइंड को ऐसे ऐसे कचरे से दूर रखने के लिए, अगर कभी कभी कुछ कचरे लिखने वालों को ब्लॉक करना पड़े तो ब्लॉक भी कर देना चाहिए। क्योंकि अगर आपने एक मंजिल अपने लिए सोची है, एक दिशा सोची है, तो उस दिशा पे आपको जाना है, आपको डिगना नहीं है। और वो ताकतें जो डिगाने की कोशिश करती है, तो जैसे हमारे यहाँ होता था ना, विश्वामित्र या फिर हमारे यहाँ ऋषि मुनि यज्ञ करते थे और उसके बाद उनको, उनके यज्ञ को करने के लिए राक्षस लोग आ जाते थे। तो मुझे लगता है इस तरह की राक्षसी प्रवृत्तियां अभी भी हैं। जब आप कुछ अच्छा करने निकलते हैं तो वो आपके 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 यज्ञ में, आपके हवन में बाधा डालने के लिए, लेकिन उनसे दूर रहना आपको सीखना पड़ेगा। ये भी एक कला है, लेकिन धीरे धीरे आ जाती है जब आपका मन साफ हो और आप कुछ करने के इरादे से निकले ना, तो इन सबको आप कर लेते हैं। तो अब मैं बहुत ज्यादा चिंता नहीं करता जो दिख रहा है एक माइंड, क्योंकि अपने को एक दिशा में आगे बढ़ना है और वो दिशा से हमको हटना नहीं चाहिए, ये बड़ा जरूरी।
तो छोटा सा आंसर एक चाहिए कि क्या आपको ऐसा भी लगता है कि अब ये राक्षसी प्रवृत्ति कुछ ज्यादा बढ़ गई है ट्विटर में?
देखिए, राक्षसी प्रवृत्तियां, उनकी भी अपनी ताकत है, राक्षसी प्रवृत्तियां बढ़ने की कोशिश करती हैं, लेकिन मुझे लगता है अंततः इनकी हार होती है। आप देखिए ना, महाभारत काल में भी पांडव तो 5 थे, कौरव 100 थे, उनके पास बहुत बड़ी सेना थी, लेकिन सत्य और धर्म किसके साथ था? वो पांडवों के साथ था, उनकी जीत हुई। इसी तरह से भगवान राम के पास तो सिर्फ वानर सेना थी, रावण की सेना का क्या मुकाबला करते हो? रावण के पास तो इतनी लंबी चौड़ी सेना और सोने की लंका सब कुछ था, लेकिन धर्म और सत्य जो है वो भगवान राम के साथ था, और इसलिए भगवान राम जो है रावण को परास्त कर पाए। तो मुझे लगता है कि राक्षसी प्रवृत्तियां बड़ी ताकत में होती हैं, बड़ी संख्या में होती हैं, लेकिन इनकी संख्या से डरने की जरूरत नहीं है, क्योंकि सत्य और धर्म आपके साथ है तो आपकी जीत जरूर है।
बहुत अच्छी बात है अशोक जी। दर्शन जी, आपको कैसे चैलेंज आए? कभी लगा कि
वैसे कोई चैलेंजेस तो नहीं आए थे सर, बट अभी कैसा है कि हम मतलब मैं पहले 2-3 ग्रुप में एज अ वॉलंटियर भी काम कर चुका हूँ, फिर मैंने जाके अपना फाउंडेशन शुरू किया है। सो कुछ चैलेंजेस आने वाले हैं, मतलब किसी को कुछ ऐसा लगता है कि काम हम कर रहे हैं, क्रेडिट कोई और ले रहा है, ऐसे सब चैलेंजेस आते थे, बट ठीक है, मतलब हम तो बस एक ही बिलीव करते हैं कि सर नेकी कर और दरिया में डाल। तो बहुत सारे हमारे कार्य हम ट्विटर पे डालते भी नहीं है, 85% वैसे ऑफलाइन काम भी रहते हैं जो हम लोग करते रहते हैं, मतलब तो कुछ चैलेंजेस आते हैं, बट ठीक है, उससे ज्यादा मतलब उससे सीख के हम आगे बढ़ते हैं वापस, और बस उसको चैलेंज नहीं लेते हैं और उसको छोड़ देते हैं साइड पे, उसके बारे में ज्यादा सोचते नहीं है।
तो तीसरी लहर शायद आ गई, तो उसके लिए मतलब तैयार हैं फिर से? आपको क्या लगता है?
बिल्कुल तैयार है सर, हम तीसरी लहर के लिए भी तैयार है, बट कैसा है कि
लोगों को ये भी कोशिश
मतलब 2 लहर जो भी आके गई है उससे गवर्नमेंट को कुछ ना कुछ सीख के कुछ इंफ्रास्ट्रक्चर, मेडिकल डेवलपमेंट ये सब करना चाहिए। अच्छी मेडिकल फैसिलिटी सबके लिए होनी चाहिए, ताकि मतलब हमें ज्यादा इंटरवेन ना करना पड़े। हम तो चाहते हैं कि गवर्नमेंट सब कुछ करे, बट कहीं ना कहीं एक डॉट्स कहीं पे मिसिंग होते हैं, लिंक मिसिंग होती है, तो वहां पे हम लोग सिर्फ गाइड करते हैं लोगों को कि इस तरह से आपको ये करना है।
नहीं, दैट इज ऑल्सो वेरी इंपॉर्टेंट। एवरीवन हैज द रिस्पॉन्सिबिलिटी टूवर्ड्स द कंट्री, मतलब और सोसाइटी जिसमें आप रहते हैं, कम्युनिटी में अगर सारे लोग अपनी अपनी कम्युनिटी को ठीक करने की कोशिश कर लें तो देश तो अपने आप ठीक हो जाएगा।
यस एब्सोल्युटली।
ये बहुत इंपॉर्टेंट है। थैंक यू सो मच, आप दोनों लोगों से जुड़कर बहुत अच्छा लगा। ये बहुत इंस्पिरेशनल पर्सनैलिटीज हैं आप दोनों। बहुत मतलब इतने सारे लोगों में आपने जो है, आपको एक मौका दिखाई दिया, देखना मौके को कि इसमें आप सेवा और सेवा के मौके को देखना, ये और भी बड़ी
बहुत जरूरी है। सेवा की भावना बहुत जरूरी है। मानवता सबसे बड़ा धर्म है, तो बस वो एक सोसाइटी को कुछ वापस देना, वो एक हमारा फर्ज है
जी। तो
ग्रेटिट्यूड आपको भी है। आप अगर ग्रेटिट्यूड ये वीक कर रहे हैं तो ग्रेटिट्यूड आपके लिए भी है, क्योंकि बहुत सारे लोग, चाहे दर्शन जी जैसे बैठे हैं या मेरे, बहुत सारे लोग हैं कि जो लोग काम कर रहे होते हैं समाज के लिए, उनको ज्यादा, क्योंकि वो लोग ऑलरेडी काम कर रहे हैं, उनको लगता है कि कोई बस हल्की सी पीठ थपथपा दे तो उनकी जो ताकत है, ऊर्जा है, वो बढ़ जाए। तो इसलिए आपके इस प्रयास को भी सब लोगों को आपने ये मंच दिया, बहुत बहुत शुक्रिया।
थैंक यू सो मच, थैंक यू। और अशोक जी, आपका जो आपने प्रयास शुरू किया उस पर मतलब ISW काउंसिल अगर किसी भी तरीके से हेल्प उसको कर सकेगी तो हम लोगों को बहुत खुशी होगी, क्योंकि आप जो एफर्ट कर रहे हैं वो हमारी उसी फिलॉसफी की तो एक बहुत बड़ा कदम है जो आप एक ले रहे हैं कि लोगों तक जो अनसर्व्ड हैं उन तक भी हेल्थ पहुंच सके। ये एक बहुत बड़ा काम है जो हमारे देश को करना बाकी है, और धीरे धीरे सरकारें तो करेंगी, लेकिन जैसा दर्शन जी ने कहा कि सरकारें जब तक करेंगी उसके पहले वो जो डॉट्स मिसिंग हैं, वो डॉट्स आप जैसे लोग उसको फिल करेंगे, या हम जैसे लोग जो है उस पर कुछ सेवा कर सकेंगे या सहयोग कर सकेंगे। इट विल बी अ ग्रेट पार्टनरशिप फॉर श्योर। तो थैंक यू सो मच। और हम लोगों ने आपके लिए एक सर्टिफिकेट बनाया है। सर्टिफिकेट बेसिकली दिस इज अ टोकन ऑफ एप्रिसिएशन फ्रॉम ISW काउंसिल, जो आपने कोविड-19 के टाइम पे लोगों की सेवा की, और हमारी उम्मीद है कि आप इसको और आगे और अच्छे ढंग से करते रहेंगे। तो हिमानी, कैन वी हैव दोस सर्टिफिकेट? Virtually we are giving, because maybe we'll get the opportunity to physically get do these things soon. हिमानी,
बिल्कुल बिल्कुल, अच्छे दिन भी आएंगे, मतलब ये दौर भी जाएगा और वापस फिर से जो है हम लोग फिजिकली मिल करके जो है एक साथ काम कर पाएंगे, वो दिन भी आएगा।
जी जी।
1 minute, sir.
इसके बाद हमारा जो इस ग्रेटिट्यूड वीक में अशोक जी और दर्शन जी, हम लोग डॉक्टर्स सुबह से बहुत सारे सेशंस के थ्रू हम लोग जो हेल्थ केयर की बहुत सारी पर्सनैलिटीज हैं उनको वो जुड़ती हैं, हम उनके साथ उनके करियर के बारे में समझते हैं, उनकी जो क्या व्हाट कीप्स देम ड्राइविंग। ऐसे बहुत सारे लोग, ऐसी स्टोरीज सुनने को मिली, जो मैंने बताया कि बहुत सारे जो ऐसे वॉलंटियर डॉक्टर थे जो दूसरों को फोन पे हेल्प कर रहे थे। तो उन्होंने मतलब सिर्फ हेल्थ के मामले में नहीं, बल्कि और आगे बढ़ करके किसी को, ऐसे लोग भी थे जिनको डॉक्टर का फोन दवा के लिए तो आता था, लेकिन किसी का फोन खाने के लिए नहीं आता था। उनके पास खाने की भी प्रॉब्लम थी, क्योंकि या तो कोई अकेला है, कोई सिंगल रह रहा है, कोई स्टूडेंट है। तो ऐसे बहुत सारे उसमें लोग जो है हेल्प कर रहे थे। ये एक हमारा टोकन ऑफ एप्रिसिएशन आपके लिए अशोक श्रीवास्तव जी।
थैंक यू।
गुड समैरिटन्स की तरीके आपने काम किया, और वी आर सो प्रिविलेज्ड टू रिकॉग्नाइज योर वर्क। थैंक यू सो मच।
थैंक यू।
थैंक यू सो मच।
दर्शन जी, आपका भी सर्टिफिकेट ये है, आपको मेल जो है टीम करेगी। तो आपने भी अपने एरिया में इतना अच्छा काम किया, और आप आगे और इसको बड़े लेवल पे करते रहें, इसी की उम्मीद के साथ आप दोनों का बहुत बहुत धन्यवाद।
थैंक यू सर,
थैंक यू,
धन्यवाद।
So next session will be on our appreciation from children artists, and it will be the harmony, the musical tribute for our healthcare warriors, corona warriors, will be hosted by my friend Rajiv. Rajiv, you are here?
Yes, Kamal, thank you.
Rajiv, please go ahead.
Yes, हिमानी,
You're live.
मेरी आवाज बहुत कम आ रही है।
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है। काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी। डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया। शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे, सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव पे। डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया। You are the real heroes, आपका शुक्रिया। Thank you.
Of second gratitude week 2021, and we having amazing experience by sharing a lot of things, a lot of gratitude about from many people, the doctors and the entire healthcare sector, even common people, for doctors who are working hard during this pandemic for the last 15 months non-stop, and they deserve this gratitude. We had an amazing day today talking about women's health and how women and infants, adults and girls taking care of their basic food and their struggle keeping healthy during this lockdown and COVID. And now to move on to our next Harmony musical tribute. This tribute is dedicated to all the doctors and frontline workers, because we understand that music is very important to heal, to deal with stress. And this time we have many musicians joining us, giving their gratitude to our doctors. Today in Harmony we have a four-piece band. The name is Anant Band, and I would like to introduce the lead singer, so who can introduce his group and the team member. This is a well-known band. They've been performing in a lot of live events and for quite a long time, daily based band and young band. So Ankit, I would request you to please introduce your colleagues, your friends, band members.
So I'll just start with the introduction. So we are Ananda Band, and we are a Delhi-based band. We are a four-piece band, starting with Anil in the center in the red T-shirt with a rhythm guitar. We have Rajat. He is playing as a lead guitar today, and my name is Pulkit, the vocalist of the band.
That's great. Your voice is a bit. I think you need to.
Right.
All right, so we can start with your performance.
Well, that was Failure Canal by Shakta Kamanatri. And let's move on to the next song which we have on our list today. One more song which I want to dedicate to all the health workers and especially to the motherhood. So just want to thank every mothers who are sending their child outside in these tough times to just take care of every person in this world, in this India and in the state, everything. So would like to thank for this song. So that was Myri by Palak Singh, a very beautiful band in program. Let's move on to the next song, which is also a modern song, and I just like this song because of its wordings and its meaning. So I think you will enjoy this song. Thank you.
सपने तू सोते जागते जो से सपने बूंदे सपने बूंदे कैसे मैं सकूं देख ना सकूं अनजाने रास्ते
That's a great performance, guys. Amazing. You guys. Great. What is?
I think that's most of this evening. If you allow 5 minutes, so we can just finish off with the last.
Okay. So you want to take time, or you just continue one more song?
I think we can end with one song.
I can't hear you properly.
Sorry, I didn't get you.
I can't hear you properly.
I think Rajiv, I am clear now. Hello, I am clear now, Rajiv.
Can you hear me?
Yes, I can hear you. Yes.
Okay. So will you continue with one more song?
Yes. One more.
Okay. Great. Thank you.
ਸਾਨੂੰ ਇੱਕ ਪਲ ਚੈਨ ਨਾ ਆਵੇ ਸਾਨੂੰ ਇੱਕ ਪਲ ਚੈਨ ਨਾ ਆਵੇ ਸਜਣਾ ਤੇਰੇ ਬਿਨਾ ਸਜਣਾ ਤੇਰੇ ਬਿਨਾ ਸਾਨੂੰ ਇੱਕ ਪਲ ਚੈਨ ਨਾ ਆਵੇ ਸਾਨੂੰ ਇੱਕ ਪਲ ਚੈਨ ਨਾ ਆਵੇ ਸਜਣਾ ਤੇਰੇ ਬਿਨਾ ਸਜਣਾ ਤੇਰੇ ਬਿਨਾ Well, thank you another band for you. Thank you very much. I think everyone has enjoyed this evening. And thank you IHW for giving us the opportunity consecutively 2 years. And thank you Latif.
So nice of you. It is amazing, Pulkit and Ankit, Anil, and forgot one more name, Rajat.
And Pulkit, yes.
Yeah, amazing performance, guys, and I wish you all the best. And I must thank you for taking time out of this, for this such a nice cause. And definitely, our audience and doctors, will enjoy this performance. It is great.
Thank you very much.
I also request you. We have also started a petition, on change.org. That is to build a memorial for all the doctors. At least we should start practicing, saying thank you to them for whatever they have done in the past and the kind of role they play in our life, saving life, and especially this during this COVID-19. So a memorial. So you guys should go tell your friends also to sign the petition. That will be really great help.
Sure, Raji, we will do, and just iterate this thing to our family and friends also, so that we can just sign this good cause. Thank you very much.
Lovely performance. Thank you very much, guys. Thanks.
Thank you. Bye bye.
So to continue the performance session of Harmony, we have some very nice performance, even messages by school kids. Today we have Indraprastha School, and they have sent some amazing messages for our doctors and healthcare workers. So I would request my team to play those messages.
Hello everyone, my name is Atish Bhardwaj. Today I am going to recite a poem on doctors. Thank you, doctors today. You made and saved my day. Thank you, doctors today. Yes, I know what to say. Thank you, doctors today. Attending patients every day. List of advice to convey. Vitamin zinc every day. Help us to fight corona away. All work and no play. Even working on Sundays. No parties and no buffets. Helping patients every way. Thank you for keeping corona away. Please accept my namaste. Thank you for services every day. Thank you, doctors today.
Good morning everyone. My name is Satyan Gupta of class 33. Today I am going to recite the poem on a corona warrior. So let's start. I have read somewhere that all superheroes do not wear capes. Oh, now I understood who they are. When the whole world is in pandemic phase, are policemen, sanitation workers, nurses and doctors doing their duties 24/7. They are not visiting their families for safety and protection. I believe their hard work will be paid and we will return to our happy days. I salute them with an gratitude and respect. Our warriors will definitely win and India will be free from COVID-19 phase. We see the real God in you. Happy Doctors Day. Thank you.
A very good morning to all. I am Piyush Singla. I study in 33. Today I am here to recite a poem. Thank you to our caregivers. Thank you to all of our caregivers. Your day and night became easier, but you didn't complain. You rolled up your sleeves and said, I'm here to help you. You smiled, you comforted, and pressed on under all the pressure. You continue to give your all and put patient first. You are our superheroes. You are our superheroes. Thank you for being a world-class caregivers today and every Good morning everyone. My name is Batra. I study in class 3D3. The title of my poem is Corona Warrior. I know there is fear. I know nobody comes near. I know people are ill. I know life is becoming still. I know there is a virus. But I thank the doctors with the white coat. They listen to our art and make us better with their art. I thank the nurses with the magic wand. They wipe our tears, and when they are here, everybody doesn't have any fear. I thank the policemen with the star. When they are on feet, everybody walks nicely on street. I thank the sweepers with the mask. They pick up the garbage with their hand and clean every bit of the land. I thank the vendors with a smile on their faces, and they fulfill our needs and make us feed. I salute to every Corona warrior and pray to God to remove this barrier. Thank you.
Hello everyone, myself Jonas Lal of class 4A3. Not all the soldiers carry guns to save the life of their country. Some carry stethoscopes. As the world has faced the pandemic situation, it has been our doctors, nurses, healthcare workers who have cemented their position as the foremost champions of humanity, saving humankind. I salute their courage, selflessness in serving society. No words are enough to express the gratitude towards the Corona warriors. All these Corona warriors who have risked their own lives to save the lives of others. It's unfortunate and great loss that so many of them lost their lives during this time. Our heroes, all Corona warriors, deserve high praise. They go so much beyond their call of duty to save lives and assure essential services. I give them a big salute. Jai Hind.
Good morning. My name is Kumari Navya Singh. Today I am going to give a speech on doctors. As the world faces the crisis of COVID-19, it has our doctors and healthcare workers who have served selflessly. We salute to their courage in serving society. No words is enough to express love towards them as they risk their own life to save others. It is unfortunate and great loss for us that so many of them lost their life during this time. As many as 646 doctors have died during this second wave of COVID-19, of which Delhi alone accounted for 109 deaths of doctors. Picture abhi baki hai and the show must go on were some of the last words of Dr. K.K. Agarwal, who lost his life due to COVID-19. He was recipient of Padam Shri. His videos are full of information about safety from COVID-19. The entire nation is thankful to the healthcare workers. Thank you.
मजबूर हुई जब दिल की दुआ तो हमने दवा से काम लिया वो नब्ज नहीं फिर थमने दी जिस नब्ज को हमने थाम लिया बीमार है वो जिस धर्म के है हमसे न कभी ये भेद हुआ सरहद में जो वर्दी खाकी थी अब उसका रंग सफेद हुआ तेरी मिट्टी में मिल जावा गुल बन के मैं खिल जावा इतनी सी है दिल की आरज़ू तेरे नदियों में बह जावा तेरे खेतों में लहरावा इतनी सी है दिल की आरज़ू.
Happy Doctor's Day. Good morning, my respected teacher and my dear friends. Today, I am going to recite a poem on Doctor's Day. Thank you for the help and support, for the compassion that you show, for taking the time and care for me, and this I know.
Thank you doesn't seem to be enough for all that you have seen me through. This world is a better place because of wonderful nurses and doctors like you. Thank you and have a nice day ahead.
Everyone, I'm Ahana Amla of class 5A2. Today I'm going to sing a song to show my heartfelt gratitude towards our doctors. So let's start. समर्पण को तेरे प्रणाम, समर्पण को तेरे प्रणाम, समर्पण को तेरे प्रणाम, समर्पण को तेरे प्रणाम। ममता का तू है दूजा नाम, समर्पण को तेरे प्रणाम। आपदा से ये रण तू है लड़ रहा, मौत का बढ़ रहा कारवां, तेरे हाथों से ही जग का आशीष है, तेरा जीवन तेरा ना रहा। इस पथ पर चले ना रुके ना डरे, विश्व तेरा ऋणी हो गया। सूरज की तरह तू अखंडित रहा, तेरा जीवन ही है प्रेरणा। समर्पण को तेरे प्रणाम, समर्पण को तेरे प्रणाम। हैप्पी डॉक्टर्स डे। धन्यवाद।
I, Ira Trivedi, is going to speak on doctor. D is for dynamic, O is for outstanding, C is for clever, T is for tidy, O is for observant, and R is for radiant. Here comes my doctor in many forms. They don't always wear a cap. A smile or a word or an action is sometimes all it takes. They help us without thinking, sometimes putting themselves at a risk. They could be a lifesaver, they could be a carer, they could look after our children or keep our country ticking. To me, my hero is my doctor uncle. A hero comes in a doctor. That is very true. Be happy, be safe. Happy Doctor's Day. Thank you.
To earn the title doctor is an honor. It is true fruition of a lifelong dream, achieved by just a few. For knowledge in and of itself is only just a part. The thing that makes you special is your kind and gentle heart. And when a doctor cares as much as you sincerely do, the world becomes a better place, no doubt because of you.
Hello friends, my name is Anya Garg. Today I become a doctor, one of the Corona warriors. Now I am going to recite a poem on all of us. From day and night, working hard to fight for others, they live, risking their own for a bliss. Months after months in the hospital, away from their close ones, they live a life captivated, working for others to survive. Let's be grateful for them, grateful for what they do. Thank them magnanimously venerate them with full empathy. Thank you.
Hi friends, I'm Ishita Verma from class 5th B3 and today I'm going to share a few important information and also thank doctors and healthcare professionals for their contribution. As we all know, there is COVID-19 everywhere. Doctors and healthcare professionals are risking their lives for us. They are risking their families' lives too. They are just like warriors fighting the COVID-19 out there. It's just like a war zone out there. And everybody is fighting from COVID-19. When every country is fighting from COVID-19, doctors are saving our lives. History will always remember doctors for their contribution. Thanks again to the doctors and healthcare professionals for their contribution. Thank you.
Today I, Harshika of class 5A1, on behalf of whole Indraprastha family, is going to pay tribute to Corona warriors or so-called saviors. Thank you so much for all your hard work and support during this difficult time. Dear brave healers, thank you so much for fighting against virus. You are risking your own life to save others, leaving your own families and having endlessly work. I really hope that this COVID would gone soon so that you all can rest. Not all heroes can wear a cap. I would pray that you all would reunited to your families. You all are true heroes for tomorrow's world. Now I want to recite some words for Corona warriors. कोरोना योद्धाओं को मेरा प्रणाम। कोरोना योद्धा कर रहे हैं ऐसा काम, कोरोना का हो रहा है काम तमाम। कोरोना के खिलाफ इस लड़ाई में पूरा देश कर रहा है इनको सलाम। पूरा देश मना रहा है इन पर पर्व, देशवासियों को हो रहा है इन पर गर्व। कोरोना योद्धाओं ने मन में ठाना है, कोरोना को हर हाल में हराना है। कोरोना योद्धाओं को हमारा प्रणाम, कोरोना योद्धाओं को हमारा सलाम। धन्यवाद।
Our heroes need to wear this dress all day long on this corona time. Let me tell you something about our heroes. What does it mean to be a hero? It's not those who live with ease or those who run away and hide. A hero is a person who encounters overwhelming adversity and stands tall under its weight. The person who has tried, tested, and often strained to breaking, yet rises stronger. The person who has battled and bled, instead of running away, they run towards. A hero say, I will, when others say nothing at all. They volunteer, they sacrifice, they inspire, they care. They are warriors, the heroes. And to them, we say thank you to all our Corona warriors.
Hello and good morning to one and all. I, Praveen Kaur from class 3rd B2 is presenting a small poem as a tribute to all the health workers for working 24/7 and saving lives. So, the title of my poem is Doctors, the Real Heroes. When was the last time you thanked those people? When was the last time you appreciated their efforts? When was the last time you realized that they too can get hurt? They are giving their all for you. They have been risking their lives too. They are busy saving lives. They have left their families behind and have not slept from long time. It is high time. We need to stand with them and support. Till when we will keep quiet to this black hole? Let's acknowledge and appreciate their efforts they are making. Thank you, doctors, for standing strong and facing the adversities. I thank all the doctors of all the countries. I salute all the health workers out there. Thank you for being for us all the time. Thank you.
Good morning everyone, I am Turi from class 3B2. Today I am going to speak a poem on our nurses. Nights so long they wear you down from room to room without a sound. Stands between life and death, returns that life with just a breath. Who makes the doctors look so grand, but it's hardly seen from where they stand. There's no seems to give or care. You can count on nurses, they are always there. You cared the sick and held many hands through the years. You laughed with some and with others you cried real tears. A nurse knows what complication each illness brings, but you did your duties like an angel without wings. Thank you to all the nurses of coronavirus pandemic. Thank you.
Hello everyone, I'm Vivan Malik from class 3B2 and I'm going to recite a poem on Doctor's Day. Not only doctor but a warrior, you dismantle every health barrier, and with stethoscope dressed in white, against all virus you are ready to fight. Life in the patient when in danger, role of yours is a game changer. Someone's husband, someone's wife, you save all these people's life. Facing situation difficult odd, no doubt you are next to God. I thank all the corona warriors for their selfless services and all the sacrifices they have made. Thank you. Happy Doctor's Day.
डॉक्टर भी बरसाएंगे, फिर भी उन्होंने अपने फर्ज से मुंह नहीं मोड़ा है। इतना कोसा है तुमने उनको, पर फिर भी उन्होंने तुम्हारी हिफाजत करना नहीं छोड़ा है। मैं घर पर हूँ, मुझे कोई डर नहीं। जो छपरी मौत की खबर कही, अभी आजादी में मैं महफूज नहीं। इसलिए घर ही है एक जगह सही, जरा उनकी सोचो जिन्होंने हमारे लिए अपना घर छोड़ा है। कुछ नाम ऐसे भी है जिन्होंने ड्यूटी पर दम तोड़ा है। मौत है हर खतरे में, फिर भी वो तुम्हारा कचरा उठाने आते हैं। दिल दहल जाता है उनके परिवार वालों का जब वो घर से बाहर जाते हैं। हम महफूज है, शुक्र बनाओ थोड़ा वक्त और, फिर दुनिया पूरी माफ होगी। फिर देना इनको इज्जत भरपूर, जब एक कातिल हवा साफ होगी। जब निष्पक्ष होकर सब जन सेवा में लग जाते हैं।
सलाम है उनको
जो इतना सब सहकर भी अपना फर्ज निभाते हैं। धन्यवाद।
Hello everyone, I am Dr. Anhad Singh Batra. I am a corona warrior. When doctors care, corona runs with scare. Doctors heal our pain so that we might gain. Thank you doctors for
for what you do and for just being you. Dear God, bless them all day long so they become super strong. I would like to thank all the Corona warriors and healthcare workers for taking care of us in this pandemic. Thank you.
While the world struggles to survive a pandemic, there are angels with golden wings called doctors flying all over as saviors and warriors. Let's salute these national heroes. Salute you, oh dear doctors. You help the patients like no another. Hello everyone. I, Hamish Kanchandani of class 4B3 is going to recite a poem dedicated to doctors. White coat is like moon in darkness. Your name is like hope in illness. You do your best to cure us. We can see how you care for us. Your life is filled with all sacrifice, yet you deal with us so nice. You love your work with all your heart. The science of body is made an art. I also want a healing hand like you. I need that beautiful mind like you. I want to serve my nation. I want to help the patients. Happy Doctor's Day. Thank you.
All the kids, such an amazing performance, so creative. You know, I don't have words for these kids. They are so amazing. Thank you for your performance. Thank you, Indraprasth School, for your contribution to this great cause. And we'll keep in touch with you for such lovely performances. And now to move on to our closing of the day, we have some very informative sessions tomorrow on the day 4 of Gratitude Week. We are talking about how we can save our youth from the non-communicable disease. We also talking about diabetes, especially when India is suffering from diabetes. India is the most populated country, and diabetes is the main concern. We have specialists coming and talking about diabetes and how during COVID we can take care of diabetes. We have a major problem for other diseases, especially stroke, and how these people who are suffering from stroke and they can go and take the treatment, how they can manage during this COVID pandemic when they don't feel like going to hospital and there's some problem with that. So tomorrow we'll be live again at 11 o'clock in the morning with the Gratitude Week. Till the time, bye-bye and have a very good evening and take care of yourself.